I can guarantee you the way it's applied is, having chatted with Wisconsin's department expert on retaliatory taxes, is they look at whichever tax is highest and they're going to tax the higher tax of either the state tax or whatever their home state domicile is taxing, regardless of whether or not any of the domestics, Wisconsin domestics would actually have to pay that. On the other hand, if you look at there's about 200-page NEIC guide on this. So if you want the details, you can certainly go through it line by line. But in other states, you will certainly not see them applied if there's no domestics. So I think functionally it means that there are going to be retaliatory taxes applied in some states, but not necessarily every state. And sometimes those retaliatory taxes will mean that those companies will be uncompetitive in those states for selling health insurance or other insurance lines.
And when we say taxes, that also includes assessments.
Yes, that's correct. And again, that varies state to state, and that varies assessment to assessment, and it varies. There can be variances based on credits and other things that happen. For example, we had in Wisconsin significant credits that attached to our premium taxes, and that meant for most of our domestics they paid zero in premium taxes. But that also meant that some states didn't reflect those credits, and so they had higher premium taxes in states. That also applies to agent fees, agent licensing fees. Pretty much every fee is subject potentially to retaliatory taxes. Yes.
Thank you. Senator Lesser, you're up.
Thank you, Madam Chair, and it's good to see you again, Mr. Whiskey. I think you were here most recently last year. Is that right?
Yes, sir. Thank you. Yes.
Okay. I won't belabor. We talked to some length about your record working for former Governor Scott Walker. I'm not going to go over that again this time, but I remember the discussion quite well. Just sort of building on Representative Wood's question, though, you're talking about retaliatory taxation. I have actually taken the time to spend some time going through the NAIC retaliatory tax guide that you referenced. Can you speak to whether or not, in your to your understanding of if an insurance user fee has been subject to retaliatory taxation? Connecticut currently has some, and as far as I know, they're not being subject to taxation in any state.
So an insurance user fee, I'm sorry.
Well, if you look at the language in the bill that's before the Connecticut General Assembly.
Okay, the insurance user fee. My understanding in talking to the Wisconsin folks and how it actually gets administered is that they believe that, I talked to them about this, and they felt that it would in fact be subject to their retaliatory taxes. Again, I can't tell you that that's going to be the case in every state. I can't tell you that it's going to be the case when push comes to shove. If Wisconsin takes a look at it, they may take another look at it. But functionally, it is subject, and it varies state to state. And so I think there's some doubt as to how it would apply.
So Connecticut has those assessments. I apologize. I just want to be brief, sort of in the interest of getting to some everyone on who wishes to testify. But Connecticut currently has user fees in effect. Is Wisconsin currently assessing retaliatory taxation on Connecticut domiciled insurers?
I'll have to double check that, but I believe my understanding is that they are. But I will double check and find that out.
And they are looking at our existing user fees like we have on the surcharge that everyone in Connecticut's familiar with on the for crumbling foundations. That's currently being charged.
So I'll have to check into the specifics, but it is a very specific insurance company by insurance company analysis. It is done almost exclusively by hand on each insurance company when they look at it. So when I talked, it was on generalities. We talked about various kinds of fees. The indication to me was that in the state of Wisconsin, if it moves and there is a fee attached to it, they were going to apply it to the state. And again, I would be willing to bet that you could probably get a list, maybe even a large list of states where, in fact, that fee would not be subject to retaliatory tax.
Well, the question that I have and the frustration that I have, and you probably can sense the frustration in my voice, and it's not directed at you individually, but it's that in conversations with industry, I hear a lot of generalities. And then when we talk, when we look for specifics, sometimes they're there and sometimes they're not there. And so as someone who's working in the industry, I would, and as a policymaker, I think would be helpful for the committee, if there is an issue. Obviously, we take very seriously our status as a domicile for many large industry players, but we need to hear concrete specifics, not generalities. And if there is a concern, I hope it's specific not to assessments in general, but to the specific wording of the legislation being considered by this committee.
Yeah, I understand where you're coming from. I will tell you, in my experience, we had a huge issue related to one of our domestics. Humana happened to be a domestic of Wisconsin, and had a huge issue from a retaliatory tax standpoint that we had no understanding how any other state could apply it as a retaliatory tax, right? And so it was a frustrating thing for us to even consider fixing. And it was, they had considered moving their domicile away from Wisconsin as a result. So understand your frustration. And
No,
they had experienced exactly the same issue.
But I don't think you may understand my frustration, but I don't hear you answering my question, which is that I think it's really, the language that's here was carefully crafted in collaboration with our partners in industry to try to address the retaliatory taxation issue. So I understand you're in Wisconsin and you're speaking in generalities, but if you're raising the specter that there may be additional retaliatory taxation issues that we're not aware of, I think that you owe it to this committee to be precise and to speak to the specific language in the bill. And if you're able to do that, that would be enormously helpful. But if not, I think that may be the case where you may be raising a specter that may not be present danger for us at this time.
I appreciate
that, Madam Chair. I want to thank you for the committee.
Yeah, thank you.
Representative Nuccio.
Good evening, sir. How are you?
Thank you.
Quick question for you. Can you give a little more detail around, you said one of my favorite words in your testimony, and that's transparency. So I was wondering if you can give a little more detail around some of the stuff that you've seen in other states, because I agree with you. I think we need to be extremely transparent when we are spending taxpayer dollars and how they're being utilized, especially in a time when everybody's being very conscious of how they're spending their money and what's coming at them. So can you give a little more background around the transparency that you've seen from other states in regards to insurance policies, the spend, and where any backstops may come from?
Mm-hmm. And are you talking, and apologize for clarifying, you're talking about private insurers versus public, or both?
Public, mainly public.
Mainly public, okay. So, my main experience obviously comes from Wisconsin. I sat on the group insurance board, which governs the state employee plan. Those meetings were public in nature. Every single one was a public meeting. There were public reports from the actuary that dealt with the two different pools that we administered, similar to Connecticut, the local government pool, as well as the state employee pool. We had an idea specifically what the loss ratio was on any plan, how it was running throughout the year, and the public knew that. They knew the specific numbers. They knew the numbers based on not only based on the specific in general terms, but the specific plan design, on the language. All that information was public. The bidding process for everything was a public bidding process. Some of the numbers, if there were competitive issues, could be redacted, but pieces of that had to be sort of public in their nature. And then on top of it, they were, and as I talked about, subject to public audits as a piece of it. And I will tell you, quite frankly, we had a very embarrassing mistake by one of our accountants in the Injured Patient Compensation Fund that we would have loved to have been able to hide. It wasn't a material issue. It was fixed almost immediately. It was a misreporting of a piece on a data, but we should have been, and we were publicly pilloried for that accountant's poor and shoddy work. And as a result, we had to have an additional layer of work until that individual actually left state employment. And we had additional levels of review. And it was a one-time mistake. But again, it subjected us to additional audits over the course of the year. So the state knew exactly what our loss ratio was inside that fund, how everything ran, the specific contracts, what they cost, the legislature had all those reports on a regular basis.
Thank you. And can you tell me, was that legislatively driven, that transparency and that impact?
Yeah, so it was primarily legislatively driven, although there were separate, inside the state audits that were required. But it was we had a separate bureau, the Legislative Audit Bureau, that reported every 3 years, again, on every state agency, every single program separate and outside of those state agencies. So each state agency was subject to a separate audit about what they were doing, how they were doing it, how the money was being spent. Yes.
Thank you very much. I'd like to go on record to say that I would absolutely welcome that kind of legislation. Thank you very much.
Thank you.
Thank you, JP.
Thank
Stay
you.
warm.
Thank you.
Lucy Nolan is up next, followed by Carleen Wonder.
Hello, good evening. Hello, can you hear me?
Yes, we can hear you, Carleen. We're gonna have you go next, so go ahead.
Okay, thank you. Good evening, Senator Lesser, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Carleen Wonder, and I'm a personal care attendant, a PCA. I currently live in New Haven, Connecticut, and I care for consumers in Ansonia and New Haven. I'm here today to testify in support of SB 842. I have been working as a PCA for 13 years and find fulfillment in my work. It makes me happy to see my consumers living comfortable lives and to know I have helped them to overcome their disabilities to pursue the luxuries others are able to enjoy. To give someone that opportunity to pursue their independence is truly an uplifting feeling for me. At the same time, I'm deeply saddened by the fact that because of the outrageous costs of health insurance, I'm often not afforded this same opportunity. As a PCA, I'm not offered health insurance through my employer. I was fortunate this past year because I was able to qualify for Husky. However, I took on 15 more hours a week in October and will now make too much to continue to access Husky plans. This has left me feeling stressed, fearful of even the smallest medical inconvenience. To make matters worse, I'm a diabetic and rely on insulin to survive. Even while I'm on Husky, my insulin is $400 a month, which is financially crippling for me. Occasionally, my pharmacist would give me a slight discount on my insulin to help me afford this life-saving medicine. On top of this, I have been forced to ration my insulin, taking less than the recommended dosage given by my doctor. While I know that it is dangerous, I have no choice. I simply cannot afford it. I have even looked into private insurance plans, as I know my Husky insurance will soon be gone. So through the health exchange, however, even the cheapest bronze plan, I was told by Access Health, was $795.16 monthly premium, which again, I cannot afford. If Connecticut had a public option, it would greatly reduce stress in my life. It is a burden when you're unable to afford the healthcare you need. People should not have to rely on the whims of others or the charity of their pharmacists to ensure they can afford the medicine they need to survive. The people of Connecticut deserve better. Please, I beseech you, I implore you to do the right thing and pass this bill. Please support SB 842. Thank you so much for your time.
Arlene, any questions from the committee? Senator Lesser.
Thank you. I want to thank you, Carlene, for your testimony. It's heartbreaking.
You're welcome.
A lot of the bill is specifically focused on people in very much in situations very much like yours, expanding access to Husky, and also making sure that the premiums on the exchange and the deductibles are affordable, and also that the exchange covers basic issues, things like insulin. Nobody should have to ration their insulin. It is outrageous that in the richest state, the richest country on earth, you're in that position. We passed a big law last year that's specifically supposed to help folks like you. Nobody should go without insulin. And so what I would hope that you could do is reach out to me after this hearing. I'd love to work with you to try to make sure that you get the medication that you need to stay alive, because that is not safe, and we want to make sure that you're in a safe place. But thank you for what you do, and please, I hope you can reach out to me, and love to help you after this hearing.
Thank you so much, Senator Lesser.
Carlene, thank you for coming today and sharing your story. Next up is Grace DeMayo, followed by Roberta Alves.
Good evening. My name is Grace DeMayo, Senator Lesser, Representative Wood, members of the committee. Thank you for hanging in there all day, and thank you for the opportunity to testify before you in support of Senate Bill 842. I'm speaking today in my role as Director of Advocacy at the Hispanic Health Council, and we believe that the Senate bill will make healthcare more equitable, dependable, and affordable by creating new public options for health insurance in the state. Senate Bill 842 would be especially helpful to organizations like the Hispanic Health Council. We're a statewide community-based organization, and our mission is to improve the health and social well-being of Latinos and other diverse communities. We do this largely through the work of community health workers, and community health workers are uniquely positioned to complement and enhance the capacity of the healthcare system through their being positioned in the community. They address social determinants of health, and therefore really address inequities in health experienced by low-income people and people of color in the state. One of those social determinants is access to affordable quality health care. Interestingly, much of the work done by our organization is done under contract from state agencies. Ironically, our agency has had increasing difficulty over recent decades due to escalating costs in providing those same community health workers with affordable healthcare coverage for them and their families. So it's actually a struggle within the organization to achieve our mission for our own staff, who are from the communities they work in, saving lives in the communities they work in across the state, thousands of lives annually, and multiply that by CBOs across the state. And we have a real problem of equity equity within CBOs in the state around the opportunities we have in addressing health equity for our own employees. Of course, the next layer of that, and you've heard lots of stories today, for the sake of time, I'll just reference that then we look at the folks that we actually serve, folks who are low income, vulnerable, inequitably challenged by the pandemic, but prior to that, by all those same social determinants that have made them sicker. And one of those inequities is inequitable access to health insurance. So when we think about the populations across the state that need a solution, we need a solution that is quality, comprehensive, and affordable. And Senate Bill 842 addresses those three elements and does it for the populations that are most at risk and most in situations like the prior speaker so painfully shared. We've heard many stories like that throughout the work of our agency. So given that, for the sake of time, I'll just summarize and say healthcare is a fundamental human right, one which should be assured through universal access to quality, affordable health insurance coverage. Given that, I strongly encourage you to please vote in favor of this bill. It'll do a great deal towards assuring equity to health and healthcare for so many in our state, and address a real problem that community-based organizations are experiencing. Thank you so much.
Grace, thank you for coming here today and waiting patiently. Do we have any questions from the committee? Great, thank you again for your testimony. Next up, we have Roberto Alves, followed by John Murphy.
Oh, thank you.
Hi, Roberto.
Well, Senator Lesser, Representative Wood, Senator Wong, Representative Patrick D'Amato, and members of Insurance and Real Estate Committee of the Connecticut General Assembly. My name is Roberto Alves. I'm a city councilman in Danbury, Connecticut, and I support SB 842. And I urge all the honorable members I have the privilege of addressing today to support it as well. SB 842 will make healthcare more equitable, dependable, and affordable by creating new public options for health insurance in our state. We're a year into this pandemic, and the ongoing health crisis is one that requires immediate and meaningful action to expand access to affordable and dependable healthcare. Make no mistake that access to healthcare is also an issue of race, and the inequalities in our healthcare system are impossible to ignore. Keep in mind that pre-pandemic, 6.8% of Black residents and 13.1% of our Latino populations were also uninsured pre-pandemic. This legislation will help address the disparities in our system and the racial inequities within it. Additionally, healthcare costs are an overwhelming burden on our small businesses, of which there are over 350,000 in the state, all of whom face their own challenges outside of and related to the pandemic. If we want them to get back on their feet, we need to create additional options for employers so they can provide more affordable healthcare for their employees. This bill will help level the playing field for small businesses, and at the same time strengthen our economy, in addition to keeping workers healthier and more productive as a result. Now, I want to share something a little bit more personal that wasn't part of the written testimony. And as I heard, and I've had this on throughout the day as I'm working and also being a teacher to my young children who have been in distance learning. I am a proud American. I'm a proud city councilman. I'm an even prouder husband and father. I am a recent US citizen. Got my citizenship in 2017. Before that, I was a permanent resident green card holder. But as a child, I wasn't documented. My family came into the US. I was 5 years old. Like so many who came, they came for a short period of time. They overstayed their visa. As children, you have no say in that. You just go to school. You see your parents work hard. You see your community work hard. You see them be scared of, where the money is coming from as they're going to the local grocery store, spending money in the community. Our undocumented community put in millions, billions of dollars into our economy every year. We need to help them too. When I was 16 and still undocumented, I had an injury. I was playing backyard football with friends and I ruptured my spleen. That was a serious injury. I was in the ICU for multiple days and then stepped down from ICU and then on bed rest at home for well over a month. I missed a significant amount of time of school. My parents shielded me from the financial side of it because I was a community-oriented person at that age. I served in the Danbury Police Explorers. I constantly volunteered. I was a translator for our neighborhood. So they didn't want me to worry about that. God knows what they did and how they figured out the community to help, pay for something as serious as a splenectomy, the surgery involved. I am happy to see that this bill, allows undocumented individuals to buy in and be a part of or qualify for health insurance. It's time our state steps up and does that. I urge you all on the committee to support this bill. We need to support ourselves. We need to support everybody in our community and our undocumented folks. They give so much. And sometimes we get in the national climate, and we don't get a lot of that in Connecticut, but there's some of it. People get, thrown to the side, or they're sometimes not respected. But what these folks are people who are here to work. They're our neighbors, they're our friends, they're your children's friends in school. and their kids grow up to be small business owners like my sister is, to be city councilmen like I am, to give back to their community.
You've hit your 3-minute mark. If you wouldn't mind just wrapping up.
I appreciate that. Sorry. That really is that. So thank you very much, everybody, for their time and the marathon you have been on today. I appreciate that.
And I want to apologize to all the speakers because I do have an alarm that I guess no one is hearing. So I hate to interrupt people, but I'm going to have to do that because we are letting people speak over the time limit. Roberta, I appreciate you coming and sharing your story. You are a councilman in New Britain, did you say?
Danbury, Connecticut.
Danbury. I was wondering, does your municipality buy into the partnership plan?
I'm not familiar with that, no.
Okay. Thank you. Any questions from the committee? Senator Anwar.
Thank you so much, Madam Chair. I just wanted to thank you, Councilman, for your testimony and sharing your story, because I think when people, the undocumented have been dehumanized in an organized manner by a certain group of people. And when you share your story, you humanize the people, you humanize their challenges, but also humanize the contribution and then the amount of tax. And arguably, some of the undocumented may be paying more taxes than some of the people in pretty high offices in the recent past. So I just wanted to thank you for your testimony.
Thank you very much, Senator. It's my pleasure.
Roberta, thanks for coming on today. Next up is John Murphy, followed by Joshua Mitchtom.
Good afternoon, Representative Wood, Senator Lesser, members of the committee. My name is John Murphy, and I'm here today to testify on behalf of the United Auto Workers.
John, can everyone hear John? Because I heard him and then it went. Okay, John, I could hear you when you first came on. It doesn't look like you're muted, but I'm having trouble hearing you. Maybe, do you have an earbud in or anything like that?
I do not. Maybe you should move on to another speaker and I'll try to rectify my audio issue.
Yeah, you're really very, very soft, and I don't think anyone can hear what you're saying.
Madam Chair, maybe we could let someone else go and go back to John when he has his audio fixed.
All right, John, we will come back to you after Joshua Mitchtom.
Hello.
Thank you, Representative Wood, Senator Lester, members of the committee. I am a Hartford City Councilman. I'm speaking in that role and also on behalf of Councilwoman Wildelise Bermudez, who's testifying to another committee at the same time. So we're trying to divide our duties. I did submit some written testimony, so I won't go over that. But I really want to emphasize a little bit kind of what Councilman Alves was saying from Danbury. You know, I've heard a lot of talk, which is frankly over my head, about the economics and the regulation of this. But at base, we are talking about people's lives. And in Hartford, certainly, you know, the median household income in Hartford is about $30,000. It's less than half of the state median household income. And the average for family coverage is $20,000. You're talking about a lot of folks who are working and trying to get by. And this is not even getting to folks like undocumented folks who can't buy in regardless. And there's just no way to get access. And that lack of access to healthcare radiates outward to a whole host of other problems, right? When parents have to get their care, let's say, from a free clinic or the emergency room, they have fewer options, they have more travel time. That's kids who are not making it to school on time, kids who are maybe more likely to get sick because their parents aren't treating their illnesses. Kids miss school, they fall behind in school. Classrooms have more disruption. I mean, this is something that affects both the economy of the community and the prospects of children and of whole families in our communities. And I think I just can't emphasize enough that if the question is that this is going to disrupt the insurance market or that it's going to cost us money, my feeling, fine. it's worth it. There should be almost no price too high to provide some stability to our most precarious families. And as a councilman, probably the most common constituent ask for assistance I get is helping people find specialists. I think it was Luis Luna from Working Families Party who talked about someone who couldn't find a surgeon. All the time I have clients who, I'm sorry, not clients, constituents, I'm a lawyer in the daytime. I have constituents who don't know what to do because they're kept from working and they're kept from providing for their families, and they just don't know what to do. And I see it also in my work with the undocumented community that I do outside of city council work. It is a constant stressor to families. It keeps people from working, from living a full life, and their dependents feel it. And it causes uncertainty for folks who have a tremendous amount of economic and legal uncertainty already. So I would just urge members of the committee to support Senate Bill 842, and really to keep in mind that if there is anything worth spending a lot of money on and worth disrupting the insurance market on and worth inconveniencing the competitive advantage of large insurance companies, if there's anything, it's this, because we're really talking about the well-being of our most precarious communities. So I'll leave it at that in case folks have questions.
Thank you, Councilman. Do we have any questions from the committee? Thank you for being patient and staying on with us for so long. We appreciate your
Thanks
testimony.
to all of you for your work.
Okay, John Murphy, do you want to give this a try again?
Can you hear me now?
Yes, we can.
Oh, great. Sorry about this. Good afternoon, Representative Wood, Senator Lesser, members of the committee. My name is John Murphy, and I'm here today to testify on behalf of United Auto Workers Region 9A and our Regional Director, Beverly Brakeman. We support Senate Bill 842, an act concerning health insurance and healthcare in Connecticut. Workers and families are losing their health coverage in great numbers due to the pandemic. Small businesses are struggling trying to offer healthcare that is too expensive to their employees. Expensive, high deductible plans make healthcare inaccessible to many, and racial disparities continue to have gone unaddressed, worsening longstanding inequities in our state. Connecticut needs to act boldly to curb the ongoing healthcare emergency. The constant struggle that every labor union faces at the bargaining table with their employers, how to provide quality, affordable healthcare benefits to their members, while also leaving enough money on the table to negotiate wages. Non-union workers face even greater costs, leaving many with high copays and high deductible plans. These types of plans do not provide dependable health care. Out-of-pocket costs can be prohibitive, causing many to forego routine medical care and having a negative effect on wellness, long-term health, and financial security. The pandemic has also shown the need for new options for workers who lose their jobs, since most workers access their health care through their employment. No one should have to worry about losing affordable health care access for themselves or their family, along with losing a job. Reducing healthcare expenses will expand the state's economy and ease the financial burden on families and small businesses. Expanding access and lowering costs also puts more money in the pockets of working families, which in turn is good for Connecticut's economy. It's really beyond time to put people before profit. Profits are rising for private insurance plans as millions of Americans line up at food banks and homeless shelters. We need to act now to help the people of the state by creating public options to address this urgent crisis of affordability and dependability in this pandemic and beyond. We urge the committee and Connecticut lawmakers to support SB 842 this session to expand high quality, dependable, and affordable health care by creating new public options for health insurance. Thank you.
Thank you, John. Are there questions from the committee? John, thank you for being here. Next up is Jay Siklick, followed by Gavin Karan.
Thank you, Representative Wood, Senator Lesser, members of the committee. I'm Jay Siklick. I'm an attorney with the Center for Children's Advocacy and the Deputy Director of the Center. The center is New England's largest civil rights legal organization dedicated to fighting for the civil and legal rights of Connecticut's most vulnerable children. In addition to my written testimony, I'm grateful to testify in support of Raise Bill 6389, an act concerning explanation of benefits. This is a critically important bill standing for an important principle: that all individuals who enjoy the privilege of being insured under a health insurance policy are entitled to the privacy when seeking such care that is sought confidentially, and in a manner that's consistent with the rights that are inherently imbued to all young adults and minors in this critically important healthcare arena. For many years, we at the center, along with advocates whom you've heard of earlier today, have been pushing for greater access to healthcare for those most at risk. We've been pushing for this act in order to start the process of ensuring confidential treatment in those most sensitive confidential areas, such as reproductive health care, HIV diagnosis and treatment, access to PrEP, which is prophylaxis medication for the prevention of HIV transmission, behavioral health, and substance abuse care and treatment. This bill does not extend or expand any existing rights. It merely allows those individuals who are entitled to confidential care to access that care without the fear of an explanation of benefits being sent to individuals against the wishes of someone who's entitled to that confidential care. Make no mistake, this is not a panacea for this issue. It does not affect the policyholder's right to view the status of their deductible, nor does it put the policyholder on the hook for copays that are incurred as a result of confidential care. But it's merely one step along the lines of increasing access to sensitive and confidential care. This bill, these protections are long overdue. It's time to continue this path towards increasing access to care, guaranteeing confidentiality, and ensuring that all eligible individuals in our state are empowered to seek assistance in those most sensitive situations, especially when care is so critically important at this particular point in time. Thank you again for giving me the opportunity to testify, and I appreciate the time.
Jay, thanks so much for coming today. Any questions from the committee? Thank you, Jay. Up next is Gavin Karan, followed by Gavin Guerrera. Gavin, can you unmute yourself?
Yes, hello. Good afternoon, esteemed members of the Insurance and Real Estate Committee in Connecticut General Assembly. My name is Gavin Karan. I'm a certified organic farmer urging strong support for SB 842 to create a public option in Connecticut. During the beginning of the pandemic, I lost my job along with my healthcare. We should never have tied insurance to employment. However, with COVID-19 pandemic and the downturn in our economy, that should be even more clear. I believe we're in urgent need for comprehensive universal healthcare, and this bill will be a significant step towards decommodifying healthcare, which is a human right. Thank you for your time.
Wow, that was the shortest one here.
It's gonna be quick. It's been like 5 hours on the wait, so I wanted to be really short. Any questions, I'm happy to answer.
No, we really appreciate it, and thank you for being a farmer and going into that field and sharing your story with us. Representative Dathan.
Thank you so much, Gavin, for your presentation and quick analysis there of what you went through. I'm sorry you had to go through that. It's really tough. So when you lost your job and were you offered COBRA through your former employer?
I was, but it was about $1,000 a month, which is out of my income level for healthcare. I mean,
that was my question. Did you compare the rate for COBRA to what the exchange had to offer?
Because it was February, I guess I was maybe not aware of the fact I could reapply. And then my new wife actually had healthcare, so I was able to get it through her. So I was covered for, under Husky for a short amount of time, and then I was able to get on health insurance. But I was really, afraid for a while because I wasn't sure, what to do. And it's not really clear based on, the laws, and like no one like shows up to your house, tells you, you can apply for health insurance. And this has been the first time I was, let off from a job with healthcare.
Okay, yeah, I'm sorry to hear that. Yeah, I know Cobra for many folks is super, super expensive. Through your job as a farmer, are you able to get any other subsidies for your insurance, or is it you just satisfied with your wife's coverage?
I do
Okay.
qualify for a subsidy, but it's
Okay.
still about like $200 a month for healthcare for the two of us,
Okay.
which is better
Well,
than 5 or 6, but it's still
Yeah.
fairly expensive.
Yeah, when you you're having a job that is really a labor of love, and I totally understand. So I appreciate what you're doing for our state, and thank you again for your time today. Have a good one.
Thank you.
Any other questions from the committee? Great, thank you, Gavin. Next up, we have a Gavin Guerrera, followed by Jonathan Gonzalez Cruz.
Hi, my name is Gavin Guerra. I'm from Weston, Connecticut. I'm an independent filmmaker and a member of the ever-growing group of what's known as the gig economy. I'm offering testimony in support of SB 842, in particular the public option. While my situation may not be unique, it is stressful and somewhat difficult to comprehend because I'm by no means poor. I make a decent living by reasonable human standards, and I'm the sole financial provider for my family, yet I find myself under constant financial strain, primarily due to the cost of meaningful health insurance. As a gig worker, one is an independent contractor and understands that your contract of employment lasts as long as the project you're on. And in the last one, I was very fortunate to have health coverage. That project ended at exactly the same time as the COVID lockdown started. Film production ground to a halt, and I've been taking advantage of COBRA to maintain coverage for my family at a cost of $2,500 a month or $30,000 a year. And that's just premiums. I am blessed with a beautiful 8-year-old non-speaking autistic daughter that suffers from a life-threatening but manageable affliction known as Crohn's disease. This illness needs to be closely monitored and treated with infusions and blood work on an ongoing basis. We are fortunate enough to live 50 miles from New York City, where one of the world's leading authorities on the disease has accepted my daughter as a patient. Not wanting to jeopardize her health care, but hoping to cut expenses, I started looking for replacement plans on the Connecticut Exchange, only to find that despite her proximity, her doctor would not be covered. Resigning myself to working within these restrictions, I started looking to see if the plans offered were at least cheaper than the $2,500 a month I am currently paying. It turns out that there really was no comparable plan, and that the plans offered carried high base premiums coupled with outlandish deductibles, out-of-pocket costs, co-insurance, and no guarantees that the treatments my daughter receives would be covered without a fight. At the end of the day, knowing that we will in fact use our insurance, in fact rely on it, these affordable plans on the exchange get right back to at least $30,000 very quickly. I don't have the luxury of just hoping that we don't get sick. My daughter is sick and will need a lifetime of care, her disability notwithstanding. As a single member LLC, I don't qualify for group rates, but I also don't qualify for much by way of subsidy. I'm truly falling through the cracks. To clean up an apt saying, garbage rolls downhill, and I can tell you it's getting pretty putrid near the bottom of this particular hill. However, I'm excited to see that this discussion is proceeding and that we might be able to set an example to the rest of the country. The time to act is now. We need a robust public option. But beyond all that, I mean, having sat through hours of testimony here, it's a little infuriating to listen to talk about actuarial tables and taxes and all that. I mean, these are people, you know, we have real people, and what's a tax, you know, kind of incentive in the face of that? I mean, there's nothing that was said today that really made me feel like we were taking the human cost as seriously as the business cost. And, you know, I really feel like, you know, until it affects you personally, it almost doesn't affect you personally. And we need to get out of the politics of me and into the politics of we, because, you know, we're all kind of in this together, and I really don't know how to navigate these waters, you know, as hard as I work and as much as I make, that I should still, you know, have to, you know, suffer or struggle. I'm not suffering, but I'm certainly struggling just seems outlandish to me. Like it just doesn't make any sense. So thank you for your time.
I want to just say thank you for coming on and sharing your story with us and waiting for so long, to do so. But it really means a lot to hear from you on this, and I appreciate you coming on here. Questions from the committee, Representative Dathan.
Thank you very much, and I really appreciate your testimony, Gavin. Just a quick question with your daughter with special needs. Is she eligible for Medicaid at all?
So she is for supportive services, but this really is more about her Crohn's disease than her autism. I mean, my wife is a stay-home mom and takes care of her very well. I mean, now during the COVID lockdowns, we are homeschooling her, or at least distance learning her, and all of her needs are met therapeutically and what have you. Mind you, no autism therapy is covered under insurance anyway, be it speech therapy, occupational therapy. The only coverage that is covered, only therapy that is covered is behavioral therapy, and that's a whole different discussion that we can have for a different time. But no providers really accept insurance anyway, and if you've been on the exchange and you've seen what out-of-network coverage looks like, you might as well just pay out of pocket, because it gets to be really expensive really fast. And there's like this weird thing that I noticed about paying people out of network, right? So if they charge you $100 an hour and the insurance company says, well, best practices is only $60 an hour, and we're only going to pay you 40% of $60 an hour, the other $40 of that 100 comes out of your pocket anyway, right? So it doesn't make sense. I actually crunched the numbers to see if it was even worth having insurance. Like, what if I just paid out of pocket, right? Would it come to $30,000 a year of coverage out of my pocket if I didn't have insurance at all? But then, of course, I'm over 50 now and I need insurance because, life doesn't get easier over 50. So, these costs are talk about American exceptionalism, right? Somehow we think we got it right here as the only country that doesn't provide this for their citizens. And I just don't get it. It doesn't seem right. Just fundamentally doesn't seem right. So thank you.
No, I get it, Gavin. I actually gave birth to 2 children under the NHS in the UK and gave birth to 1 child here in America. And seeing the bills that came across my desk for my daughter's birth, I was like, this was straightforward. I just couldn't even imagine how some folks do it. And the outcomes I had in the UK with my 2 children's birth was exceptional. And no, I'm not suggesting that a single payer is the right move. I actually not sure if it is the right move for our state. But what we do need to offer is an option for people to choose to buy something that might be less expensive. And with the open market and the open economy that we have, we need to have options. So I appreciate you spending the time today to tell us your story, and good luck to your family. Thank you.
Thank you. Thank you very much. I really hope this gets somewhere. Have a great day.
You too. Next up is Jonathan Gonzalez Cruz, followed by Michael Byrne.
May I just start?
You're on. Go ahead.
Okay. Hello, good evening, members of the Insurance and Real Estate Committee. Thank you for giving me the opportunity to share my story with you all. And before I share it, I actually want to bring up, my name is Jonathan. I recently graduated from the University of Connecticut with a master's in quantitative economics. And before I share my story, I wanted to bring up quick notes. Cigna in the third quarter of 2020 made a profit of $41 billion. And before that, they paid their CEO $19 million. United Health has revenue of $257 billion and pays their CEO $18 million. So I wanted to establish that first, because these are not small businesses. These are not mom and pop shops. These are billion-dollar industries who are spending $1 million to lobby against this bill, which will help working people. And so when I was a graduate assistant, I was fortunate enough to opt into the state employee plan, where a month for both medical and dental coverage, I would pay about $80. Once I graduated and was no longer a state employee, that increased to $400 for the same coverage, because now the state was no longer negotiating my prices on my behalf. So simply put, individuals, when they're buying private insurance, the insurance industry has the upper hand and they bring up those prices. I also want to share my story with when it comes to shopping for health coverage for my family, because we were undocumented. We can't buy into healthcare access because the ACA excluded us. In terms of Husky, we are also excluded from them. And so in turn, going to the private market was my only option. In truth, when I looked in there, it was going to cost more than $300 for me. It was going to cost about $1,000 for both my parents. And for my brothers, it would have been about $300. So that alone would have been $2,100 a month. That is not acceptable for any working family here and in the state. We cannot afford that. And I'm sorry if I'm coming off across emotional, because earlier today, Senator Huang said that maybe right now is not the time for this bill. And to be honest, I completely disagree with that, because during Christmas, my mom, who is uninsured and who has been struggling with lung issues, was bleeding from her nose around 10 o'clock at night. And we were so scared because we knew that if we went to the hospital without insurance, we might get a huge medical bill that will put us in medical debt for many years. In fact, medical debt is one of the biggest debt that people in this country experience. And so in turn, I urge every single one of you to please support this bill and to please stop defending billion-dollar insurance industry. Yes, we are the insurance capital of the world, but we should be the healthcare state of the world, where 100% of our residents have healthcare coverage. Please, I urge you, because my mom needs it, I need it, working families across the state need it. Please stop being persuaded by million-dollar lobbying that the insurance industry is doing. They will be fine. They have always been fine. They have billions of dollars. But you know who doesn't? I don't have billions of dollars. My neighbors don't have billions of dollars. And so in turn, I urge you to please pass this public option, because it will help people pay perhaps $80 a month versus about $400 a month for the same type of coverage, simply because they as an individual were not big enough to negotiate prices for the insurance.
Jonathan, thank you for coming and sharing your story. I do see how emotional you are, and it really means a lot to hear, how this has affected you and your family. And I appreciate you waiting and being patient and sharing that story with us. Do we have any questions from the committee or Sam? All right, thank you so much, Jonathan.
Thank
you. Michael Byrne is up, followed by Phyllis Frazier.
Hi, thank you. I don't know if you can see me on video. Yes. Hi, my name is Michael Byrne. I'm here today representing the United States Travel Insurance Association, otherwise known as USTIA. Thank you for the opportunity to provide comments on SB 89. So it's the travel insurance suicide exclusion bill discussed earlier, and really appreciate all the testimony throughout the day on Connecticut struggling with ways to provide healthcare to everybody. And these are obviously very personal and very sensitive stories, and appreciate hearing those from everybody. The USTIA's members include insurance carriers, third-party administrators, insurance agencies, and related businesses involved in the development, administration, and marketing of travel insurance and travel assistance products. First and foremost, most importantly, we are extremely sympathetic to the heartbreaking situation that we understand motivated the introduction of this legislation in prior sessions, and its reintroduction as SB 89 this year. I can't imagine the courage it takes for Ms. Brennan, who testified earlier, and I believe last year. I can't imagine the courage it takes for her to testify about her son and her experience with her travel insurance company. I signed back on just as she was finishing. And if you're listening, Ms. Brennan, still, I'm so very sorry for your and your family's loss. I'll refer the committee to my written testimony for background on the travel insurance industry and thoughts on the general issue of mandating provisions in private contracts in a competitive market for a discretionary product like travel insurance. Perhaps that's a broader public policy discussion for a later date. possibly in collaboration with the Connecticut Insurance Department. And I did hear the earlier comments about and am well aware of and sensitive to the public perception of the insurance industry, especially in challenging times like these. USTIA does not object to SB 89, subject to a modification that we believe addresses the various testimony before you, namely language clarifying that travel insurance will cover trip cancellation due to the suicide of an insured spouse, child, or other dependent. We also would like to incorporate into Connecticut law through SB 89 a framework to provide regulatory certainty with respect to the sale of travel insurance, including for transparency and disclosure of what a product does and does not cover. We would very much appreciate the opportunity to offer that language to Senator Slapp and the committee for consideration. Thank you again for allowing me the opportunity to talk with you today on behalf of the United States Travel Insurance Association. I'd be happy to answer any questions.
Michael, thank you for coming. I was wondering if your group had a discussion regarding AIG in this topic, if you had any feedback to the customers that are losing out on this. Like, was there any discussion as in, we would appreciate you resolving this offline or anything like that?
I have not had any discussions with AIG specifically. They are a member of the USTIA. I do believe that the policy at issue did contain language that expressly excluded any suicide, which applied to this particular case. That policy language was filed and approved with the department. But I also read the testimony and understand that Ms. Brennan obviously had a very terrible experience with her insurance carrier, and seems like, you know, at the very least, again, I don't know how it was handled, but at the very least, some condolence, sympathy, understanding, acknowledgement may have helped in this situation. But I'm not aware of specific discussions about how they may have handled this particular situation or others like it.
I mean, and how often does something like a suicide happen when it comes to travel insurance? I would assume it's extremely low, yet they made a point of putting their foot down and you know, not being very empathetic to the situation. So I was just wondering, how common is it?
I don't know. I like you, I can't imagine it's that common. I imagine it's very rare, and probably even, you know, more rare as you separate between the suicide of an insured, him or herself, and a family member of an insured. You know, I can understand, and I heard some comments earlier. Obviously, you know, people are pretty surprised about, or seem pretty surprised about how this was handled, and I can understand the general reaction as to why can't they just pay this, right? It doesn't happen that often. Can't you just be sympathetic? And again, I don't know about this specific situation. You know, I don't know how I would have handled it if I were that company. The contract language does not provide for it. Could they have paid it anyway? Yes, I think that happens in other cases. But then, you know, there's obviously others whose contract wouldn't cover other instances that wouldn't get paid. And not that this was the reason they didn't pay it, because I don't know the reason they didn't pay it, but there are rules, I think in Connecticut and probably every other state, against paying a claim that's not covered. Generally, you can't provide a benefit that's not provided under insurance policy. And I'm not suggesting that a company stand behind a law to not pay a claim in this situation. I think it was like, you know, $5,000. It's, you know, and you look at it and say, why can't they just pay under this situation? And again, I don't know. So I can understand the outrage, this disappointment, and surprise, but you know, that's all I can say, really.
Great. Any other questions from the committee? Great. Thank you, Michael, for coming today. Next up is Phyllis Frazier, followed by Betty Maracino. Phyllis, are you on? Phyllis, you can unmute
Yes, can you hear me?
Yes, we can hear you.
Okay, good evening, Senator Lasser, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Phyllis Frazier, and I live in Willimantic, Connecticut. I have worked as a direct support staff at Sunrise Northeast for 21 years. I am here today to testify in support of SB 842. As a direct support staff, I work with individuals with intellectual disabilities, helping them to learn new skills to improve the quality of their lives. It is incredibly rewarding to work with my individuals and to help them live normal lives. While of course this is my job, my individuals feel like family to me. One incredibly challenging aspect of working at Sunrise Northeast is it is outrageously expensive health insurance. The family plan offered by Sunrise, for instance, it's $5,200 a month. This is more than I make in a month. I've spent over 20 years of my life working for this company. I feel insulted, and this is what they offer my coworkers and I in terms of health insurance. While I don't make enough money to afford the plans offered by Sunrise, I make too much to be eligible for Husky. At 62 years old, I live in fear that something will happen and I will face a medical bill that sends me into financial crisis. Even small procedures are difficult to handle. I currently have a cavity that I cannot afford to address, and soon that cavity may become a root canal, which will only be more expensive to be taken care of. Thank God the vaccine and testing have been free, because if it wasn't, I would not be able to afford it. If Connecticut had a public option, it would take some weight off of my shoulders and allow me to breathe a little easier. I would know that if something happened to me, I would be taken care of. There are thousands of people out there just like me, people who earn too much and too little at the same time. Please do what is right by us as we do for the people we care for. Please support SB 842. Thank you for your time.
Thank you, Phyllis. Senator Lesser, questions.
Yes, thank you, Madam Chair, and thank you, fellas, for your testimony. Ms. Frazier, did I hear you right? You're a healthcare worker, and your employer offers you health insurance that's over 100% of your income. Is that right?
Yes, for
your health insurance is over 100% of your income.
For a family, yes.
Thank you.
Thank you.
Phyllis, thank you for coming today. Next up is Wendy Marcou, followed by Jordan D'Angelo.
All right, that's it. Yeah.
Diane, can you mute? Thank you. Okay. I thought I saw Betty Marafino. There she is. Betty, you are on mute. If you just want to unmute yourself, you can talk.
Good evening, Senator Lesser and Representative Woods, and thank you guys on the panel for sticking it out all these hours with us. I've learned a lot listening to this. I'm a resident of West Hartford, and I am president of the Connecticut Alliance for Retired Americans. And for our 50,000 plus members in Connecticut, 842 is our #1 priority this year. And listening today to everybody speaking, I'm struck by the human cost of the stories that we've heard. And I'd just like to share a couple of examples. Last year, I was invited by Representative Scanlon to serve on a committee that went to a number of towns to talk about healthcare. And at every one of those panel discussions, physicians would get up and talk about how very often they see patients who are sicker, and they're sicker because they put off going to the doctor because they just couldn't afford to pay for whatever they needed. We also heard from physicians who said that very often they would prescribe a medication, their patient would go to the pharmacy, and they get a call from the pharmacy, and the patient would say, "Do you know how much this costs? I just can't afford to pay for it. Is there something cheaper than I could get?" And that really puts people in a bind. A couple of years ago, we in the Connecticut Alliance for Retired Americans received a grant from the United Healthcare Foundation of Connecticut to go into the communities and collect healthcare stories. And what we heard from most people was the following phrase: I'm scared to death. I am so afraid that I am going to lose my health coverage, or when I go to the pharmacy, I won't be able to afford the medication. And nobody should be in that position of being scared to death. And just let me close on a personal note. My husband and I are retirees. We were community college professors for a number of years. And so now that we're retired, we have the state healthcare plan, which is a good plan, which everybody should have that kind of a plan, because the fear of will I be able to afford this is gone, and nobody should have to live with that fear. So thank you very much for listening.
Betty, thanks so much for sharing your story. Any questions from the committee? Thank you, Betty. Thanks for being patient. Jordan D'Angelo, followed by Joshua and Angela.
Hello, good evening, Senator Lesser, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Jordan D'Angelo, and I'm a personal care attendant, PCA, that lives and works in Winston, Connecticut, caring for my mom. I'm here to testify in support of SB 842. Caring for others has always been a part of my life. When I was a teenager, I cared for my grandmother when she had dementia. So when it became obvious that my mom needed someone to take care of her, I knew that she would benefit from a personal care attendant. So I stepped into that role. I enjoyed taking care of her, and I enjoyed taking care of my past patients as well. It makes me happy to know that I am able to allow her to live in her own home and do so comfortably. With that being said, it is also difficult caring for my mom. There's emotional tax to watching someone you love who is sick. And even though I'm only paid 40 hours a week, I am essentially working 24/7 to take care of her. Home care workers in our state are professional caregivers. The work we do allows people to receive critical care while remaining in their own homes. We don't just clean their homes or help them in and out of bed. We help them socialize and continue to do the things that they love. We care about our consumers. They are human beings and deserve to live normal lives. And it saddens me deeply that while we work so hard to provide a dignified life for our consumers, we are treated with utter disregard by the society we live in today. Unlike many people, health insurance is not afforded to me through my job. Furthermore, I make too much money to be eligible for Husky. At 27, I have not had health insurance in almost a decade. I have needed glasses since at least 2013, but I simply cannot afford them. When I was 23, I was unfortunate enough to have suffered a heart attack, and I was taken to the hospital by ambulance. The ambulance ride alone was over $1,000, and I'm still paying that off today. Additionally, the doctor at the hospital urged me to see a cardiologist, but I could not, and I still cannot, because I cannot afford it. Even routine preventative measures are out of the question for me. It has been so long since I've been to the dentist, I don't even remember when I had my last routine cleaning. If Connecticut had a public option, essential caregivers like me would be able to access healthcare instead of needlessly watching our bodies deteriorate. If Connecticut had a public option, it would mean that I could stay in Connecticut instead of moving to another state like Massachusetts, which I'm still looking into doing, unfortunately. If Connecticut had a public option, it would mean that I could access the care I need without triggering financial crisis for myself or my family. Please do the right thing and pass this bill. So that everyone in our state can have access to high quality and high value healthcare. Please support SB 842. Thank you everyone for your time.
Jordan, thank you so much. I really appreciate that. I know how hard it is to share your story, and I'm really glad you did today. Any questions from the committee for Jordan? Great, thank you, Jordan. Next up is Joshua DeAngelis, followed by Liz Gustafson. Liz Gustafson, I thought I saw your name on. Why don't you go ahead next?
Hi, everyone. Thank you for staying active and here and listening to all of this important testimony. Senator Lesser, Representative Wood, and distinguished members of the Insurance and Real Estate Committee. My name is Liz Gustafson, and I am the State Director of NARAL Pro-Choice Connecticut. I am testifying in strong support of HB 6389, an act concerning explanation of benefits. Although EOBs were created to increase transparency and protect consumers in the insurance claims process, this bill addresses a crucial barrier to accessing healthcare by ensuring that when multiple people are on the same insurance plan, confidential healthcare information is protected and not shared with anyone other than the patient. This bill also includes an accountability component of carriers, requiring them to act with a degree of urgency within a specified timeline when receiving an email or mailed request for suppression or redirection of an EOB. Those seeking any healthcare service should feel confident that this care will remain confidential for a variety of reasons. Disclosing any patient's private information negatively affects everyone, but particularly young adults who are insured through a parent's plan, minors who are exercising their right to access services, and adult spouses who are dependent on a partner's plan and may be in a controlling and/or abusive relationship. Individuals seeking care related to sexual and reproductive health, domestic violence, sexual assault, mental health, and other protected services may face the fear of their private medical information being disclosed to family members or are deterred from seeking those services altogether. Patients should not be stigmatized or punished for seeking healthcare, and instead should be empowered to make decisions with full freedom and autonomy. In 2018, the Patch Act was signed into law in Massachusetts with the same premise: to protect an individual's confidential and private healthcare decisions and to address deterrence faced by those seeking care in fear of others finding out. Connecticut enrollees should have the same protections from insurers, as confidence in knowing healthcare will remain private and confidential will have a profoundly positive impact on public health outcomes here in our state. I strongly support HB 6389, and I urge the committee and Connecticut lawmakers to vote favorably to protect the confidentiality of patients utilizing their private insurance plan. I also do want to note that we also submitted testimony in strong support of SB 842, as everyone deserves access to high quality, affordable health care, regardless of their race, gender, sexuality, zip code, immigration, or employment status. Thank you so much.
Thank you, Liz. Any questions from the committee? Liz, thanks so much for coming today. Diane,
thank you so much.
You're welcome. Diane Ariza, followed by Dr. Gregory Shangold. Dr. Greg.
I haven't.
I see Dr. Gregory Shangold, if you'd like to go next.
Sure, be happy to. Good evening, Representative Wood and other distinguished members of the committee. Good job staying in all day. Feels like one of my shifts. On behalf of the physicians and the physicians in training of the Connecticut State Medical Society, thank you for the opportunity to provide testimony on Raised Bill 842. For those who don't know me, I'm an emergency physician practicing in Connecticut for the past 18 years. Physicians will always support access to healthcare by creating affordable insurance options that work for both patients and providers. We really have an opportunity to be a pioneering state in this health insurance reform, similar to when we passed surprise billing legislation many years ahead of other states and in front of the federal government. But we must get this right. We do have several questions and concerns about 842, and it's our hope that we can collaboratively work on these questions and address our concerns through the legislative process. We must remember that access to insurance coverage does not necessarily lead to access to care. Both prongs of the bill 842, both the expansion of the state employee plan and expansion of health insurance, do not seem to address network adequacy standards. We do feel that some sort of standard needs to be implemented into the bill. An influx of new patients into the state employees network will stress the current physician network. In order to provide meaningful access to care, network adequacy standards must be promulgated to ensure a robust physician care network. So many times narrow networks have been used to drive down cost or not include fair payments to physicians. And this further is complicated about getting enough physicians to stay in our state. We train an enormous amount of residents, but for some reason, we retain very few of these residents compared to other states. So we also commend the committee for limiting the deductible to the IRS minimum. High deductible health plans have had negative consequences on both patients and the physician-patient relationship since they've been going higher and higher over the years. Numerous studies have shown the negative effects of high deductible health plans as much of the testimony today. As patients are responsible for more of the healthcare dollar, we see significant delays in accessing care that in the long run result in more expensive care and hospitalization. We strongly encourage that the recommendations of the work group convened by the Legislative Act 2 years ago now be included in and incorporated into Raise Bill 842. If I have time, there was also a question raised in earlier testimony about physicians not collecting the patient responsibility. And physicians often do not collect that patient responsibility. As an emergency physician, we only collect about half of the money that is allocated towards patients. And unlike some other entities, this is not a business expense or a tax write-off. It's just lost revenue. Additionally, many physician practices have to put more and more resources in to collect that patient responsibility. But many people are right where they forego care because of the monies that are owed.
Thank
So
you, Dr.
lastly,
Shangold. If you could just wrap it up in one sentence, open it up to questions.
So lastly, the concerns about the regulatory process, we'd like to be part of all the implementation, but we are concerned that so many things are just left to a regulatory process, which can be adequate now, but change with different administrations and over time. So we would like to see those concerns addressed in the legislation. Thank you again.
Mr. Wong. You're on mute, Senator Wong, even though it doesn't look like you are for some reason.
I am. Thank you, Madam Chair. Dr. Shangold, thank you very much for your testimony, and to all of your colleagues, thank you for your work on the front lines. It is greatly appreciated. Did you submit testimony?
Yes, we submitted testimony from the State Medical Society. It might be under the State Medical Society, not under my personal name.
Okay, I'll go look for that. Because I wanted to ask you to possibly repeat the original phrase you said. It isn't about, addressing the issue of network adequacy. Do you remember what you said that really piqued my interest? It isn't about the first part or the second part, it's about network adequacy.
Well, I think I started that statement by saying having insurance doesn't mean you have access to care. And if we have more and more people now that have this state insurance product, but there's not enough physicians to provide that are in that network that participate with that insurance product, then what you're going to have is longer waits, and those people won't truly be accessing care. So just having the insurance product on its own doesn't mean that you have access to care. There are areas where there's just not specialties as it is right now. And so network adequacy and things that promote doctors to want to join a network is going to be just as important as the discussions you're having now.
Absolutely. And I think that's an important part of the consideration. As a medical provider and being one of the important components of healthcare delivery, would you agree to the statement that most people don't fully understand the incredible cost of healthcare?
I do agree with that. I mean, many people, it's such a complicated thing. I know when I deal with my personal healthcare issues in my families, I have trouble navigating through the process, and I'm a managing partner in a private emergency group. I'm the president of the State Medical Society. I think I have the inside track, and it is a complicated part of the task force. Something we talked about on the health high deductible health plan task force, which was last year, was work by UConn's Dr. Victor Vilagro about literacy in healthcare, and that many people don't have the literacy. And one thing we talked about is trying to improve that literacy so that people do pick the right plan for them, to understand their plan and what co-insurance, co-pays, and deductible all means.
And I appreciate also your statement, and that's why I'm eager to get your testimony. I don't see it in our files, and if we could, I will definitely follow up with you to get it, where you said we need to reserve judgment and take a look at this current proposed legislation. And I appreciate that. And this is what the public hearing is all about, for the long day that we've had today already. But I appreciate your pause in recognizing that this is a step of a discussion, but it is not the panacea and the solution for the incredible myriad of challenges that we have. And my heart breaks for some of the stories that I'm listening to, and we all want to strive to get answers for that, but the solution is not always easy. And I said in the beginning of these public hearings that I've been reviewing and trying to understand this issue for over 35 years. The reality is, if people had the answers, we would have it already. So I want to thank you for being on the front lines again, and to all your colleagues for what you do during this COVID pandemic. And thank you. Thank you, Madam Chair.
You're welcome, Senator Wong. Senator Anwar.
Thank you, Madam Chair. Thank you, Dr. Schengold here. Thank you for your testimony. Now, have you heard in your leadership position from individual physicians and practices the challenges they are having with healthcare for their employees and for themselves?
Absolutely. So you've seen this trend over the past 5 years where many private practices, because of the business pressures, both on collecting from the insurance and also being a small business and running a business, have decided to sell their practices. And that's where we get some of the consolidation issues. So a lot of them have closed up, and COVID has only exacerbated that. There was a recent article that I think was covered in a lot of the media of these pressures of practices that have closed down because of COVID now, where they've had to invest in PPE and the lower volumes and many of these pressures. So certainly dealing with insurance companies and not having denials and having to spend time on the phone to get approval for necessary care. The amount of people that avoid essential care and non-essential care because of high deductibles, all of those pressures in the billing side have put enormous pressures on physicians. And I think the net result is you get less private physicians, and unfortunately that decreases access to high quality care.
So and this amongst the various reasons that we have in our state, but we are losing clinicians, physicians across the state because of a variety of reasons, but this aspect is one of them. Is that a fair understanding?
By this issue, I guess I want to make sure I say what this issue is.
In other words, we really have a disaster looming with the number of physicians in the community. They're decreasing significantly in the state of Connecticut. There are a number of reasons why doctors are leaving the state of Connecticut or retiring early, but one of them is that they are unable to afford the increasing cost of healthcare in their practices.
I think many physicians who run private practices feel it's their duty to have the best products that's out there, you know, and having some of the products, I can tell you, so I've been running our business for 13 years now, and the amount of cost that we put into healthcare has been going up and up and up. And as a small business who also is on the other end, my premium increases that we have to pay for our health insurance don't match the benefit increases that we get on the provider side. So we are lucky if we could get 1.5 to 3% increase per year on the provider side, but we're often talking about 5, 8, 10, 12% increases on the premium side. And so you can see as a business, that's a lot of stress. And some people have decided the answer is just to stop practicing.
Yeah, I think that's so important. I'm glad we were able to hear that, and I'm glad my colleagues would be able to hear this, because there's some people in our legislature who feel that the status quo is acceptable and everything is good. There are business organizations who claim that there is no problem, or there's not much of a problem on this end for the cost of healthcare in our state. So I'm glad we were able to take care of that part from at least your experience. I also wanted to clarify, what is the official position of the Connecticut State Medical Society around public option?
So I would say the official position can't be put into support or oppose. We support the idea. We think everyone should have access to insurance and access to high quality, safe healthcare. So whatever vehicles get us to that end, we support. We think this is a good start, but we do have some reservations as the bill is written. And we would like to work with people to amend that, but that network adequacy, and certainly I think Kevin Lembo said that right now they're going to be using the rates that are these commercial rates. And I don't want to get into Susan Halpin's all about cost shifting, which is also important. And I understand that from the insurance industry, but obviously the rates, if we got Medicaid, if this ultimately resulted in some sort of Medicaid or just Medicare, that would not be survivable. And if it resulted in more high deductible health plans, even though you negotiate a payment with an insurance company of a high rate, if that all goes to a deductible, which you can never collect, that can't be a solution either. So to use some of the information that came from the high deductible task force, I think is also important, where we're not exposed to all of that risk.
Right, and I think one thing is very clear in this, and I think Senator Lesser will weigh on this as well, and Kevin Lembo and others who have been working on this for quite some time. This is not a Medicaid expansion. This is not intended to be, and will be a Medicaid extension. That's very clear, and there's no cap that has been placed on the services that are going to be provided. So it's not a mechanism to try and restrict. We'll not be able to get the quality and the access if there is a restriction placed on the healthcare providers in the system. So that has been well understood and recognized, and that is not a part of the bill. So if that was not a part of the bill, would you feel more comfortable saying that, well, this looks like a solution? Because what's being saved, there's obviously the magic in this situation is that the public option is not paying $250 million to the top 5 employees. That's the saving right there, which are the ones who are lobbying and like crazy because they don't want to be in the marketplace to be able to compete when you have people making $50, $100, $60, $70, $80,000 in a plan, as opposed to $150 million, $50 million, and God knows what has been happening in the bigger insurance industry. That is where the saving is, and also the efficiency and the numbers and the healthy pool that we have had, relatively speaking, and also the targeted small businesses. So that is where the saving is, and the saving is not at the cost of the providers at all. And that's I think the brilliance of this plan. I think Senator Lesser can also allude to some of this in a second, but I truly appreciate your testimony, and thank you for all your good work, sir.
Thank you, Senator.
Senator Lesser.
Thank you.
Yes, thank you, Madam Chair, and it's very tough to follow my friend Senator Anwar, but thank you, Dr. Shangold, for your testimony. And I don't really have a question. I just wanted to appreciate that you've been just a wonderful person to work with on this project of making sure that everyone in the state gets affordable access to health insurance. And certainly I share your concern about network adequacy and want to work with you to make sure that the concerns that you articulated are really fleshed out in this bill, so that's something that the physicians and providers across Connecticut can really embrace. So I want to thank you for sharing those concerns, and I can commit from my end to working with you to make sure that we address each and every one.
Likewise, Senator, I've always enjoyed working with you, and I know how accessible you are and how passionate you are on the issue, so thank you.
Representative Nuccio.
Hi, Dr. Shangold. How are you?
Hi, Representative. Nice to see you again.
Nice to see you again. Thanks for hanging out for this long. So you brought up a couple things that I think are really interesting and worthy of pointing out. So you talked about the depth of network and the fact that we're losing physicians. And I was wondering if you could maybe comment about how that's affecting rates or the consolidation of physicians and how that's driving rates, because you then brought up something that I think is very key that needs to be focused on. If your negotiated rates are 1 to 3% a year and your cost of insurance is higher than that, your insurance is then contributing to the higher cost of insurance, higher cost of healthcare. So, this is again, the dog chasing the tail the whole time. And that's a point of interest, I think, that is worthy of delving into, even if just for 45 seconds more than we already have. So I was wondering if you could maybe just comment a little bit on those two things.
Just to be clear, you want me to comment on the network adequacy question and losing the physicians in the state?
That in relation to also how that is prompting consolidation, like of the big hospitals and physicians groups underneath, and how that's kind of contributing to the cost of healthcare.
Right. So I'll refer people to a survey done by Physician Foundation, which was over 3,000 physicians nationally, but the numbers correspond here in Connecticut as well, which has seen this trend of where in the past there were 75, 80% of physicians were in private practice. And now that number in Connecticut is down below 50%. I believe it's 46%. So the consolidation is happening where they're selling. And when you talk to individual physicians and you ask them why are they doing it, it's that combination of the pressures they get from insurance reimbursement and all of the problems with that, where they're just not getting the time and effort. And so they've become employees of other entities and looking for other things than just treating patients. But on top of just that consolidation, and I'm not involved with the negotiations from these big entities, but I can imagine, if you, when you negotiate, you obviously use leverage. So the more leverage you have, the more that negotiation can go one way or the other. So that's obviously there, but because of antitrust laws, I don't have access to any of these negotiations. And that's one of the things. I don't know what my colleagues make because we can't talk about those type of things. So as far as Connecticut goes, there's multiple things also. I haven't heard, and I honestly, I've been here for most of the day, but I've had to do some other work. So, but we haven't talked about the medical education or malpractice reform. And two of those are huge parts of cost of healthcare. And so a lot of that is being paid for and wrapped into this whole discussion. So if this wasn't complex enough, paying for defensive medicine and paying for the medical education process, just for example, someone graduates after 4 years of med school, they often have $500,000 of debt. So somewhere along the line, that person has to repay that debt. And then if you put on top of it the malpractice premium that you have to do and all of the testing that gets done to avoid large settlement suits, these are all individual costs that go into this as well. So other states have done things for both education and malpractice reform to attract doctors, if not just general reasons to come to a state. But Connecticut, when you look at any national survey, is it an attractive place to practice medicine? Many times is not in the top tiers of other states. And so I believe there's another bill, it might be in public health, that says, let's get a task force together to look at things to bring physicians to the state. But if you don't have a lot of physicians and they're getting squeezed in a certain way, then that all can decrease that network adequacy. And if a physician says, I can't take that rate, this is a take it or leave it contract, because they're the small fish in the pond and the insurance company is saying, take it or leave it, you won't have access to these patients. What is the doctor going to do? They either are coerced into taking it until they just can't take it anymore, and they roll up and they sell or they leave practice. And that's really what's been happening.
You mentioned a couple of very good points. My daughter is going for her doctorate in psychology, and when she's done in about a year and a half, she will have between $150,000 and $200,000 in student loans. So it's a very big cost to become a doctor or even a nurse at this point in time. So one of the things that I'm wondering, as a doctor, you have the ability to negotiate with multiple insurance companies if you so choose, correct?
Because I'm in a private group, yes, we negotiate with the individual insurance companies, and in emergency medicine, it's slightly different too, because there's federal law that dictates how we take care of patients as well. So there's a lot of complexity there.
Yeah, there's you can't turn anybody away. So
right.
That is definitely a federal regulation there. So
now we have surprise billing both on the state and on the federal to
right. If you're a
mitigate all
non-par
those
participator and everything else, if you're not disclosing, it's getting more and more complex. So you mentioned a concern about the negotiated rates, and I hear that time and time again. And one of my concerns and one of my questions for the comptroller was regarding the negotiated rates, knowing very well how Medicare and Medicaid are paid in the state of Connecticut, and then the balance of that off onto the insured people. So with this plan, I agree with you that there's a concern for negotiated rates. If the state is negotiating on their own and using their entire pool, you could see a lot of pressure downward on provider rates. So I definitely hear you with that. And I look forward to sitting down to try to come up with some sensible solutions to kind of corral the cost, and of course bring more providers back in, so we do have a depth of network, and there's diversity and variety in the doctors, in the plans that people will have. So thank you very much for your time. And on a side note, I just want to mention to Senator Lesser, when you had I'm not sure if it's a son or a daughter, but how cute. Thank you for putting a baby on after 8 hours of public hearing so far.
Here to provide entertainment where I can. Thank you.
You know, just hold them up. Is it a girl or a boy?
It's a boy. Yeah.
Hold them up just a little bit every now and then, just to show.
Wait, I
He'll
did
be making
ask
other
him if he had
cameos.
any questions. Dr. Schenkel, thank you for joining us. I don't see any other questions, but I really appreciate your time, and it was a great discussion, and I don't think you're going to see the last of us after this. So thank you.
My pleasure. Thank you, committee.
At this point, we're about halfway through our speaker list, so I did want to thank the committee for sticking it out and being so involved with all the questions and discussion. I think it's been great so far. Next up is Lisa Windham, followed by Mary Claire Whalen.
Thank you, Representative Wood, Senator Lesser, and members of the Insurance Real Estate Committee. I'm Lisa Windham, the Executive Director of the Connecticut Office of the National Alliance on Mental Illness. I'm here today in support of Senate Bill 842. I have submitted written testimony, so I'm going to try to be brief and share a story with you that backs up some of what is in my testimony. NAMI is the nation's largest mental health organization dedicated to building better lives for all people affected by mental health conditions. NAMI Connecticut and its 9 local affiliates provide support groups and education programs for people with mental health conditions and their loved ones, and advocate for policies to improve the lives of people affected by mental health conditions. I'm testifying here today both as the leader of this organization, which is committed to making sure expanding access to health insurance. It is part of our national and our state policy platform to make sure that people with mental health conditions get the best possible care. I'm also here as the head of a small nonprofit organization in Connecticut that is struggling to provide our team with quality healthcare. And I have been listening on and off today while doing an incredible amount of fundraising letters and getting those out into the world. And I heard my colleague Kathleen Flaherty talk about her own situation with healthcare with her organization. And we have the same issues at NAMI Connecticut. Although I've lived in Fairfield for over 20 years, up until October of 2019, I was employed by not-for-profit organizations in New York State. And I was employed by a small national organization in New York City and had wonderful, wonderful healthcare coverage. And when my position was eliminated in 2018, and I was talking to some of my friends who are small business owners or who have spouses who are small business owners, they were stunned that my COBRA premium for medical, dental, and vision was far less than their premiums here in Connecticut. And when I took my position as the executive director of NAMI Connecticut in October of 2019, I stayed on COBRA. And I stayed on COBRA because my COBRA premium for my spouse and I is less than what will come out of my pocket under NAMI's employer-provided health plan. It's really challenging in a small nonprofit with a mature staff. I won't call us old, but I will say we're mature. And with Connecticut's system of underwriting group insurance plans based on each participant's age, we suffer greatly because our staff is largely over 50. I also think this gives employers an incentive not to hire people over 50. We do cost more. We're worth it, but we cost more. And
So,
it's
can you just, you're at your 3-minute mark if you just want to wrap up with a few
so
sentences.
I just want to say that, you know, as an employer, this is so important to us to be able to provide our staff with quality, affordable healthcare, because right now our plans aren't good. They have high deductibles and they cost us a lot of money.
Thank you. Any questions from the committee? Representative Dathan.
Thank you very much, Madam Chairman, and thank you, Lisa, for your advocacy with NAMI. You all are a wonderful organization, and I'm so glad that you do so much for our community. I am not sure if you, thank you for your testimony on the 842 bill, but I actually had a question on the explanation of benefits bill. I don't know if you've been following that bill as well.
I have, we're a small team and we're limited in how much we can testify, but I heard my colleagues, I heard my former colleague Gretchen Raffa's testimony, and I support that, the position that Planned Parenthood and NARAL take. You know, we're concerned too about especially young people seeking mental health care. And, you know, there's already cap on how many visits they can seek without their parents' consent. And we know that we would rather see young people get mental health care than have their parents be involved in that care if they feel it's not safe.
That's it. That was what I was going to ask you. And I was going to ask, do you think that, you know, more people might be able to get help if they knew that the explanation of benefits wouldn't be going to a parent or a young adult? And do you think that that could help people with mental health issues in our state?
I absolutely do. I think it could help young people, and, you know, I think it could help people who don't want to share with their families that they're seeking mental health services. Mental health still carries a tremendous amount of shame and stigma. We're working every day to eliminate that, but it would help a lot of people.
Great. Well, that was all I wanted to ask. Thank you so much for your time.
Thank you, Representative Dathan.
Thanks for coming and being patient with us, Lisa.
Thank you.
Next up is Mary Whalen, followed by Wendy Marcou.
Wow, I cannot believe we made it to me. That's amazing. Good evening, Representative Wood, Senator Lesser, and members of the committee. My name is Mary Claire Whalen. I'm from New Haven, and I work on a small nonprofit farm in Woodbridge growing vegetables for my local community. I also work for the New Connecticut Farmer Alliance, which is a chapter of the National Young Farmer Coalition. I'm here to testify because I think that one of the best ways to support Connecticut farmers and farm workers and grow a resilient and thriving food system will be to pass Senate Bill 842. I submitted written testimony, but I'd like to add a few details. Farming is my passion. It's what I love to do. I've been doing it for 7 years, and it's also a public service. As of now, I'm able to access affordable healthcare through my mother as a dependent, which enables me to keep returning back year after year and learning more at the same small farm that I love. My greatest hope is to one day open my own farm in Connecticut, building on my years of experience in the industry. However, I do not believe that I will ever be able to take that risk to open my own farm without the assurance that I will have access to affordable health care. So I'm faced with the question, do I follow the lead of dozens of young Connecticut farmers and move? Do I go into a different career? And I know I'm not alone in this fear. In addition to my on-farm work, I'm the coordinator of the New Connecticut Farmer Alliance, a group of more than 400 farmers in the state. As of 2019, 42% of our members listed health insurance for farmers as their #1 policy priority. It was the most popular choice by far. So I'm saying more than land access, more than accessing new markets, more than increased training opportunities or mental health support for farmers, all of which are crucial issues, young farmers are worried about healthcare. We need to support young farmers and farm businesses who work hard and at razor-thin margins by giving farms access to the state healthcare plan as outlined earlier. The average age of a farmer in Connecticut is 59 years old, and we desperately need young farmers to step up to the plate. This is the only bill up for discussion this session that I believe might have some hope of making access to healthcare possible for beginning farmers. Crucially, I'd like to add that a strong local food system is a diverse one. Much of our food in Connecticut is grown by farmers and farm workers of color, including undocumented farm workers. We need to support them too through this plan, not just because it's the right thing to do, but because they hold years of experience and skilled labor, which makes our food system stronger and more resilient to shocks like COVID-19. As a farm worker myself, I know for a fact how much access to healthcare would encourage me to return back to the same farm instead of moving into another industry or taking my skills elsewhere. And finally, as you can imagine, farming is a very physically demanding job, and catastrophic coverage just will not cut it. If I hope to serve my community by growing local, healthy food for them, which is a healthcare issue in itself, I need to focus on preventative care and take care of my body now so that I can hopefully have a long career ahead of me. I hope the committee will consider how passing Senate Bill 842 will contribute to strengthening and enlivening the CT food system and how much this healthcare access is desperately needed by farm workers like myself, who have been on the front lines of community care during this pandemic, growing the food that we all need to live. Thanks.
Very clear. Thank you very much for sharing that testimony with us. And I'm just really proud to see so many young people in Connecticut that are going into farming, and the work that you do is benefiting all of us. So thank you. Any questions from the committee? All right, Mary Claire, thank you for coming. Next up is Wendy Marcou, followed by Ellen Andrews.
Hi, good afternoon, Senator Lesser and Representative Wood and members of the Insurance and Real Estate Committee. My name is Wendy Marcou, and I live in South Windsor, and I'm a direct support professional for whole life. I'm here today to testify in support of Bill of 842. Caring for people has always been a passion of mine as well. I first began working with children and eventually moved on to working with adults. Within my position at Whole Life, I care for people with mental and physical disabilities. I help them learn new skills that they can use every day with their everyday lives. Through this work, you develop bonds with the individuals you care for, and it's fulfilling, and you see that with them, and then with you help. While I enjoy this work I do with Whole Life, I feel disrespected whenever I attempt to utilize our health insurance plan. The monthly premiums are manageable, however, but the deductible is backbreaking. For individual plans, the deductible is $3,500, which means that unless I am in need of a serious procedure, I must pay out of pocket. Furthermore, I make too much money to qualify for Husky in the state. So unless I want to be uninsured, I am stuck with this plan. Working as a direct care support professional, I am tasked on a daily basis caring for others, but I live in a constant fear that sometimes some things will happen to me and I have no one to care for me. As for I do live alone. When you board a plane, you are told, in case of an emergency, that you're to take care of yourself first, correct? Before you take care of others. So how can we expect as professionals and as caregivers to continue serving communities when we do next to nothing to ensure to take care of themselves and ourselves? In Connecticut, we had public options. It would make a huge difference in people's lives, I think, if we would serve as a safety net for people. If we lost our jobs or we got hurt, it would serve as a real safety net for us. Please do the right thing and pass a bill so caregivers like me can continue to do our jobs with peace of mind and support what we need. Please support this bill 842, guys. We really need it.
Wendy, thank you for waiting and being patient. I hear an echo.
I'm sorry.
Oh, is that you on two things? Well, thank you. I just want to see any questions from the committee. Wendy, thanks so much for coming.
Thank you.
Ellen Andrews, very nice to see you. You're up.
Nice to see you too. Thanks. Yes, I'm Ellen Andrews from the Connecticut Health Policy Project. I want to thank you for this opportunity to share our thoughts on SB 842. I should clarify, I think we were listed as supporting the bill on our testimony, and we don't have an opinion. We don't support or oppose 842. There are parts of it we love and parts of it we have concerns with. We love restoring coverage for Husky parents. I've been doing this a long time. It's 21 years just at the Health Policy Project and years before that. 5 years ago, 11,000 Connecticut working parents lost coverage due to budget cuts. And, you know, some of the people who were cut were able to be brought back in other eligibility categories, but still 11,000 lost it forever. At the time, the administration framed the cut as a transition to coverage through Access Health CT. But because of tracking that the legislature insisted happened, DSS was able to show that virtually none, very, very small number, were able to buy insurance. And even of them, many had to drop it within a few months. It just isn't affordable for people at that level. So the transition never worked. We need to fix that. It's been 5 years and we need to bring those parents back. The impact of parent cuts on families is profound. If you think it doesn't affect kids, you're very wrong. We did a study. We followed 8 families who had lost coverage in a previous cut. And I'll just talk about one. Elizabeth was a substitute teacher in New Haven. She and her son, Sean, live in New Haven. They lost coverage. We were able to get Sean back on. That was a mistake, but we couldn't get Elizabeth back on. She had high blood pressure and had medications, which she could no longer. She had to choose between rent and her medications. She chose to pay for rent and she had a heart attack. After she was discharged from the hospital, she got better, but she now had a much longer list of medications. But she had Husky, thankfully, for 6 months because now she qualified, although she had to pay a spend down, which she had no idea how she was ever going to pay that. But after the 6 months, unfortunately, she again had to choose between rent and medications. She chose rent again, and she had a very serious heart attack. She was in the hospital for quite a while, and it was no doubt a very expensive stay, and the state paid that. So the state paid probably $80,000 in hospitalizations, but for $260 a month, keeping her on her medications. It was just, I mean, it was terrible for her heart. Now has been seriously damaged. Her son had to go live with relatives while she wasn't well. And it was just a stupid waste of money. So restoring Husky parents is the right thing to do for taxpayers and for families. So we love that part. We also love the part about subsidies because the exchange, as I said, is not, it just doesn't work for many people. and coverage for immigrants as well. I think the COVID pandemic has made it clear to us that somebody else's health is directly related to my health. And, you don't want to be, my sister lives in Toronto. She doesn't worry about the last person pressing the elevator button, whether they could go to see a doctor when they weren't well. And she doesn't worry about the people caring for her children.
Thank you. I'm sorry to interrupt, but you've hit the 3-minute mark. Do you want to sum up with a sentence or two?
Sure. We have concerns about the public option. I guess one point I would make is to be careful not to overpromise. As a nonprofit, we signed up for MeHIP, which was the first iteration of the through the Comptroller's Office of a public option, and we could afford it the first year. It was more expensive, but we did it because it was the right thing, but we could not afford it the next year. So be very careful. And my concerns are in my testimony, so I'll leave it there.
Thank you. And my question to you, Ellen, is that some of the concerns that I had seen you writing about regard the transparency issue, and I was wondering if you can talk a little bit about that.
Sure. Yeah, in Medicaid, I'll probably deny this, at the MAPOC meeting later this week, but we do know an awful lot about that program. And that is because of sustained advocacy by advocates as well as legislators. I used to staff the Medicaid Council, and we just required that they let us know. So we get monthly, I get very great deal of detail on how we're spending in that program by eligibility category, by what service level every month. And we don't have any information like that. We get quality information, which I think we're getting on Thursday or very soon, on HEDIS measures, an entire spreadsheet on how we're doing in terms of ED visits and getting people in for checkups and follow up after discharge, avoidable hospitalizations and ED visits. We get none of that from the state employee plan, and it's a very expensive plan. I'm sure people are getting care, but we don't know that much about it, and we don't. So if it doesn't work, I don't know how we'll know, to be honest.
Yeah, I did hear some things when you say it's a very expensive plan, like the cost that, say, a family of 4 in the partnership plan, that cost is almost double what the private sector is. I don't know, and I guess we don't know that because we haven't seen data that backs something like that up, correct?
We do have data actually on what the partnership costs are. I have them here somewhere, but it's over $1,000 a month just for somebody who's a single plan, and it goes up to, I believe, $1,800 a month, depending on which county you live in. And well, this was in 2019, according to HHS. Small businesses under 50 employees were spending a total employer and employee share for premiums about $7,600. So the state employee plan from the partnership is already going to have to come down about 40% to get to something that over half of small businesses can't even afford at $7,600, or they're not, it's 38 point something percent that are taking it up. So, I mean, I hope that it works. I really do. That's our reason for being at the Health Policy Project, is to get these kinds of things to work. I'm very concerned about the numbers, and we don't know enough to feel, I certainly don't know enough for the Connecticut Health Policy Project to feel confident about it. The other problem is that there's an opportunity cost. The more we wait on this, and I know that candidates have heard from people that they want some relief and they need it now. We've been working on this a long time, and we're ignoring the input costs, doing something about drugs, doing something about consolidation, which we heard a little about today. Those costs are out of control, and I rarely agree with Susan Halpin, but we both agree on that we have to work on the foundational costs, or we're just messing on the margins.
Thank you. Senator Wong.
Thank you, Madam Chair. And Ellen, thank you very much for sticking it out and I have always appreciated reading your material. You and your organization have a sensitivity and an awareness of the social responsibility and the social emotional dynamic of healthcare, and you back it up with using analytics. So it's a really unique compliment that I want to applaud you, and I really do enjoy reading your material, and I know we've communicated that way on that. But I also appreciate your approach in this, in the sense of using the analytics, but understanding there's a social consciousness side to it, and offering the thought and the caution to not overpromise. And I think that's one of the challenges is no one is opposed to the idea of increasing access, maintaining the quality, and reducing the foundational costs. No one. But I think one of the cautions we wanted to be able to do is to not overpromise, to not create a expectation that this is the panacea. Because indeed, as I said repeatedly, if we knew all the answers, we would have done it many years ago. So I want to extend how you have approached this and to thank you. And for you, one of the thoughts I had is, what are your thoughts on the 1332 exchange in being able to utilize the ACA exception and federal funding to be able to provide some degree of relief and not look to increase an assessment or a tax on insurers and within the plan and taxpayers?
Yeah, I share your concerns about a tax. You know, maybe I'm not as concerned as others are, because you know, it's true that Susan says how, you know, premiums went down this last year. I don't know about you, but none of the consumers I talked to have noticed that it went down. So I don't know how big a deal it is, but I still, just as an issue, I just as a concept, it doesn't make sense to me to tax premiums for some to make it less expensive for others, because every time you add a dollar, there's going to be somebody out there who can't afford that extra dollar, and you might be increasing the number of uninsured. And I think we should be looking to broaden the base of revenue for what we want to do. I want to thank you so much. I am going to bring this back to every one of my board members. Nobody's ever said they enjoy reading my stuff. That's really nice of you. Thank you.
Look, I absolutely do, because it is so well thought up from the context of the sensitivity and the social responsibility concept that is so essential, and everything that we have to do as legislators and policymakers. But also you back it up with the analytics and the analysis, and it's really I think it's a conscientious approach to solving many of the challenges that we have. So please do accept that and extend that to your board member. The other thing you also pointed out that I wanted to extend to the chairs, and a procedural, you're absolutely right. As you read through the plethora of public testimony that's categorized here, we only have two categories. You either support or you oppose. And you just made the offer that you neither oppose or support, and you wanted to be able to have thorough discussions and reservations. Perhaps we should, in our category, create a third category of saying question mark or maybe, because I think we just had the same issue occur with the Connecticut Medical Society. And as I was reading through, and I hope we'll get to be able to talk to the Connecticut Hospital Association, they're also cited on this as being supportive. And as I read through the testimony, it seems, and I'll look forward to talking to them, that they have some reservations about SB 842. So I would ask through the chairs and maybe procedurally that when we looked at public hearing testimony, that we create a third category for testimonies that raise this very important question and may be neutral in their approach to the proposed bill.
I didn't get a chance to answer your question though about, that's a great idea. On the 1332 waiver, they're still pretty new for states. I would, again, I think it's an exciting idea in the Affordable Care Act. It's very broad, and you gotta love stuff like that when the feds give you room to dream. But I think some states that have not been able to use it the way they wanted to, maybe overreached in terms of how, universal healthcare and things like that. So I look forward to seeing what comes out of that. I hope it is an open, transparent process. I'm very concerned about it going through the Office of Healthcare Strategy, which has not been in SIM or in their latest cost cap program, have not been open and transparent and have not engaged voices that didn't say what they wanted to hear, basically. And that troubles me.
Well, transparency should be an absolute priority in this in regards to looking at the fiscal viability of any plan. The second area in regards to cost containment that you cited in your testimony is prescription drug cost containment. You're absolutely right. It is an escalating cost. And I know for us in the Senate Republicans and House Republicans, we looked at maintaining or being able to contain prescription drug costs. Can you elaborate a little bit of your suggestions?
Sure. One suggestion that I liked, especially when we thought we didn't have any money in the budget, now we have a little bit, so I might have other ideas now, that is to, states are looking at this. Hawaii, Washington, and Massachusetts so far are looking at a tax on unjustified price increases. When a company takes a drug that's been around, it's not new, they've already recouped their R&D, and they just increase the price because they can, the states are looking at taxing that increase at 80%. And I think it's a great idea. It should get around the legal challenges that have stopped some other states with some of the other kinds of, drug review boards and some other things that they've tried to do, setting prices, that kind of thing. We're not setting a price, we're just going to tax it if you make it too high. And I'm not a lawyer, but that's apparently can survive a challenge.
Thank you. And the third area that we are advocating from a cost savings perspective is utilizing benchmarking. I know Massachusetts have utilized benchmarking to be able to contain and measure about across the board and equitable sources in having good data and measure, which I applauded your organization with doing. Do you think benchmarking is a critical element for us to begin the process of cost containment?
Yeah, I'm of two minds. I always like more data. One of my former bosses said, "Oh, Ellen's eyes are glowing. She must have gotten a new database." But unfortunately, Massachusetts' benchmarking cost cap has not worked as well as they had hoped. It's good that they know where the problems are, but it has not made coverage affordable. There's serious questions about whether it's really, and whenever you say you save money, it's always a comparison to an assumption about what it would have been. So it's not clear that they saved money. So a report in and of itself doesn't do anything. It's what we do with it.
Well put, Ellen. I don't think Massachusetts is the only one that's prone to using reports and numbers to support our theories and hypothesis. That being said, but it is a good start, and it gives us barometers where if we're truly transparent and we use data to really focus on the issue at hand, which is reducing healthcare costs and increasing access, I believe you'd be interested in the proposal that we will have deliberations and a public hearing on, because we've been working on it for a couple of years, and I would really welcome you and your organization's input, because our goal is the same as everybody else's that testify here, to be able to provide quality and accessible and affordable healthcare and containing the skyrocketing cost of healthcare insurance. So Ellen, I want to thank you very, very much, and I'm sure we'll be talking some more. So thank you, Madam Chair.
Thank you. Thanks.
Thank you, Representative Nuccio.
Good evening, Ms. Andrews. How are you?
I'm good. How are you?
Hanging in there. So you mentioned a couple of things that I was going to see if you could elaborate a little bit on. You've got some valuable insight into the last time the state really kind of tried something like this with the MEHIP plan. And I was wondering if you could give us a little historical context on that. And the second piece around that is when you decided to leave the MEHIP plan, were there any punitive, oh Lord, I can't even talk now, it's been so long, any punitive fines for leaving? And with this new plan, there are definitely, there's wording in there that there will be a penalization if you do try to leave the plan that's on the table right now. And I expect that that's going to have a pretty big infrastructure cost for anybody who decides to no longer participate. So I was hoping maybe you could start off by just giving us a little bit of history of the MEHIP plan and the occurrences of that.
Yeah, I honestly don't. I actually looked at back at my notes and I don't remember. It was, 10 years, 12 years ago. And I don't have a lot on it. And I know that they made changes to the plan after that, but it still didn't work extremely well. And then they created the partnership plan, and that had changes that, I knew for the test. I don't recall those. And then there's a partnership 2.0. So it's been through a lot of iterations. But no, it was just a year, like most plans, and there was no fee when we left, thankfully.
So I applaud the state for constantly trying to innovate a plan that didn't work and make a new plan and such. But this one would obviously be for the 3 years for some and 1 year for another. But I do think the infrastructure cost of leaving would be a little undue on the side of the person who's trying to leave. Now, you had mentioned the prescription cost, and I'd like to just point out that the prescription cost is the highest dollar spend for every $1 spent in healthcare. And the ICER legislation that you're talking about, I'd be very interested to see this committee take that and look at that, because one of the things that I think, again, contributes to the actual high cost of health insurance and health care is the predatory practice of you take a drug like insulin that cost a penny to make and you charge hundreds of dollars for it. And then subsequently, when we pass legislation that attacks the one piece that we want it to, which is the cost share, it doesn't necessarily do anything with the actual cost of that drug. And to me, it's not always popular to say, but I do see that as like predatory billing. It is a needed prescription. It is a life-changing prescription, but the fact that I understand the need for research dollars, but to me, to target that certain kind of medicine that is a life-requiring medicine and then mark it up so high to be able to support other initiatives, to me, is something that I think we could take a look at and look at that ICER concept to see if there's something we could do there to implement some legislation to lower that cost. And I think that's about all that I had. I thought I had another question for you, but I'm down to scribbling on like little bits of white pieces of paper now.
My phone number.
Yes, thank you very much for coming. And as I said, I think this committee could definitely benefit from seeing the ICER legislation.
Sure, great.
Thank you, Senator Lesser.
Yeah, thank you, Madam Chair. Thank you, Ellen. It's good to see you. I have just a couple of questions. First, I wanted to follow up on some of the Senator Wong's questioning earlier with regard to 1332 waiver. Specifically, the proposal that he referenced would put Connecticut in the trajectory towards requesting or implementing a reinsurance program. As I'm sure you understand, reinsurance will have the effect of lowering premiums on the exchange, but that is not necessarily the same as lowering costs for people on the exchange. And for folks who are receiving subsidized coverage under the exchange, lower premiums paradoxically could result in higher costs in some cases. Is that your understanding too?
Yeah, reinsurance is, if the state wants to spend money to even out and lower premiums, I'm not going to disagree. I think there are more efficient ways to do it, because every time you give a subsidy to, pass it through somebody else, you're going to lose some money. So I would prefer to see it more efficiently in subsidies. Then you can target it directly to the families who need it. And reinsurance also troubles me just from an economic perspective, and I'm not an economist. My training was in a real science, a proper science. But I concern about reinsurance. Say the attachment point is $100,000, that everyone over $100,000, say a frequent flyer in the emergency room, insurers would have no incentive anymore to try and get that person the services that they need, get them some care management, get them some housing, whatever they need to solve that problem. So I'm worried that it would actually to some extent, make things worse. So I'm not a big fan of reinsurance, but if you want to put money into making subsidies for people, I'd be all over that.
Thank you. So I appreciate that clarification, because when you expressed enthusiasm earlier for the 1332 waiver process, I want to make sure that folks didn't misunderstand what you were saying. And
yeah, I wouldn't have called it enthusiasm. Yeah.
With regard to your concerns about the public option, it sort of reminds me of an old joke. The food there is terrible, and the portions are so small. You know, I'm a little confused, because I understand that the MEHIP program did not work, but given that there is very little, if any, fiscal note for the idea of underwriting, you know, small group nonprofit insurance, if it is in fact unaffordable, so what?
Well, I think the issue of overpromising, I think there are opportunity costs. It is, you know, if we could work on the foundational issues like consolidation and drugs at the same time, that would, you'd have a point. But if we, and Connecticut doesn't tend to do more than one thing at a time, I'm worried that—
With respect, Ellen, I don't think that's accurate. We've raised other titles in this committee, including health prescription drug reform bills. And I noted with interest Representative Nuccio's comments just a minute ago about the ICER legislation. That's something that this committee is looking at. I just don't think that this bill is intending to be an act concerning everything in the world of healthcare.
Well, glad to hear that. That's good. That's really good.
Okay. So the concern is not that you think it's necessarily bad policy or a bad thing to do, just that it may not be the thing that you would focus on if you were chair of this committee or member of this committee. Right.
And I think there's, you know, talking to other nonprofits and to people, I think that it would be good to get expectations to a level that people weren't thinking this was going to solve everything. And there have been people that are really desperate who think this is going to solve everything for them. And I hope it will. But just in case, I think we should be looking at other things as well.
And so just to be clear, you support the expansion of Husky A. Do you support the additional subsidies for the exchange plans?
Absolutely, yes.
Do you support the expansion of the MedConnect Medicaid buy-in program?
Yeah, I actually spoke to some people at Legal Aid about this, and we had some questions about it, whether it was it the way it was written, it wasn't clear whether that was through the traditional Medicaid program or whether that would be through Access Health and using Medicaid funds in sort of a premium assistance way. That would worry me more, especially for people with disabilities. That Medicaid is built for them. It's comprehensive coverage and has a really good panel to handle people with all the needs for people with, you know, serious illness and disabilities. So I think it would be better to keep it within the Medicaid program. That would be my only caveat.
Yes, it would be within the Medicaid program.
Great. Yes, put that on my yes list.
Great, thank you very much.
Sure.
Ellen, thanks so much for joining us and sticking with us tonight. We appreciate it.
Thank
Next
you.
up is Holly Hackett, followed by Thomas Burr. I don't see Holly. Is Thomas on?
I'm here.
Thomas, you're up.
Wonderful. Thank you so much. Good evening, Senator Lesser, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Thomas Burr. I'm the Community and Affiliate Relations Manager at the Connecticut State Office of the National Alliance on Mental Illness. NAMI Connecticut is in support of Senate Bills 842, an act concerning health insurance and health care in Connecticut. And for the record, Ellen Andrews is a tough act to follow. A few minutes ago, you heard from Lisa Windham, our executive director, and you have my written testimony. So I will simply speak on behalf of myself and add that I am speaking as someone who currently works for a nonprofit corporation. However, prior to that, I worked in the high-tech industry as an engineer for over 20 years. As someone who has been a health insurance consumer for over 40 years, I am struck by how many things, cars, cell phones, TVs, have all gotten so much better, faster, and more feature-rich, while healthcare has gotten more and more unaffordable and problematic over this very same time frame. We here at NAMI Connecticut field calls constantly from people who need help getting the healthcare they have paid for from insurance companies who seem to just want to deny, and deny again in paying for the critical and necessary mental health care for themselves and their loved ones. At this point, like Minister Josh Pahalik, who spoke earlier today, I am simply beyond frustrated with the health insurance industry. They come to these hearings saying things like they want to be part of the solution, when from my perspective, they are just a big part of the problem. For example, it took us 5 years just to get a mental health parity reporting bill passed back in 2019. And that was, in my opinion, only because of the embarrassment from the landmark Witt versus UBH decision in California. Again, an insurance company just being a huge roadblock to good, effective healthcare. In summary, all I can say is that I'm done. The healthcare system is bloated, corrupt, and unsustainable. It provides little or no value to too many people. Bring on the public option. It can't possibly be any worse than what we have now. So please pass SB 842. Thank you. And now I'd be happy to answer any questions you might have.
Hey, Thomas, thanks for staying with us all night. We really appreciate it. Thanks for your testimony. Do we have any questions from the committee? Thanks, Thomas.
All right, I'd just like to add, Senator Wang, yes, we do need a third choice as far as testimony, as opposed to opposed or for, because the marijuana bill's coming up and we're not going to be for or against it, but we want to weigh in.
Thank you, Thomas. Next up is Alan Shakata, followed by John Lazaru. Alan, you're up. You're muted, Alan. Just unmute yourself. Thomas, you are not. You need to mute yourself.
How's that?
Good, we can hear you.
They can't see you.
Okay.
Ah, well, actually, if you could hear me, that's not the end of the world.
Yeah, go ahead.
Okay. Well, I have a little different perspective. I am actually in the insurance business. I've been the principal owner of my own agency, MacMan Insurance Associates, for almost 25 years in May. I've been in the insurance business for about 31 years. I do sit on the advisory board of most of the carriers here in Connecticut. And we as an agency service thousands of individuals, hundreds of small groups, and almost 1,000 Medicare agents as well, Medicare clients. Without directly stating it, this bill appears in the short time that we really had a chance to read it, to be leading us down this path to single payer healthcare, which it is a little ambiguous the way it's worded, and health insurance is anything but ambiguous. So among some of my concerns that I would like to just bring up, and I've heard over 8.5 hours, quite a few concerns from both sides. And I will say right up front, I am also an agreeer that instead of nay or yay, I would like a third option as well, because there are some things I do like, and if it could be part of a solution, not necessarily one way or the other, it might be more palatable for more people. But some of the things that was in that 35-page bill, page 6, stated that the public option cannot be offered alongside any other health insurance, and lack of competition has already hurt the individual market and the small group market via premium hikes and forcing higher cost sharing ever since the ACA was passed. Pre-existing conditions and market fairness on page 3, section 2 of your bill references the approval of applications. This is worded so ambiguously that it can be interpreted as a violation of the ACA's pre-existing condition protections. It's not clear if the public option has to follow the same guidelines as private options. If it's a different set of rules, adverse selection will lead to a private market share's demise. Claims management, page 7, letter E, paragraph 3, specifically references charging groups to make up for claims overages without specifying when that would be or for how much. A small employer getting a bill 3 months into their plan for double the premium because of one sick employee would ruin a small business, which is why many groups, CBIA being one of them that I've been a member of for 25 years, says 60% of the small businesses are against this bill. But I'm open to hear. Financially, our state is already in the red. The assessment charges laid out on the carriers and participants don't suffice. How does the state expect to handle funding? Will it not be on the taxpayers that are already leaving the state, leaving many states, but this one is difficult right now. The $50 million potential fee for carriers and insurance providers could only result in higher costs on insureds, layoffs at the carrier level, or both, including my own agency. Customer experience, the bill is far too general in describing the applications, servicing, and customer relations processes. It seems to reference using the exchange, navigators, state agencies to manage everyone. These groups are currently understaffed and frankly not knowledgeable or accessible enough to handle the residents they serve now.
Alan, you've hit your 3-minute mark. If you just want to wrap it up, that'd be great.
Okay. Specifically, I just think that would be a little irresponsible to pass this bill, at least until we've had more time to dive into it, discuss it, and maybe find other solutions that they can do, possibly alongside of the private market instead of just getting rid of one or the other. Being I'm over my time limit, I talk too much, but after 8.5 hours of waiting, I finally had my chance, so I'm welcome to hear any questions that you have.
Alan, thank you. We appreciate you waiting and giving your testimony. Senator Wong.
Thank you, Madam Chair. And Alan, thank you very much for hanging in there. And, you know, after 8.5 hours of testimony, I think you present a uniquely different perspective. You're not a big policy person. You're not one of those wonderfully, you know, importantly emotional stories that we've heard. And you're not getting it from politicians and policymakers. You seem to represent a perspective of clients that you serve. And can you talk about where this bill, and you kind of articulated, where this bill lacks significantly in its approach and in its formation of servicing the clients, the people that are looking to use this product and whose lives will be impacted by it? It seems that this entire process doesn't account for what important role you have in working with people that are buying the insurance, getting the insurance. Can you elaborate the kind of the process you take in kind of enrolling them and helping them choose the process, and from your experience, why you think this public option or SB 842 may be lacking?
Well, the devil is always in the detail, and being that there was very little of that disclosed in this bill, it's very difficult to make a educated decision when you don't have facts. There's a lot of innuendos, there's a lot of things that might be, and there's things that can go either way. It doesn't really discuss if brokers are even going to be a part of this. So to answer your specific question, what do I do as a broker? We coddle our clients. We educate them in a lot of ways. We've had clients for almost 30 years, so they know how we work, and they count on us to help them make these decisions. I will never forget when Obamacare was created back in 2010, when it really came into earnest in 2014. Mr. Obama made a statement like, just don't worry about it. You don't need brokers. Just go online, pick your plan, and that's how it will work. And the problem is so many people that we work with, number one, if you go on Access Health, a plan like that gives you 75 options, and then there's subsidies involved, and trying to determine what plan makes the most sense. It's not like throwing darts at a board and hoping you get the right one. This is your medical insurance for yourself and your family. We, I believe, understand the needs of our clients far better than people that don't even know who they are. And most of the people we deal with are far more educated now because of us in an ever-changing marketplace. I mean, we are the first to say that the one common denominator in our industry is change. Nothing stays the same from one year to the next because of the metal levels that were created, and because of that, what they call AV calculator that makes the plans differ from one year to the next. A lot of people will say, I'm happy with my plan. I did not get a very large increase. I'll stay with that exact plan. And we have to tell them, well, it's not going to be exactly the same. And we try to educate them. The copay might have gone up a few dollars on an office visit or a prescription or a deductible. That's how basically it fits within the metal level that was created when Obamacare started. I do feel, though, there is some good to Obamacare. We've been able to work with whatever is thrown at us. Our job is to help our clients end up with the best possible plan that's going to help their family. Now, in reading this whole bill, and granted, you handed it to me at 4 o'clock on Thursday, didn't have a lot of time to be able to really understand it. But in reading it enough with two of my associates in my office, there's definitely a lot of vagueness in regards to how many options are there going to be in the public option. Is it one plan or is it several plans? How does a person that's coming to the state for advice, who's going to advise them? Is it going to be a navigator? Is it going to be the people that took over the shop exchange, which was a mess? And I know from firsthand experience, I have a person in my office who worked there until all of them were laid off 9 months into the I'll just say the time of that. And now it's taken over by the state, and it's horrible. It has very, very little traction in the entire group marketplace. But yet, whoever is trying to give all this advice, I don't believe will be as helpful as we are. We are very supportive of our clients, and we understand that their needs are important to them. And you can't just say what one person has, their neighbor's going to want the same thing, because they're all different. In group plans, if you have 2, 3, 4 options in a group, that makes more sense if there is a contribution, because they don't all have the same medical needs. There should be different choices to have. I don't know what those choices are, because the public option, at least in the bill we saw, doesn't really give you a lot of detail on some of the things that I find are very important. The one last piece, the networks that are used, we don't even know who they're using. Is it going to be one of the main carriers? Is it going to be a conglomeration of all of them, or is the state going to create their own network of providers based on however they negotiate with the doctors? The gentleman who ran the doctor of the Connecticut Medical Society hit on a lot of points that I would hit, so I'm not going to go back over them again. But in reality, the doctors are fleeing the state because it's very difficult to work. I mean, malpractice has cost them a lot. They're not making as much. A lot of private practices are joining forces with others, so they maybe can create a large group setting where now they might be able to get better rates. There's a lot of different strategies that go into making sure your clients get the best possible solution. And I do think that the broker, in our case, especially us, because we've been doing this for so long, can give much better advice than maybe somebody from the state who doesn't really know these people.
Yeah, and you raised some great examples. I think the state takeover, your experience with the exchange has been challenging, I guess, being kind. But you also hinted that the insurers aren't always in the best light either, and it's important that both entities look to get rid of your business and your connection to the consumer. And what are your take on that in the sense that the flaws of both entities, and what you would suggest that could be a better solution to reducing costs? You talked about malpractice, you talked about different components, but from a consumer and a direct consumer contact point, do you have any suggestions?
I would love to see more detail on what the public option or options can be and how they could fit in, but I would say side by side with the private marketplace today, as opposed to saying it's one or the other and everyone has to go one way or the other. I just feel like you're not giving employer groups and within them the employees enough options and choices that might be more helpful for them. For instance, in the individual market, totally different than the group market. I get that. Company like Anthem Blue Cross, big company. They have a great national network. Blue Cross is in all 50 states. However, in their exchange product, in the individual plan, you cannot leave the state of Connecticut. Same thing with Husky, can't leave Connecticut. Now that may not be important to some people, but we have quite a few people that live in Fairfield County, where I am, that feel that for whatever they're thinking, that New York has the greatest doctors in the world, the best hospitals, and Connecticut is just not as good. I don't agree with that, but the fact is we have many clients, especially in lower Fairfield County, that feel a necessity they have to go into New York. You can't do that with Anthem Blue Cross now, or Connecticut for that matter on the exchange. I don't know on the public option, is that network going to be Connecticut only, or is it going to be able to allow you access to the country? People that may want to go to Florida in the winter months, or even for a couple of weeks, or anywhere else in the United States, does that mean they're not going to have in-network access as soon as they leave the state of Connecticut? Like Husky. Husky is a wonderful tool, and I don't even mind expanding that and making it more available to more people if necessary, but it's an option. I don't think it's an all or none situation, because I think too many people would get hurt by that.
And I think it's a fair statement to say that under this proposal and under the materials that you have and your experience with a state managed program that is conscious about managing cost, I don't think it'd be appropriate to use the term that you will be able to keep the same doctors, the same network, and the same choices that you would have prior, as was promised under Obama, the Affordable Care Act. Would that be a fair statement, that people should not expect that they should be getting the same thing as they're getting now for the prices that they're paying?
Yeah, I think that's a fair statement. I mean, unfortunately, that's a famous statement, is don't worry, you can keep your doctors, you can keep your plan, obviously, and the rates are going to be significantly cheaper. Those were all three fallacies that were just not truthful. Now, I don't know if that was the intent, but that's what ended up. I like to deal with fact. I don't want to keep going on theories and fantasies. I did listen to many of the speakers today who had some really heartfelt stories, and I feel for them. I also have an autistic child, and we live with that. He's now 28 and doing very well, and he's the reason I'm now in Florida and not at your snowstorm. But I'm down here because I like you, Tony, and I respect you, and I said I would testify today because this is meaningful to me. I do feel that I do understand our system the way it is, but I also understand, like I said earlier, changes are very commonplace in our industry. I don't have any problem with creating new options. In fact, I think it's good. I remember when Obamacare started, I was not very much a fan of that. But as it turned out, because the rates did escalate quite a bit, it did a lot of good things for people who really needed to be covered. I would be more of a proponent of possibly raising the amount that you can make to get a subsidy. Instead of around 49,000, maybe somehow make that number 75 or whatever the number actually makes sense, to allow more of the middle class people who do make decent money but not that much money to now, instead of at 51,000 paying an exorbitant rate, maybe now they would be eligible for a subsidy, and that might make more people a lot happier, because I do feel it's important that they do get to keep their network. Husky, yes, does have some good options, especially for people that do have illnesses, but so do all the other carriers, and they have a whole lot more doctors to choose from in the non-Husky networks.
Thank you. And one last question that you raised that is an important differential in the private marketplace and in all the insurance that you sell, health insurance, the coverage of pre-existing conditions and the abolition of adverse selection processes under the Affordable Care Act, that is a fact in your current private market insurance programs, correct?
Both individually and group. I mean, to even, well, one exception to that, and it's not part of the ACA guidelines, but they are now in the last 2.5 years and more earnest in the last year, what we call level funded plans. All the carriers are now offering them in the group market. There's a minimum number of participants, typically it's 5 or more. But what it does is it does get underwritten. It's basically doing, to some extent, what the state at least is talking about, although I don't know because I don't see the details, but it allows the carrier to look at the risk because they do have health questionnaires. And based on the health, they could either say, yes, we'll take the group. No, we're not going to take the group, or we can raise the rate up, which is the way the individual market used to be before Obamacare changed all that in 2014. Now that is a little different because what makes that different in a level funded plan, they don't cover preventative vision and dental for kids. They don't cover in vitro. Those are the two big takeaways as far as benefit. But the big plus that it gives you is if they are taking healthy groups and the groups do well with their loss ratio and they come in below the claim cap, they actually get refunded some of their premium back, which is a plus that all fully insured plans do not get. And those are some of the things that we explain to groups. It may make sense for some, it's not for all. That's why I'm not a big proponent of all or none. I just feel that's not really the best method for this state or anywhere else for that matter.
Well, Alan, I appreciate you calling in from Florida. And could I leave with this common thought that I think resonates with your over 30 years of experience and what I've heard from many of your customers is that you present the facts, you give them the best service that you can, but you never overpromise. And you deal with giving them the information that they need to make the best decision and provide products that offer that. But I think you're very, very conscious and very, very diligent about making sure that you're not going to overpromise that you have all the solutions in this. And that's important to note as we undertake any policy and anything that's so dramatic and so sweeping from the standpoint of the current proposal on Senate Bill A42, that we have to be very conscious that we're not overpromising and not be able to deliver. And
one other point, Tony, if I can make it.
Sure.
The other part that I am concerned with this bill, because I don't know, again, without the detail, when it comes to servicing an account, that's where we, I believe, specialize. When we do meetings for groups, we tell them right up front, whoever we use, whichever carrier it is, it's very cyclical in regards to rates, they all vary, but now the networks have become much better, much bigger. But the question is, when somebody goes to the pharmacy and the pharmacist tells that person, sorry, your plan was canceled, who are they going to call if they're in the state option? Are they calling the state? Are they calling Mr. Lembo? Are they calling a navigator? Who handles those issues? And the only reason I say that is it's happened to my wife twice, where they said, no, sorry, your plan's canceled. And she said, no, my husband owns an insurance agency and I pay the bills. The bills have already been paid. We're not canceled. The point being is there what the carriers love to call system glitches. These happen all the time. That's reality. Unfortunately, what we tell groups is there will be hiccups all the time, whether it's in getting your ID cards on time or a claim isn't handled properly, where we're different than most agencies, let alone the state of Connecticut. We will fight for them and we will have, because we do have a lot of contacts within the carriers, because we obviously write a lot of business, we will get your situation fixed. And we do it in a timely fashion because normally they're panicked. They're at a doctor and they said, sorry, you can't go for your surgery tomorrow. Yeah, we pre-certified it, but now we see your plan's not active. Well, we know it's an issue, but we know we can fix it. I would love to know, how is the state gonna do that? And who's gonna do that for our clients? They're
The
used to.
devil's in the details, right, Alan?
That's correct.
So thank you very, very much. And thank you, Madam Chair, for the indulgence. And I just was told by family that it's National Pizza Day.
Well, good. Then you could have dinner once. I have yet to eat.
Yeah.
But that's okay.
Thank you, Madam Chair. Thank you, Alan.
Thank you.
Thank you, Alan.
You're welcome.
Next is John Lazaru, followed by Ashley Starr Frechette. Hopefully I said that correctly. John, are you with us? Yeah, I can see John if you just want to take yourself off mute. Okay, we can come back to John. Ashley, are you there?
All right, sorry, can you hear me?
We can hear you.
Great, thanks so much. So good evening, Representative Wood, Senator Lesser, and members of the committee. My name is Ashley Starr Frechette. I'm the Director of Health Professional Outreach at the Connecticut Coalition Against Domestic Violence. We're the state's leading voice for victims of domestic violence and the agencies that serve them. We have 18 member organizations across the state that work to serve almost 40,000 victims each year. So I'm here tonight to ask you guys to please support House Bill 6389, an act concerning explanation of benefits. As a few people talked about earlier, EOBs currently are automatically generated by health insurance companies, and they're sent to the policy holder of that insurance policy, not directly to the patient who sought that service. The inability to control where these automated statements go disproportionately impacts vulnerable patients like victims and survivors of domestic violence. Many victims and survivors are actually on that same insurance plan as the person that is abusing them, making this current practice extremely dangerous to individuals dealing with this. So intimate partner violence is, as we all know, it's a national public health concern. 1 in 4 women and 1 in 7 men have been severely abused by an intimate partner at some point in their lives. And in fact, here in the US, intimate partner violence is actually more common for women than breast cancer and diabetes combined. IPV takes an incredible toll on the physical and emotional health of victims and survivors, and it leads to increased need for medical services. The way that Connecticut is currently allowing EOBs to be automatically generated and sent directly to the policyholder, not to the patient who physically sought those services, can put victims of domestic violence in serious danger. It may also prevent them from seeking necessary services due to the concern that the abuser would be notified. This may also prevent, nothing has highlighted this need more for this bill than this COVID-19 pandemic, which brought on an increase in the complexity of the issues that our survivors are facing. With everyone stuck at home, the need to ensure that these automatically generated EOBs wouldn't be the reason that a victim or survivor is put in harm's way is really important. Currently, HIPAA prevents medical providers from disclosing most aspects of patient care, and we think that insurance companies should be held to that same standard. So passing House Bill 6389 would allow victims to choose a safe and appropriate method of receiving their EOBs without the fear that the abuser would get a copy. So I strongly urge you to please help protect victims and survivors of domestic violence by passing this measure. I also wanted to mention that CCDV does support Senate Bill 842 to increase access to affordable health care for immigrants and providing a choice between private insurance and publicly sponsored plans. We think that should be a priority. Affordable health care for all is essential for victims and survivors of domestic violence, especially with the increased need for health care services. So we hope that you will consider both of those requests, and thank you for the time tonight.
Ashley, thank you for spending so long waiting to speak. We appreciate your testimony. Any questions from the committee? Representative Dathan.
Thank you so much, Madam Chair, and thank you, Ashley, for your heartfelt testimony this evening. It is really important that we support victims of domestic violence. I know a few other states have similar bills. Have you been able to connect with any of maybe similar agencies that advocate on behalf of domestic violence victims on how this initiative has helped their communities?
Thank you so much for the question. That's a great question. So Massachusetts has a similar bill that works really well and has been very helpful because it's such a simple thing that can be done to help people from something that could be so dangerous, and also Futures Without Violence, their national leader for all things domestic violence. And they also support this and have, helped us with the language for this.
Great. I really appreciate you testifying. Have a good evening. Thank you for
Thank
waiting.
you too.
Thanks, Ashley. John Lazaru, you are up, followed by Natasha Aziz.
Hi, sorry about that. I'm actually at work. I was hoping to do this early in the day, but it didn't happen.
Well, thank you for waiting so long. We really appreciate this.
On top of all, when I got to work at a group home, come to find out one of the staff possibly has tested positive. So in a contaminant situation, we're in full PPE. I will talk loudly and do the best I can. Good afternoon, Senator Lesser and Representative Wood, and members of the Insurance Real Estate Committee. My name is John Lazaro. I work for 16 years in this field. I'm a member originally of Tri-County ARC and ultimately for whole life. I work in Down syndrome group homes. I work with the mentally handicapped. It's a great field. I love what I do. I love working with the clients. They're really the best people on the planet. They don't really care about anything except that you showed up to take care of them. They like music, their games, going out on outings. Hopefully we could start doing that again. I'm here to testify today in support of Bill SB 842, because even though I love what I do, the insurance is simply unaffordable. The family plans, let me just pop my mask off. I'm in the back of the med room here. The family premium for our family health plans are just astronomical in our division. The bottom rung plan, like if you get just the basic coverage, you're looking at like $800 a month with about a $12,000 deductible. If you want to get something that's actually like real insurance, you're looking at something anywhere $1,300 to $1,400 or more and a $7,000 deductible. In putting that into perspective, that's roughly like a $1,400 mortgage. That's more than my car insurance, utilities, food, almost everything combined. If I tried to get a loan for that at my income bracket, I mean, a loan officer would laugh at me. We do not qualify. Yet somehow I'm expected to pay that, no questions asked, for the insurance. I mean, if you compare that to what my workers and I make as a wage, it's about 50% right out of the gate of everything that we would earn for a full-time paycheck. That's $16.80 an hour, $2,688 a month. You're looking at about, if you hit your deductible, you're looking at about 71% of a total full-time paycheck before taxes, before anything else is removed. It's simply undoable. In addition, my wife, who's a para in the school system, is in a similar box. Paras are not allowed to have family insurance. They can only do individual plans. So we're left in the really terrible spot of both her and I have basically the bottom rung catastrophic plan for ourselves. Our kids are precariously covered by Husky because we just slide under the cap, but it could go south of the border at any moment. Where, if I'm frozen for an extra shift of overtime, that could make all the difference in the world. We could be over the cap. Now, we're doing everything that we can. There are many workers like me in this box where, one of us could have dropped our job, gone on food stamps, lowered our income, and qualified for family Husky, but that doesn't seem to be the American way to do this. We're doing it the right way. Both my wife and I are working full time. We're pulling ourselves up by our little bootstraps and trying to do the best we can, but we're literally being priced out of the insurance. The family insurance plan, we're literally boxed out of. I work with so many of my fellow fellow union members that this is the #1 thing that sinks us.
John, thank you so much for sharing your testimony. I can feel the stress in your voice for how hard this is for you and your family. And I can see you're at work and probably waited for a really long time to speak. So it means a lot to share this with us. I was wondering if you could elaborate a little more. Are you using the Access Health CT as a place to go for your healthcare, or are you using a private broker?
The Access for the renewal for the Husky, it's the Access Health. The rest, for my wife and I, we use really whatever our employers choose. I kind of laugh when you have people come on and say that, well, we're here to offer a variety of choices. You don't really have a choice. Whatever your employer chose and essentially steam shovel down your throat, that's the plan. Right. If your doctor's in it, they're in it. If they're not, you pick another doctor. And for many of us, I mean, example myself, I have a $6,700 cap before my insurance pays anything. I ended up in the hospital mostly from the stress of the COVID situation and everything, working here at work. You never know when you're going to be relieved or someone's going to call out because they're sick. Ended up in the hospital, blood pressure 196/118, hit with a hospital bill of $3,000. I'm not at my cap. There's nothing else to do but throw it on a credit card. I don't want to destroy my credit. It's going to take years to pay it off. And by the time the program, you reach to the end of the year, you may or may not hit the cap. You probably won't. It's $6,700 and it'll just roll again. I mean, all of our debt that my wife and I have accrued is primarily doctor bills. That's it. That is the #1 barrier between us and the American dream for myself and many of my fellow union workers. I don't know for certain if this bill is the 100% fix. I don't know that. But for where we're standing at right now, anything is better than absolute failure. Where I'm at right now is paramount to nowhere. There's no way out of this box. If you're a family in Connecticut under, say, 85, 90 grand, I don't know what you're supposed to do. This healthcare right now for a family, for many of us, is literally one full-time job just for that. And that's before housing or food or anything else gets added to it.
Right. John, thank you. I'm going to pass it over to our colleagues to ask you some more questions. We have Senator Anwar.
Thank you, Madam Chair. Mr. Lazaro, thank you so much for waiting the entire day. And I apologize, some of the legislators may have taken longer with some of the people to make some points. But I do, what you said is something very powerful. What you said to us was that, do we have a perfect bill? But in the presence of a failure, a slightly imperfect bill is better than the current failure. Because we as a state are failing the people, working people. And then if you look at the Alice reports, we actually have the working poor is increasing rapidly and the ability for people to get insurance is decreasing. So that's exactly the challenge that we have. We have spent about 2 hours talking to a salesman on insurance to prove a point that business or that individual would be impacted. So I am just heartbroken with what we have done to our community and our state. And I'm so thankful that you have come and spoken, and so many more people have come to speak about the truth, their reality of what they're facing every single day, rather than some of the alternate realities that people are experiencing. We have the responsibility to take care of the people who are vulnerable, who are hurting. And I'm so glad that we have a bill that can at least start to address this. And thank you so much for saying, and all of us have heard you, the wait was worth it. Thank you. Thank you so much.
Thank you.
John, thanks for coming on. Next up, we have Natasha Aziz, followed by Allison Weir. I don't see Natasha. We'll go to Allison Weir, followed by, and then Dr. McLean is after Allison.
Thank you, Representative Wood, Senator Lesser, and members of the committee. My name is Allison Weir. I'm with the Greater Hartford Legal Aid. I'm a policy advocate, And I'm writing here in support of SB 842, especially the Husky expansion provision. And I urge you to consider expanding the income limits for all adults covered under Husky. I've submitted written testimony, so I won't dwell on too much, but I just want to add a couple points. The income limits under the 3 Medicaid programs for adults, Husky A, Husky C, and Husky D, are all substantially too low. While children under Husky A are eligible with family incomes up to 201% of federal poverty level, their parents are only eligible up to 160% of federal poverty level. It's even lower for adults without children covered under Husky D, who are covered only up to 138% of poverty level. And for adults who are elderly or disabled covered under Husky C, the income limits, which vary by regions in the state, don't even reach 95% of poverty level. We urge you to consider moving income limits up for all adults to be covered, comparable to children. Increasing the income level for adults becomes even more important as the minimum wage increases. Legal services, of course, supports an increase in minimum wage. However, one unintended consequence of that increase is that people get closer to the benefits cliff for Husky. It was mentioned earlier that the bill will provide subsidies for the exchange for up to 200% of poverty. But even with that, the out-of-pocket costs could easily eat up any wage increase from an increase in the minimum wage. For example, a single person working part-time at minimum wage for $12 an hour currently earns, say, $17,774, which is 138% of the federal poverty level. Raising the minimum wage to $13 an hour pushes him over the limit with an annual income of $19,000. But with that, even the subsidies are entirely covered, the premiums are entirely covered, the out-of-pocket costs of $2,500 for the year would eat up all of the additional wage he's made. So we really ask you to consider raising the income level for Husky from Husky D as well as Husky C, where the income levels are so low. And these are people who can't work. And the 95% of poverty level is nothing. And if they don't have that, then they don't have Husky C, they don't have any insurance really, because they have so many out-of-pocket expenses. Even if all the premiums are covered, it'll really be detrimental. The other thing about increasing Husky is that 50% of the costs of restoring the income limits would be covered by the federal government under the federal federal Medicaid match, which would increase Connecticut's expenditures. Increase the impact of Connecticut's expenditure, and also bring in more federal money into the government. So I'll try to, in the interest of time, cut my comments short. But if you have any questions, I'm happy to answer them.
Thank you, Allison. Any questions from the committee? Senator Lesser.
Thank you, Madam Chair, and thank you, Allison, for your testimony, and I guess everyone for their perseverance at this hour. Obviously, I understand why Medicaid advocates are looking for higher eligibility thresholds across the board. I think that's self-explanatory, and you made a very good case. The bill does, we're outside of Husky A, require that the exchange. I don't know if this is a much consolation or not, that the exchange eliminate premiums for everyone under 200% of poverty. I understand that the exchange is not necessarily appropriate for everyone, and that may leave some cost sharing problems and may not work for some of the older folks on Husky C that you were describing. Would that be a significant positive step, or are we chasing the wrong goal there?
I think for Husky D, for the adults without children, it'd be a significant positive step. But Husky C really does need more structural supports. I appreciate also that the bill makes it easier for people to connect into the Connect program. But the folks who are on Husky C at the low income level point, they're really kind of stuck. They can't work. I think we've heard testimony today from folks who've said this has been a real problem, even trying to get an employer, even if you could work just a few hours a week, just to get an employer to agree to schedule that.
Got it. Thank you. I mean, I think one of the struggles that we're having is just keeping the price tag affordable. And so that's why, you know, if we were going to raise eligibility to one level, it seems like Husky A was the lowest hanging fruit there.
Certainly understand that. But, you know, I again, policy advocate, wanting to help our clients as much as possible.
Totally understandable. And I'd be doing the same thing if I had fewer physicians. So that makes total sense. Thank you.
Representative Farrar.
Thanks. Hi, Allison. Following up a little on what the senator covered, one of the things we heard from the previous speaker, and you got into a little bit, is really the effect of the benefits cliff on so many families. And I was wondering if you could kind of speak to how you feel like this proposal resolves some of those cliffs, and as you said, you know, where there's more work to do.
Well, certainly raising the Husky A for parents helps the benefit cliff for the family generally. It also makes a lot of sense in that if parents are insured, the kids are more likely to be insured. We've seen a lot of research showing that kids who may be eligible for Husky aren't necessarily enrolled in it if their parents are enrolled in it. So keeping the family intact really does help a lot with that. Again, with the benefits cliff as well, a family of four, you know, we've heard just the speaker before, his kids are covered, but he and his wife are having a lot of trouble, and he's, you know, thinking about not taking overtime, or just if he takes overtime, could easily get pushed out of that, and the kids won't be covered either, which is another situation beyond the 201. But certainly the 201 for Husky A is a big step in helping reduce the benefit cliffs for the family.
Thank you. Thanks for being here.
Representative Nuccio.
Hi, good evening. Thank you, Madam Chair. You know, I haven't said that today, and I'm sorry for that. I keep slipping my mind, but thank you. Good evening, Ms. Weir. How are you?
Well, thank you, Representative.
Thank you for sticking around with us. I think Representative Farrar just kind of took what I was going to say a bit. I understand you just pointed out a very, very pivotal piece of information. As we increase the minimum wage up to $15, it is going to continue to push, you know, the intent of that is to the workable wage and everything else, but it's also then going to push people out of the range of subsidies. And the next dollar cliff is something that is very real, that I think hopefully we will be able to look at and expand and try to come up with a sliding scale, because just because you get to one level doesn't mean you still couldn't use a little more help. Maybe you don't need 100% of the help, but you still need a portion of the help. So you pointed out a very, very good thing for us to hear, to remember, and then to commit to working on. So I appreciate that.
Thank you.
Allison, thanks for joining us. Next up is Dr. I'm sorry?
Thank you very much.
Oh, you're welcome. Oh, I love your cat. All right, Dr. McLean, followed by Merrill Gay.
Great, thank you. You can hear me okay?
Yes, we can.
Super, just want to make sure, thank you. So I think you were expecting Dr. Robert Russo from the State Medical Society, but since the Medical Society actually already had a chance, he graciously gave me his slot. I'm Dr. Robert McLean. I want to thank chairpersons Senator Lesser and Representative Kerry Wood and the rest of the members of the committee. I speak before you as an individual living in Connecticut and as a physician practicing in New Haven for over 25 years and as the immediate past president of the American College of Physicians. I'm here to speak in support of Raise Bill 842. This bill, once it becomes law, will help the state of Connecticut take a significant step forward in efforts to provide affordable health insurance coverage for all of our citizens, and therefore I really urge you and the General Assembly to pass it. I've been concerned for quite some time about the inequities across our state, regarding affordability and accessibility of both health insurance and healthcare itself, as many have raised. We have found ourselves in a dysfunctional and disjointed healthcare delivery and payment system that leaves way too many people out. The Affordable Care Act in 2010 made some steps forward in increasing availability, a great deal, and affordability only somewhat, and of health insurance, and to many through the state health insurance exchange. Yet, yes, people can buy health insurance, as some have said, but the small business component never developed as envisioned, and high deductibles and copays still make healthcare unaffordable for many individuals. The presence of some sort of public option plan as envisioned in this bill will go a long way toward filling those remaining gaps. Over many years, I and others I've seen on this meeting have been involved in state government-directed initiatives around health reform, ranging from the Primary Care Access Authority back in 2007 to sustenance proposals in 2009, which is where I first met Comptroller Kevin Lembo, and to more recently, the Health Innovation Steering Committee under Lieutenant Governor Wyman. I have closely witnessed many great ideas go nowhere due to both budgetary restraints and powerful opposing interests. I believe many of you do believe that your responsibility as elected public servants is to help the individual citizens of Connecticut. When I was president of the ACP last year, I was involved in the development of a series of policy papers around comprehensive health reforms needed to address the ills of our current healthcare delivery system. In the testimony that I submitted, there's a link to that. The first of those papers address coverage and cost of care, and I really would encourage you to look at it. Based on extensive research of strategies tried in different states and countries, and on the simple fact that our existing healthcare system is, quote, inefficient, unaffordable, unsustainable, and inaccessible to many people, the ACP in those papers stated that one path to achieve universal coverage that was affordable within our current pluralistic system would be to incorporate a publicly financed coverage option. I think you realize that this would not simply be Medicare for all or Medicaid for all. There are significant problems, as some have raised, with current Medicare and Medicaid payments to both physicians and hospitals. Payments in any public option cannot be based on those rates alone. It would not be financially sustainable for small physician practices or hospitals and health systems to live on those. And some of those entities actually may be opposing this bill or aspects of it because that payment uncertainty is not explicitly addressed in all of the language of the bill.
Dr. McLean, if you could wrap it up,
Yep.
your 3 minutes is up.
Absolutely, thank you. To many of our small employers and individuals who cannot obtain adequate health care and affordable health insurance in our state, I urge us to support this bill. And I'm happy to take any questions. Thank you.
Thank you. We do have questions. Senator Anwar.
Thank you, Madam Chair. Thank you, Dr. McLean, for waiting all day and then for the testimony. I know you well because you have been the president of American College of Physicians. That's a national organization. So it's a source of pride for all the physicians in the state of Connecticut that a Connecticut doctor was the leader for the entire United States for the American College of Physicians. Do you know the membership? I was last looking, it's like 160,000 physicians across the country.
Over 160,000 specialists in general internal medicine and specialists in internal medicine. So there's about 20 or 30,000 that are medical students, a lot of residents, a lot of practicing doctors, doctors across all sort of practice settings, medical specialists, as I say. Yeah, it's the whole gamut. It's a wide spectrum of a lot of physicians. And a lot, I would say probably of the general interest, most of them are doing primary care. So a lot of the push behind this comprehensive health reform really was looking at the importance of a primary care backbone, which is kind of a whole nother topic we could speak for a couple hours about. But I know that, you know, the state has been trying for years to try to figure out how to incentivize that and make that work better.
Now, this highly specialized, becoming an internal medicine specialist takes a lot of effort to get to that point. I know that because I'm an internist myself, and before I became a specialist as well. But I want to mention about in 2020 in January, the Annals of Internal Medicine, which is one of the top medical journals, there was a very strong position or a prescription from the physicians across the United States was written. Can you speak to me about that, please?
Sure, I made reference to, so the paper, the series of papers, essentially the American College of Physicians had been pushing for really comprehensive health reform for many years and supported the Affordable Care Act back in 2010, not because it was a perfect bill, and this is not a perfect bill, and as you have said, it is a foot in the door to do something that we need to do. When we have a system that is so dysfunctional, we have to stop accepting imperfection. Or we have to accept that we have failure for so many people, and we have to do something. So the ACP, saw the ACA for all of its good. As I say, it made healthcare more available, but quite frankly, it just wasn't affordable for many, many people. And we've all lived that. And the exchanges are great in terms of what they tried to do, but they are simply too unaffordable in many ways for many people. The high deductibles, all that stuff. So the ACP said, okay, listen. The ACA is not going far enough. What can we do? What do we need to do? And they really went out and they said, what has worked and what has not worked in different states, which has served as pilots in some ways, some of them with public option kind of programs, and in other countries. Clearly, you can't take what's happening in social democracies in Europe and bring that over to our multi-pluralistic country. They're different, but there are things and aspects that worked, and what works and what doesn't. And their conclusion, with the goal being we need to have a healthcare system across this nation that does not have job lock, as somebody talked about earlier. So you have to kind of try to move away from some of the employer bases. You have guaranteed coverage, you have universal coverage and affordability. And they came to the conclusion that a purely market-based solution does not work. It will not get you there. Healthcare is too expensive to rely on the market to do too much. And if you're going to really if we're going to blow it up, although we can't, how would we get there? There were two options that actually made sense that they led a path to in these series of papers. One was a multi-payer option, which includes a public option in a way to keep the market honest, which is what you all are talking about here now. And the other one was what a lot of people want to hear, but a lot of other people don't, which is a single payer finance system, which has a little bit of a cultural shift than the others. But those were two systems which they lay out a path could get you to where you need to get. So the public option within still allowed a multi-payer pluralistic system. There's a path to get there. And I think that is what a lot of people favor. People, especially who live and work in the insurance industry, we can't discount that. But I think we have to recognize that leaving this to the market alone, you're not going to get affordable, accessible health insurance for everyone.
So, and this was written before the pandemic.
Absolutely, it was published in January of 2020. I mean, these are old problems. Yeah.
Right.
The pandemic, though, to your point, I think has shown that our backbone, our system is broken. The public health aspect of it was broken. We couldn't do stuff that we needed to. I mean, it had been underfunded and undercut for a number of years in the recent administration. There are multiple, blistering sores, to use a medical, visual, that were demonstrated from the pandemic. But it merely demonstrated what had been there for a long time, and we all knew it. And all you had to do is talk to the people who have struggled getting health insurance, getting coverage. Many of them spoke eloquently today from our state. I think it was John Lazarou a few people ago. He basically said, there's no choice. If you're lucky enough to be employed and they offer insurance, you don't have a choice. You're given what the employer gave you. And if it has a high deductible that you can't afford, you're stuck. So I think you have to recognize there are certain aspects people like the choice if they are in an employer that offers choice. Sometimes there's a little choice, not a whole lot, but it's broken. And we need to kind of get at it. We somebody else said tonight, let's stop talking about numbers and taxes and that. Let's talk about people's lives. I mean, the people who told some just really sad stories of struggles, it was heartbreaking. And that's reality, and the state government has a role and can do so much if they're willing to start to go down this path.
This is very helpful. And right now, I think some of the people are trying to push for the status quo, despite the ground reality and the worst or terrible case scenario that we have seen post-pandemic, to say that, well, stay the course and continue this, and it's going to market pressures are going to fix things. It is going to be irresponsible to stay that course and then try to find technicalities, minor technicalities, and some specific sales industry people or analysts for these insurance industries would come up and then give rationale to try and protect their jobs. So I truly value what you're saying, and the fact that you're a practicing physician, the fact that you have been a leader at the national level of one of the largest medical organizations, and the fact that this organization has publicly stated that public option is the way to go to save the lives of the people. And then that's the prism that you've looked at. And you've also called about sustainability in that. So, and could you speak to the sustainability? Because people are saying, well, this is not going to be sustainable.
Well, I mean, there's a lot of talk about that. I think you have to figure out, money is going to be spent on healthcare by somebody. It's going to be spent by individuals through taxes are helping pay for Medicare and Medicaid. People are potentially not getting paid as much as through their living wage because their employer's paying benefits. I mean, the employer-based system is tremendously complicated. I think that people had frustrations with it because of job loss and those issues. I think that the pandemic, when so many people lost their job, I think raised some real awareness of the weakness of the employer-based system, because when they lose their job, they lose their insurance. And then suddenly they're scrambling and they're trying to get on Husky or Medicaid or see what they're eligible for, or maybe they can buy it from the exchange, but they can't afford the exchange premiums. And if they can do that, they can't afford the deductibles. So it's this just horrific circle or cycle that people get into of not having money to pay for insurance. And then they go, well, if I'm really sick enough, I'll go to the hospital. So then the hospitals pay for it, or don't get paid for it. So then the hospitals have to go to the state and say, we have this unfunded, huge amount of money that people never pay for. So because we give all this charitable care, you have to reimburse us on this. So you get all the cost shifting stuff. I mean, it's a mess. It's incredibly complicated. We cannot blow it up and start again, as much as many of us would like to. And so how can we start to kind of chew at the problems around the edges? Probably the most feasible thing that I think will help the state get a handle on this is something like is proposed in this bill. It's not wrapping in, Medicaid to this. I think a lot of people say, why don't we do that? Then your numbers are bigger. It's just, that's too big a nut to crack right now, as much as I think that would be a great idea. But it's huge. And I think this is one step. It's not perfect. It's not addressed every little nuance and ambiguity, as many have said. I think it has to go forward with kind of the right incentives and some of the nuancing that probably needs to still be worked out. But it is a step forward that is just critical. And as you said, the status quo is not acceptable. And the pandemic has clearly shown that.
Thank you so much, Dr. McLean. Thank you for your testimony and time you've stayed with us all day today. Thank you, Madam Chair, for
fascinating to watch, I'll tell you.
Dr. McLean, thank you for joining us. Next up, we have Meryl Gay, followed by Torino Jimenez.
Senator Lesser, Representative Wood, and members of the committee, thank you for this opportunity to testify. My name is Meryl Gay. I'm the Executive Director of the Connecticut Early Childhood Alliance, and I testify on behalf of our 94 members in favor of Senate Bill 842. There are three primary reasons we support this bill. The three big things this does is to restore the income eligibility for parents up to 201%. For our members, many of whom are child care providers, there are a surprisingly large number of our members who fit into that 10,000 or 11,000 parents who lost care when this was changed in 2015 or 2016, I guess. The next thing that we support is the creation of a public option, because many of our organizations are either small businesses or small nonprofit organizations. And anything we can do to figure out a way to reduce their costs and provide better quality care, better quality insurance plans for those small businesses is particularly helpful right now, as the childcare industry is reeling from the impact of the pandemic. And then finally, the expansion of subsidies to support the undocumented workers who do some of the hardest work and lowest paid work in our economy, who right now are effectively cut out of the healthcare system. They can't be on Husky, they can't use the exchange, and so there's not much left for them. So those are the three reasons that we support this bill. I've had childcare providers talk to me about losing their coverage when the income limit dropped on Husky. I've had providers talk to me about when a spouse lost a job and therefore they lost the health care that they had, not being able to figure out that when they took COBRA for a month or two until they realized that they couldn't afford it, that then made them ineligible to get onto the exchange for months until the next open enrollment period. So this is a real problem for lots of people right now, and I urge you to support Senate Bill 842. Be happy to answer questions.
Thank you. Representative Comey.
Okay, thank you. Hi, thank you, Madam Chair. By the way, you are doing a fabulous job. I appreciate everything that you're doing here. Hi, Meryl. It's good to see you, and thanks for hanging in with us for this long day. I know that you said that you represent an early childhood industry of 94 members of your organization, but I also happen to know firsthand that you advocate and work with on a daily basis with 300 or more providers and folks in the industry. So let's not sell yourself short there. But you were talking about, I wanted to talk with you about the fact that we all know that our economy and our economic success is really strictly linked to our ability to find affordable and quality childcare. And I was wondering if the impact, you just briefly touched on the impact of the small business owners. Can you talk a little bit about what happened during COVID and how programs have had to reduce their numbers of kids that they're serving, and what that has meant to their programs, but also the teachers and the people that work for them?
Yeah, so we're at about 70% of the capacity we used to have pre-pandemic. There are programs we're told to reduce the number of children they could have in the classroom to help promote social distancing. And particularly in the cities where a lot of the school districts have gone hybrid or fully remote, it's dramatically impacted the number of parents who are participating in preschool programs. So in the big cities, most of the preschool programs are operating at about 50% capacity. That's meant that staff's been laid off, and it means that those childcare providers are really struggling to stay afloat. The healthcare in, all those folks who've gotten laid off have lost their health insurance. And that's if they offered health insurance in the first place, particularly some of the small business ones that are not part of the school readiness program. They don't get any subsidy. There are a number of them that have not been able to offer healthcare plans to their employees. And so those folks are really struggling for an affordable option. They know that it's hard to retain staff when you can't offer them a health plan, but they aren't in a position to do it because they're barely hanging on.
And I think, I had heard some stories as well, Meryl, that that there's a lot of job sharing. They're keeping their staff on because they're hoping to get back out, to after, post-pandemic, that they're hoping to get back to full operating and it is so difficult to find early care teachers, and that they're doing some job sharing and things like that in order just to give everybody a little bit, a little piece of the pie, if you want to call it that.
Yep.
And then and by the way, the reduced number of slots is not just happening in the cities as well. We have programs here in the suburbs that are not full, that have room, and it's, as you know, difficult to keep the business going. Is there anything that you think that can be done to maybe improve the ability to hire, to find these, to retain these workers, and do you think that in your stories with health insurance, is that a number? What do you think it is on the priority list?
Well, certainly during a pandemic, everybody's awareness of health insurance is a lot higher. These have typically, childcare jobs have typically been low-wage jobs. In some places, they have been the sort of second job in the family, and there's somebody else in the family who has health insurance, and that's how they've made it work. But now, particularly as other breadwinners in the household are getting laid off because of COVID, you have families who used to be covered now finding that they are without coverage. We had one provider who talked about her husband losing a job in Massachusetts. They were dealing with an HR department in Massachusetts. They elected to take COBRA and then realized they couldn't afford it because not only was he not working, her revenue from her family childcare business had dropped substantially. And so they dropped the COBRA and then were told by the exchange that because they'd accepted COBRA in the first place, they were now no longer eligible. They could not use the sort of life event of losing a job as the reason to qualify for the exchange outside of the normal open enrollment period. So, those sorts of things, but just it is very clear that the issues of the childcare industry are, both low wages and lack of benefits. So, we have a complicated issue there, but this bill would help a lot in increasing the eligibility for Husky. I worry that there are families out there where the parent is not eligible and they don't realize that their child is eligible. They assume because they're not eligible, their kids aren't as well. And I think that there's national research looking at the data where there have been changes to show that you have a lower percentage of children insured through the Medicaid program when their parents aren't eligible. So I do think that the simpler we can make it, the better.
And they also happen to be more majority women and minority-owned businesses as well, who are also being impacted most by the current pandemic and things like that.
Yeah.
Thank you very much, Meryl. That's all.
Thank you.
Meryl, thanks for staying on with us tonight. Next up is Torino Jimenez, followed by Taylor Biniars. And I apologize if I'm saying any names wrong. Taylor, you can go next. Following Taylor is Ellen Zinzer. Okay, just want to make sure. Can everyone hear me? Yeah, we can hear you. And you got my name 100% correctly, by the way. Good. I'm a little shocked. Dear members of the Insurance and Real Estate of the Connecticut General Assembly, my name is Taylor Biniars. I am from Ellington, Connecticut. I support Senate Bill 842, an act concerning health insurance and healthcare in Connecticut. It would make healthcare equitable, dependable, and affordable by creating new public options for health insurance in our state. I am 24, turning 25 this June, and I am paralyzed by insomnia most nights thinking about what happens next year. I actually work in this field, politics, but with no degree. It's mostly seasonal, which I don't hate, but it's not like seasonal political jobs come with benefits. I want to briefly mention a few things that impacted me. I sprained my ankle 3 times in one night. The doctor said it literally would have been better if I had broken it. I actually thought I had broken it, but I waited until the morning to go to an urgent care as my copay for that was much cheaper than going to an ER, even though I was in a lot of pain. This Saturday, for those who know me for more than 10 minutes, you know that my dad is my best friend. He had a heart attack. Thankfully, due to quick medical care, he's doing well. But the second thought that I had after that was about money and the cost that it must be. And while it shouldn't matter, he has a really good job. I breathe through my mouth. I haven't been able to breathe through my nose since I was 6. It doesn't seem that important, but it makes me more vulnerable to cavities, which I cannot afford. And I don't expect my parents to pay for them. So I stopped going to my dentist 3 years ago. When I can't afford to go, they will probably be root canals. Lastly, I've been depressed since I was 11, in therapy since 15 years old, and on medication since 17 to deal with it. I have dealt with cutting, and I'm not ashamed. My therapy has gone back to once a week, which is $25 per copay. It is $100 a month and $1,200 a year. It may not sound like a lot to some of you, but to me it is everything, and the root of my fear for next year is if I can survive without it if I have to. Basically, every other civilized country does this, and there is no excuse beyond capitalism and greed for why we do not. I know that there are a lot of facts that others will testify with, but this is my life, and one life is worth more than all of the profit. I am ashamed that our country hasn't realized that yet. Thank you. Taylor, thank you for coming and sharing your story with us. It's a very powerful one, and I appreciate you waiting for as long as you have and taking the time to talk with us tonight. Questions, Senator Anwar.
Thank you, Madam Chair. I'll be short. Thank you, Taylor, for waiting the entire day, and thank you for coming and speaking. And send my love to your father. He's an amazing person. I know you. I know him. I did not realize he had a heart attack, and I will call him too. But again, your testimony it touches my heart as well. And most powerful word I hope some of my colleagues would hear is that they look at numbers, but they're not looking at lives. And today, enough people have come and spoken about how lives are being impacted and hurt and harmed. And they will count their pennies and they will work for insurance industry to do what they can. But it's important for us to recognize that we are elected by the people to represent and protect you. So thank you so much. Thank you.
Thank you. I'll pass it on to my dad. Yes, Taylor, best wishes to your dad. Thank you. Next up, we have Alan Zinzer, followed by Betty Stakeley.
Hello, my name is Alan Zinzer. I live in Woodbury, Connecticut. I'm a small business owner. I'm actually a business broker, and so my job is getting inside the guts of Connecticut's privately held businesses and understanding the challenges in terms of what drives value, how they transition them, and inviting new owners in to take over ownership. You know, Senator Lesser earlier today made a very interesting point about State Bill 842 enhancing the relative attractiveness of Connecticut as a place for small businesses. And this really was kind of one comment, but it really is very, very true. And I think as a business broker who's actively involved in the small business sector, I want to kind of testify to the truth of that. Many of the businesses that I have for sale are really attracting an active response from surrounding states. Some of our buyers are coming in, a lot of buyers coming in from New Jersey, from New York, and we're really able to kind of sell them on why Connecticut is an attractive place to do business. And a lot of that has to do with high per capita incomes, our beautiful landscapes, access to major metropolitan regions, good schools, healthcare, a good healthcare infrastructure, and really what's important, like even what's today, is really accountable and transparent state and municipal governments. And one of the things that with this bill was we're really going to be able to offer them an ability to leverage on the state of Connecticut's buying power in the state insurance markets. And that is going to be a huge advantage, not just for owners and their families, but for employees and retaining key employees. And this is really a slam dunk, business-friendly kind of act, and I'm very happy to testify to that. On Friday morning, I joined the public policy committee of our local chamber of commerce, and they end up voting against it, using a lot of the kind of familiar sounding double speak that we hear, that this is a government takeover. And even earlier today, we heard from industry representatives talking about a fair and level playing field. But really, this is again double speak, because their fair and level playing field is a very fractured and inefficient market for people like me, small business owners, to get coverage for myself, my family, and my employees. This is a really badly needed bill. Thank you for your efforts, and thank you for hearing me today.
Alan, thanks again. You've heard us say to everyone, we really appreciate you sharing your story and spending so much time to share it. So I appreciate it. Senator Lesser.
Thank you, Madam Chair, and thank you, Alan. I think I heard you earlier today. I think it was about 12 hours ago. So it's time flies when you're having fun, I suppose. I appreciate your comments, and I just would note that I think Massachusetts was the first state to provide state-level subsidy assistance for families and small business owners purchasing health insurance on the exchange. And since then, Boston has emerged as one of the nation's leading hubs for entrepreneurship. So it's hard. I don't know that correlation equals causation. It's hard to draw a straight line from one to the other. But I take your point to heart that as someone who buys and sells businesses, it sounds like we might be onto something. Thank you, Madam Chair, and thank you, Alan, for your perseverance today.
Thanks, Alan. Next up, we have Betty Stakely, followed by Audrey Patterson.
Senator Lesser, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Betty Stakely, and I live and work in Waterbury, Connecticut. I have worked as a CNA at Autumn Lake Healthcare at Bucks Hill and Waterbury for 28 years. I am here today to testify in support of Senate Bill 842. Working as a CNA has been my life's calling. I love taking care of the elderly and feel truly fulfilled knowing I help give them a good quality of life. I call them my babies. Oftentimes, our residents can't take care of themselves, and so I care for them. Some of our residents do not have families, and so we are their family. While I truly love the work, I do not love the healthcare insurance offered to me through my job. My health insurance is expensive, yet doesn't cover the important medications that I need. For instance, I live with severe rheumatoid arthritis and require an injection of Humira every 2 weeks. This injection is not covered by my insurance and will cost me $2,300 every 2 weeks. I need these injections to work to survive. I am fortunate because I have been able to have this program that is there, a limited program called My Abbott Assist. The only issue with this program is that there are a limited number of people who can participate, and I have to reapply every year to participate. Every year I worry I will not be eligible and will be forced to pay the $2,300 every 2 weeks. How will I survive then? I, of course, look for other insurance that will cover these injections. I earn too much money to qualify for Husky and cannot afford the outrageous out-of-pocket costs of other private health insurance plans. Between the high premiums and the back-breaking deductibles, these plans are just not realistic. If Connecticut had public options, I could access the life-sustaining medication I need without the stress and anxiety. I would be able to see my doctor, the dentist, or other healthcare professionals to participate in preventive health care practices. I will be able to save money and live with the peace of mind knowing it is within my power and budget to care for myself. There are thousands of people like me in the state who need your help. Please support Senate Bill 842. Thank you for your time.
Perfect timing, Betty. Betty, thanks for coming on tonight and sharing your story and for taking care of people that need you. It's a really honorable profession. I'd like to open up for questions. Senator Lesser.
Thank you. I don't think I raised my hand, but I was looking for the button, so you read my mind, Madam Chair.
Oh, look at that.
Betty, thank you so much for sharing your story and for sort of illustrating exactly why there are so many people in the gaps between where Husky ends and where affordable health insurance begins. And we've heard that from you, but we also heard it from many, many other people today over a very long day. And so I appreciate it. I know you've got a lot on your plate right now, and but these stories that people are telling are changing people's hearts, and they're really telling the story of what we need to do. So thank you.
Thank you, Betty. Audrey Patterson. Audrey Patterson is next, followed by Teresa Armijo. Audrey Patterson, you are up. I can see you if you just want to unmute. You're muted.
Hello, can you hear me now?
Yep, you're good.
Great, thank you. Well, good evening. I originally was saying good afternoon, but now it's evening. Good evening, Senator Lesser and Representative Wood and all the members of the Insurance and Real Estate Committee. My name is Audrey Patterson. I live in Vernon, Connecticut. I am a direct support staff for Whole Life for 31 years. I also work in a similar position for Network for almost 11 years. I am here to testify to the support of the SB 842 bill. At Whole Life and Network, I work with people with mental and physical disabilities. I enjoy my job. I love my job. I love the people that I work with. As you can know, 31 years, I have learned what I mean to them. I know I make a difference in their lives, and that is a joy and a pleasure for me. But I have to say, 2020 put a different face on my job. The pandemic shook us up. We as essential workers, healthcare workers, group home workers, community program workers, we didn't have the luxury, and I know some may say that's not what they thought that they were doing, when they were able to stay home and be safe. We had to go to work in spite of the fear, in spite of what we knew could happen to us. Now, I was a victim of COVID. And you hear about it, but you don't really feel the impact until you hear the words, "You're positive." my heart dropped because I'm over 60 and I have underlying medical conditions. So I know I'm considered vulnerable as well as being in the classification of Black and brown people. So when I heard that, I had to worry about my insurance and whether or not I'm going to be able to take care of myself. What if I end up in the hospital? What if I get really sick? What if I die?
You have a few minutes to just
These thoughts go through your
wrap
head.
it up.
So when I used up my COVID relief pay and got well, thank you, Jesus, I had to go back to work and care for people who were also COVID stricken. That was scary because I said, what if I get sick again? I don't have time on the books. I barely have enough hours to cover myself if I had to go out again. My insurance, I got the cheap version. They give us different options, but I had to pick what I can afford because I'm a single woman. I live alone, so I pay all the bills. I have rheumatoid arthritis, and I have other medical conditions that require ongoing medical care. I also have to rely on Humira, which is one dose is over $2,000. And I have to worry if I'm going to be able to maintain that medication, or is that a medication I got to get off of because I can't afford it anymore because I have insurance that don't cover it. I have thyroid problems, which means my doctor is monitoring it to make sure it don't turn into cancer. Every time he says you need to go get tested, we need to check your thyroids, I panic because I know my insurance don't cover it, which means there's another bill added to my debt. Right now, I have over $3,000 in debt just in medical bills. And I struggle to pay it. I suppose I got an ultrasound back in September, and I didn't do it because I couldn't pay for it. I should never deny myself medical care because I'm worried that I can't pay for it. I'm doing a work that requires me to put myself at risk every day. The least that I should be able to rely on is an insurance that would take care of me when I'm not okay, when I'm sick. My deductible is $3,500. My premium is over $3,600 a year. That's over $700. That's over $7,000 a year that comes out of my pocket. Insurance is so vital for essential workers, their families, their children, their spouses. We got to be able to take care of ourselves. We are doing a work that is always risky. I'm asking you to support the SB 842. So people like me, my co-workers that work like I do, 2 and 3 jobs just to pay for our insurance. Just think how much we could do better with that peace of mind that we're protected and that our medical care is there for us. We shouldn't go to work under stress. We shouldn't be afraid to get sick, but we do. We worry about it every day, but we do it anyway. I'm asking you to please support the bill. I thank you for your time.
Thank you, Audrey. Thank you for coming on and sharing your story with everybody. We really appreciate you waiting so long. So thank you. Do we have any questions from the committee? Audrey, thanks again for joining us and have a wonderful night. I want to just remind everyone that we do have a 3-minute limit, and I'm doing my best. We still have a lot of people to get through tonight. Next up, we have Sal Luciano, followed by Christina Kane. Sal, you are ready to go.
Thank you very much. Good evening, Senator Lesser, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Sal Luciano. I'm president of the Connecticut AFL-CIO, and we represent about 250,000 people. Before the COVID-19 pandemic, 51% of Connecticut residents struggled to afford healthcare. That's the blistering sores that Dr. McLean was talking about. More than 5% of the state's population was completely uninsured in 2020. Almost 7% of Black residents, 13% of Latino and Hispanic residents, and 43% of Connecticut adults reported foregoing or delaying care because of cost. Many were one medical bill away from financial devastation. Today, with more than 200,000 Connecticut workers still unemployed, most have also lost the healthcare coverage that protected them and their families. They cannot afford expensive COBRA. You heard that here tonight. Meanwhile, Black, Latino, and Native Americans are contracting COVID-19 at higher rates than whites, reflecting and compounding healthcare disparities that have long gone unaddressed. SB 842 creates a new option for those most often excluded in the current employer-provided health insurance marketplace, employees of small businesses and nonprofit organizations. Nonprofits and small businesses will be able to voluntarily choose from a range of network and benefit designs, including dental care, offered at competitive prices, realized by leveraging the negotiating power of the large state employee plan. It allows more than 350,000 Connecticut small businesses who are struggling during the pandemic to provide more affordable coverage for their employees. Comptroller Lembo has historically kept rate increases far below those experienced in the private sector. SB 842 does not replace health plans offered by private insurers on and off the state health insurance exchange, Access Health Connecticut. It does not replace Medicaid Husky for low-income, disabled, and elderly residents, but it does expand eligibility so that more working-class families will be covered. Many small businesses and nonprofit organizations cannot afford to provide health insurance to their employees, especially during the pandemic. When people can't afford health insurance, they often avoid the doctor, skip medications, or delay recommended screenings. That's not good for anyone's health or well-being, and it also ends up making healthcare more expensive for everyone. SB 842 is common sense, cost-effective plan to expand healthcare access and reduce costs. A majority of Connecticut voters, 84%, believe we must make changes to our healthcare system. 7 in 10 voters favor a public healthcare option, and 72% of small business owners also support this proposal. We urge the committee to heed their call and act favorably on SB 842. All the sad stories you heard tonight, they do not want your sympathy. They want healthcare. Thank you very much.
Thank you, Sal. I hear an echo there. But I know. Do we have any questions for Sal Luciano from the committee? Senator Lesser.
Thank you, Sal. Thank you, Madam Chair, and thank you, Sal, for your testimony. It's great to work with you and the working men and women that you serve over the AFL-CIO. I have a question about the Taft-Hartley portion of the bill, because a few hours ago we heard some testimony that suggested that while this may not be the best fit for every Taft-Hartley plan, that this may not be there's some question about whether or not this was a good deal for labor. And I just wanted to see if you could weigh in on that section in particular, because I think there was a little confusion about that earlier.
Yes. In my testimony, I say Senate Bill 842 creates a new option for those most often excluded, including the Taft-Hartley plans. The plan designs emphasize preventative care and wellness, encouraging patients to utilize high-quality, lower-cost providers, unlike the high-deductible plans currently flooding the small group and individual markets, so people avoid going to their primary doctor and instead get the most kind of expensive and wrong care, which is in the emergency room. The bill also creates new options for labor unions with multi-employer Taft-Hartley plans. Unions can choose the plan that most aligns with their negotiated benefits, allowing them to retain bargain wage increases and other benefits.
Thank you very much.
Any other questions? Great. Sal, thank you so much for joining us tonight. Next up, we have Christina Kane, followed by Alyssa McDonald. I don't see Christina. I thought I saw Alyssa. Alyssa, why don't you go ahead?
Hi, esteemed members of the Committee of Insurance and Real Estate. My name is Alyssa McDonald. I'm a lifelong resident of Bolton, Connecticut, and I'm currently getting my master's at UConn. In the fall of 2018, I graduated from college and I was diagnosed with ulcerative colitis, which is basically my immune system attacked my colon, and it's not fun. I was hospitalized twice. I had colonoscopies. I had 6 blood transfusions, and I finally ended up getting a drug called Remicade, which I get through an IV. It's a biologic and it's an immunosuppressant, and it's very expensive. So I, through all of that, I was actually really lucky. I have really good insurance, and it's probably the most difficult time in my life when I also felt the luckiest. And I have that insurance because I have it through my parents' work with the state of Connecticut. And it was a lifesaver, quite frankly. And I'm here to support SB 842 because we need to extend insurance like that with good insurance, high quality, where you can get the access you need to insurance based on what your doctor says, not doing all the math out constantly to figure out if you need it, or sorry, if you can pay for it because you know you need it. And we need to expand that access to more people. You know, I'm going to have ulcerative colitis the rest of my life. It's a chronic condition. My parents' insurance is not, I'm not going to have it in 2 years, but I'll still need infusions that are really expensive. I'll still need colonoscopies every year, or sorry, every other year. It feels like every year, just forever. And having, you know, some sense of security that I could access good health insurance that covers these things would be so important. And particularly as a student who's graduating with her master's, it's to me a big reason to stay in Connecticut. And, you know, when I got diagnosed first, I thought, oh, well, now I can't really work for a small business or nonprofit because they'll never be able to have the insurance I need. And, you know, to have this as an option would just be such a, you know, this one huge anxiety, because, you know, having a chronic condition's, you know, really enough. The other thing though, is I also look around the way the world is today, and, you know, losing your insurance because you lose your job during a pandemic, it just is ridiculous. Like, how can we let that happen? And it's happening every day and it's happening everywhere. And I've been sitting here all day listening to people, and I think the thing that really struck me most is thinking about really wonderful people who helped me when I was, you know, at my worst points of my life, working through a pandemic, who didn't have access to the health insurance that I had access to. And for that reason, you know, I think that I really strongly encourage you to pass this bill. We have to do something. We can't just let this keep happening. It's ridiculous. And also, really, before I turn 26 would be great.
Alyssa, thank you for sharing your story, and I'm so sorry you you know, are going through all this, but hearing your story and you sharing that with us is really powerful. So thanks for doing that, and especially waiting so long. Any questions from the committee? All right, Alyssa, thanks so much. Up next, we have Michael Goodman, followed by Stephen Wanzik-Karp. I don't see Michael, but I see Stephen. So Stephen, why don't you go ahead?
Good evening. Thank you very much. I'm Stephen Wanzik-Karp, Executive Director, National Association of Social Workers, Connecticut Chapter. We represent over 2,300 members. You know, all industrialized nations except ours have some kind of nationalized healthcare system. Since we don't have that, a public option really is our second best choice. I'm not really sure why people are concerned about having a public option. Over 50% of the residents in this country already have public health insurance. One of the things you have to consider, if you are working for a small business, if you're working in a nonprofit, if you're a Husky parent who's over income, if you're an undocumented immigrant, if you're recently unemployed, it's a very good chance you either do not have health insurance or you do not have health insurance that you can afford to use. So what does that mean? It means you don't get preventative care. It means you don't get early detection of illness. And it means when you finally show up in a hospital emergency room or in a clinic, your condition is far worse than it should have been. The cost involved to the healthcare system is far greater. The cost to the individual is frankly just inhumane. You know, one of the things that I used to do, I actually now have health insurance from my national office. That's only been for 4 years. For over 25 years, it was my job to find health insurance every year for my employees because we're a small business. At the most, we had 4 to 5 employees. Every year, it would be a good year if we only had a 10 or 12% increase in our premium. It was not such a good year when we had 18 and 20. We had a 30% increase one year. So what do? We changed insurance companies. So my staff now has to find different providers. We start shifting more and more of the cost from the employer to the employee. So now I have staff who maybe can't even afford the coverage that we're paying for them. Social workers are essential workers. It's very ironic that those of us who are working in health and mental health care, in many cases, either do not have adequate coverage or cannot afford the coverage. We're delivering healthcare services, and yet many of my folks can't afford to use that coverage. One of the things I'm not sure has been mentioned is sort of the churning effect in nonprofits. Nonprofits and social services constantly lose their social workers and other staff to public agencies. Now, part of that is simply because those nonprofits can't afford to pay as much as a public agency. But you know what? If those nonprofits could have affordable health care and not have to shift so much cost over to the employee, that would slow down the churning. And what that churning does, it not only hurts the nonprofit, but it hurts the clients that are being served. Because if you have a client in social work, it's all about the relationship between the client and the worker. If every year the client has a new worker, it just really doesn't work well at all. So this would actually make a difference. I want to say something real quick about Husky parents. Husky parents who are over income. We know from years of documentation, from years of research, that when the parent doesn't have health care, the child doesn't generally get health care. So we're not just taking health care away from a parent, we're actually taking health care away from the children. And what happens when that parent gets sick and they don't have coverage and they can't get assistance, but they have children to take care of? We need to expand Husky A to 201% of poverty. I also
Stephen,
take
thank
note.
you. Stephen, you've hit your 3-minute limit. If you just want to say another sentence or two to wrap it up, that'd be great.
Sure. So the bottom line I would say is that it's really not a humane system. We need to do better. We can do better. This bill is the bill that will help us move forward and get more coverage and more access to care.
Stephen, thanks for being here tonight. Appreciate your comments. Any questions from the committee? Representative Comey.
I don't, thank you, Stephen. I really don't have so much as a question as just a comment in the say that you know, that the folks that are supposed to be cared for us don't have the care that they need in any sort of manner. So
it's very ironic. I mean, it's ironic that, well, it's more than ironic. I think it's inhumane that people who are providing healthcare services and essential workers are amongst the people who don't have adequate coverage or any coverage at all, particularly in a pandemic.
Stephen, thanks so much for coming on and sharing your comments.
Thank you.
Next up, we have Lauren Millay, followed by Lynn Ide.
Hi, can you hear me?
Yes, we can hear you.
Okay, great. Thank you. Hello, Senator Lesser and Representative Wood and the committee. My name is Lauren Millay, and I am a resident of Norwalk, Connecticut. and also the executive director of Norwalk Mutual Aid, which is a grassroots community organization that popped up during COVID that is trying to ensure equity and a good quality of life for everyone in our community. So I'm speaking in support of the bill SB 842, an act concerning health insurance and healthcare in Connecticut. Because similar to someone who spoke before me, I also have ulcerative colitis, and it's been a journey for me, to say the least, in the past 3 years, trying to figure out what is wrong with me, get diagnosed, do all the diagnostics, etc. And it's expensive. It's expensive and it's stressful. And if you know anything about this disease, stress makes it worse. So I fortunately did not lose my job in the pandemic. I got a new job, which was great. My previous employer had a great health insurance plan, switched my insurance. So I had a moment there where I had to wait, to pause with my new therapy because my last therapy stopped working, as it often does with this disease. And after that, I then had a transition period to my next job, which then put me on their insurance, which was another waiting period. So it's just been a lot of limbo, all while my condition continues to get worse. And so what I feel is very important about a public option is being able, as an individual, to have access to an affordable plan that no matter what happens in your life, you know that you have the same stable insurance. Because even when you do get a new job, you don't know what that insurance plan is going to look like, and you don't know how much your care is going to cost. So the same medication that I was previously on, the next week, I go to fill it at CVS and they tell me it's going to be $300 for 1 month's worth of medication, $300. So I just think that this is a step in the right direction for folks who don't have jobs, which are a lot of people now, thanks to the pandemic, and also folks like myself who are in transition. You want to be able to take on new opportunities and not have to think, can I take care of myself at my new job? Am I going to be able to keep my new job? Because if their health insurance doesn't cover my disease and all of the therapies and screenings that I need for it, you don't know what to do. You're caught between a rock and a hard place. So I really, really encourage you to support this bill, and I think it'll be a great step moving forward. Ultimately, what I would love to see is single payer, but if we can't have that, at least have this as a safety net for folks like myself. And
Lauren, thank you for joining us this evening and sharing your story. I wanted to open it up to the committee to see if there are any questions. I don't see any, but Lauren, thank you for coming and sharing your story with us. It means a lot.
Appreciate it.
Next up, we have Lynn Ide, followed by Izzy Greenberg. Lynn, I do see you. Hi, Lynn.
Good evening. Hello, everybody. Thanks for hanging in there, committee members. My name is Lynn Ide, and I'm the Director of Policy and Program at the Universal Healthcare Foundation of Connecticut. And I'm not going to read my testimony to you, which I've submitted, but I am going to highlight a few things that I'd like to share with you and ask you to think about and offer to work with you on. Really, for too long, healthcare has been elusive, exclusive, and expensive. And I've been working on healthcare reform in Connecticut in one form or another since 1985. And I really want to take exception to some of the remarks that have been made in the hearing this evening that were suggesting to do something that we don't know enough about. I think if you listened to the people who spoke from their hearts today, not the people who have a self-interest in what happens one way or the other, including myself, you would understand why we need to take a leap of faith and do something now about this issue for people. The need for bold action is crystal clear. 2020 laid in plain sight the gaping fractures in the way we deliver healthcare to people in our state. Employment, family status, income, race, and zip code determine who is in and who is out. COVID-19 and racial injustice are both pandemics that plague us all. There aren't a lot of new ideas, and there aren't a lot of questions about what we can do about this, despite some of the things that have been said. There actually are a lot of answers about what we can do about this. The question is, do we have the fortitude to move forward and actually do it? Or are we going to let power and self-interest eclipse the faces and the stories of the people that spoke with us here today and the hundreds and thousands of people around the state who didn't even know anything about this hearing and couldn't be here with us today? Too many residents in our state lack health coverage they can count on. And we believe that Senate Bill 842 offers you a chance to take one giant step forward to meet the essential need for quality, affordable health care. It's not the end. It's not the only thing we need to do. We need to do a lot more, but this is a continuation of our job as advocates and leaders in the state to meet the needs of the people who need our help the most.
Lynn, thank you very much.
I will just wrap up with one sentence, please.
Go ahead.
This bill is built on the promise that our state can use its leverage to help more people find a path to health security and equity. It is a public options, plural, bill that offers employers and families new choices to use their hard-earned dollars for health coverage. Thank you very much. And I look forward to working with you all on this.
Lynn, thanks for your comments. Any questions from the committee? Great, thank you, Lynn. Next up is Izzy Greenberg, followed by Stephen Glick.
Hello. Good evening. I know you guys have been going at this for many hours, so I will be brief. Let's see, I'm sorry, are you hearing me? It doesn't look like I'm showing up here, so I just want to make sure it's coming through okay.
We can hear you. You sound great.
Apologies, thank you. Okay, my name is Izzy Greenberg. I'm from Middletown, Connecticut, and I'm the director of the Middlesex Coalition for Children, which serves to improve outcomes for children and families in Middletown, Middlesex County, and statewide. I'm testifying in support of SB 842, which will make healthcare equitable, dependable, and affordable by creating new public options for health insurance in our state. I don't want to go through all the reasons why. I think that has been reiterated ad nauseum over the last 10 hours you've been here or something, but I will just say that this is an equity issue. It's a women's issue. And I think if we want a strong economy for children, for families, too many people are not getting the preventative care they need. They are taking jobs that are inappropriate for them solely because of health insurance, or that are not paying well enough to support their families so that they can get health insurance. It's a very stressful situation to be just at that line of affordability. And so for the many, many Alice families that are just over the line of qualifying for subsidized insurance, but that is very, very far from being able to afford insurance under most conditions. So I just want to say that for our families, for our children, for our state's economy, I think that that this would be a good move. That's it.
Love you. Izzy, thank you so much. Questions from Senator Lesser.
Thank you, Madam Chair. I just want to thank you, Izzy, for all that you do for families across Middlesex County. Thank you for your testimony tonight.
Thank you so much.
Representative Comey.
Thank you. Hi, Izzy. Good to see you. You in your testimony, you said that you talked a little bit about the out-of-pocket costs. Can you just briefly we touch base on that? Something we really haven't talked too much about.
Yeah, I mean, I have good health insurance, and I got a bill for one of my kids' medications today, and it's $75. And we had a whole conversation in our family, like, is this worth it? Is this a medication that we need? That seems like a lot of money for, and that's a small amount. Some families are paying a lot more. And I have good health insurance, so I am not complaining or making this about me, but I can imagine the conversations that are happening in homes. And I've had conversations with families, family. I think dental is a really big issue too. So I don't want to forget that, because that is definitely a healthcare issue. And that is not covered under so many plans. But, to pay for preventative care, to pay the co-pays, a lot of families are doing that kind of care for their children, which is fantastic, but then foregoing it for themselves. And we talk about this so much in the world of child advocacy, which is, a home. To have a healthy home for a child is not just about that child's health. It's a whole system, it's a whole community. And if the parents in that home, the parents in that community are not able to access health for themselves, if they are totally stressed out, the pandemic has made this all too clear that everyone's right on the edge. So many families are right on the edge. And, to be at that place where you're stressed out, you don't know if you can afford the healthcare you need. So your child might be getting it, but if you can't care for them, so there's that.
We just lost Izzy.
For Alice families especially, and I think this is a percentage of families that is very.
Izzy, we're going to have to go on to another speaker. We have lost you a couple times now. We appreciate you coming. I don't see
much more than, yeah. All right, can you hear me still?
Sorry, yeah, we've lost you a couple times. If you feel free to wrap up.
Yeah, I have kids homeworking on Zoom too.
Oh.
Yeah, listen, it's expensive, and parents are making really hard choices. That's the bottom line. Parents across the board are making really hard choices about what to pay for, and healthcare is extremely expensive, and so oftentimes that is at the bottom of the pile, unfortunately.
Thank you, Izzy.
Yeah, thank you all.
Stephen Glick, I do not see. Is Terrell Williams here? Okay, how about Julie Schubert?
Yes, I'm here.
Okay, Julie, you are up next.
Okay, thank you. So I want to start. I'm Julie Schubert. I'm the past president of Connecticut Benefit Brokers, a chapter of the National Association of Health Underwriters. So co-chairs Lesser and Wood, ranking members, and members of the committee. I'm submitting testimony for the SB 842 on behalf of our colleagues and members. Our organization represents the independent health insurance agents and brokers who work with individuals, family, small and middle market business throughout Connecticut. We advise, educate, and help facilitate the purchase, utilization of benefits. We know that Connecticut needs higher quality, competitively priced insurance options for everyone. However, a public option for small groups, nonprofits, is not the solution. The legislation raises a number of key concerns and questions for us. Therefore, we can't support this bill. We fear a public option will cause disruption in the marketplace with the existing insurance industry and the state specifically as it relates to jobs. The industry is a significant source of employment in Connecticut, not just for those who work in the carrier space, but also for the thousands of jobs in smaller independent agencies that we represent. This sector will suffer with the government entering the market. I also want to point out that the insurance carriers, they have to spend 80 to 85 cents of every dollar that's collected on claims. And then the rest is what they get to keep for admin and profit. So I think that's an important thing to note. The other thing that I wanted to note is that the small groups are pooled. They're pooled together in the book of business that the insurance carrier has. As written, this bill will give the state an overwhelming advantage over the medical carriers that compete. It could cause certain carriers to no longer do business in the state, or worse, leave it altogether. For example, this legislation allows the state to set up a multi-employer participation program. Basically, it's a MIWA. However, our state does not allow MIWA, and we also don't allow association plans that are allowed under the federal law. This creates an unfair advantage for carriers and the small businesses. We have concerns about the consequences of adding a state health insurance tax. Just last year, the federal government recognized the negative impact these taxes had on rates and repealed the tax on a bipartisan basis. We actually saw insurance premiums reduced by that exact tax amount. This tax hike will directly increase the cost of health insurance. The legislation raises questions as to the management of the public option. To date, the state has not demonstrated the ability to manage the current partnership plan. The partnership plan, from what I see, lost $10.3 million in 2018, almost $32 million in 2019, not covered by stop loss. We would expect the 2020 utilization to be good because nobody was utilizing care in 2020. I think the comptroller said it was 94% for the calendar year, which, to be honest, during a pandemic when people aren't using services is not the best either. So I can't imagine the large losses in previous years is solely due to the geographical rating. So I'm not sure that that's going to correct either. I think it's important to note that a number of states that have already attempted to establish similar programs were forced to abandon them due to the financial losses. So can the taxpayers of Connecticut afford to be the backstop for this additional financial risk?
Julie, you have met your 3-minute mark. If you just want to wrap it up with a few sentences, that would be great.
Yep, I just want to say that we do, however, support the creation of the innovation waiver and the high-risk reinsurance pools. And we do think that there is some work to be done around them, but those things we do favor. We would also like to be included in any questions that you guys might have. And I do want to thank you for your time.
Julie, thanks for coming tonight. We appreciate it. Representative Meskers.
Thank you, Julie. That was very informative. So, that last comment, I'm going to challenge you on, not because I disagree, but I want the information. So we talked about 2020 and the MLR of 94%.
Yep.
And you're questioning that. And basically, it's a medical expenditure for 2020 when we're in the midst of a COVID crisis. And the hospitals were in large part shut down. So discretionary spending was shut down. So the normal MLR should be where? And where do you think the private sector was on the MLR in 2020?
So I'm not sure where the entire private sector was, but I will tell you in some of the renewals that we worked on in our middle market or some of our self-funded groups where you could see those claims, we've seen the MLR as low as 70, 60%, 80%. So I will tell you the insurance carrier loves to see the MLR at 80, 85%. So the fact that you're at 93% does not leave a lot of dollars to pay for admin costs and that kind of thing.
So, but look, I think it's a late night. God knows I've been on this forever today.
Yes, we all have.
So definitionally, what you're telling me is that this was the year that should have a big premium capture with low expenditures. So you'd be looking at whatever the rate on a public or private sector plan, that with nobody being able to go to the hospital to use it for discretionary services, you'd be hoping to see 70, 60, 70, 75% as the MLR, and therefore the premium capture and the profitability or whatever required reimbursement would be very high. So it suggests that this at 94% was running at a pretty aggressive underwriting schedule, so that if it had been a normal year, the plan might have been running at a significant deficit.
Yes, that's what I
Okay.
believe.
Okay. So I wanted to not be, I'm not trying to position myself on my vote, to be very clear. I want to understand the numbers clearly. And so that's why I asked you that. So thank you very much for that. I would love to have a follow-up conversation. So if you get a chance, use my public email. I'll send you my cell phone. We can talk offline and follow through and stuff. Okay?
That would be great.
Thank you. Thank you, Madam Chair.
You're welcome, Senator Lesser.
Thank you, Madam Chair. I had planned to weigh in. I was just sort of taken aback by some of the MLR figures that you threw out there. What do you think we should have expected this year in terms of an acceptable medical loss ratio, especially understanding the limits within the Affordable Care Act?
Right. So the first time that I heard the medical loss ratios for 2020 for that particular plan was when the comptroller was giving his testimony. And when you look at the private sector and a lot of your plans, they ran way below 90% utilization because people weren't utilizing the hospitals and those high cost things. So when you're running at 94%, you throw in a couple of hospitals and, maybe some MRIs that were needed and scans and that kind of thing, you could be over that 100%. So that's where I was taken back that, pushing that 94% and then 89, I guess, for the calendar year was what he had said, to me seems pretty high.
And have you reviewed the medical loss ratio experience by the state employee plan over the last number of years?
I have not.
Yeah, I mean, the reason I obviously this has been an exceptional year, and I understand why it's difficult to baseline that. But federal law now says that a carrier can't make more than 80% or have a medical loss ratio of over 80%, which for folks who don't spend their lives talking about insurance law means no more than 20 cents out of every dollar that you pay in premiums can go for administration and profit. And these are for-profit companies that have all reported, or a lot of them have reported record profits this year. I mean, this has been an exceptionally profitable year for the insurance industry in Connecticut and across the country. But compared to any other line of work, 20% margin is a lot. And I just am, I'm a little bit skeptical of a claim that's the ceiling, not the floor. I think we can do better, and I think that the comptroller's plan and other plans, and not explicitly his, have done a lot better than just simply an 8% MLR consistent. Acknowledging that the 2020 was an atypical year in absolutely every respect.
Right. And don't forget that 20% goes back to pay salaries for people living in Connecticut, and there's a tax base on that. So, plus there's monies that go back into cities and towns and all of that from the carriers as well. So, I think there are partners, and having the state try to be an insurance company and compete with our carriers, I'm just not sure is a great idea. The other thing that we talk a ton about affordability. I don't see any pricing on any of this legislation. So I hate to think that you get 100% down the road and we pass this and then we look at rates and they're not affordable. So that's a major concern.
Of course. And if it's unaffordable, then it will have no impact on the market whatsoever because nobody will buy it. And that, I think, it sort of will have its own logical conclusion. But hopefully, this will have all been a wasted effort if that's the case. But we'll see. Thank you very much for your comments. I think that sums up my question. Thank you, Madam Chair.
Thank you for your time.
Representative Nuccio.
Hi, good evening. Thank you, Madam Chair. Good evening. So I just wanted to kind of clarify something that I just heard and make sure we're continuing to use the correct terminology here. The 80% is on individual market and 85% is on the non-individual market. But I want to be very clear.
Actually, 80% is small group, and then the 85% is large group.
Okay, so the key thing here is that it's not a 20% profit. approximately 3% profit that the insurance company gets in any given year. Is 20% to cover all administration of the entire thing, including provider networks and everything else. So just making sure we're using the correct terminology, right? So thank you for clarifying for me the 80 to 85, the small. I was thought 80 was on individual, but thank you for clarifying.
Julie, thanks for coming out tonight. We appreciate your comments.
Thank you. Thank you for your time.
Great. Caitlin Shake is up next, followed by Diane Keefe.
Hello, good evening. Can you hear me?
We can hear you.
Okay. Well, thank you for having me. My name is Caitlin Shake. I reside in Stratford, Connecticut. I'm a full-time registered nurse, and I support SB 842, an act concerning health insurance and healthcare in Connecticut. We're in a healthcare crisis, and the lack of dependable and equitable access is hurting Connecticut residents. Even before the pandemic, 51% of Connecticut residents struggled to afford their healthcare, and 43% of Connecticut adults reported foregoing or delaying care because of cost, leading to a workforce that is less healthy and an economy that is less robust. During 2020, because of the pandemic, unemployment rates have skyrocketed, and thousands of workers and families have lost critical coverage when they needed it the most. Healthcare costs are a key driver of Connecticut's high cost of living. Reducing healthcare expenses, especially for low and middle income residents, will expand the state's economy and ease the financial burden on Connecticut's families and small businesses. Currently, as an individual, my health insurance plan through my employer has a deductible of $3,500 for tier 2 treatment and $5,000 for out-of-network access. If I had a family plan, my annual deductible would be $7,000 as an individual and $10,000 for tier 3. In the late fall of 2020, I had an unexpected health event and required medical evaluation. It was a weekend, and I spent an hour looking up and contacting healthcare offices that were open and accepting patients. Eventually, I realized my options were limited and resorted to finding an urgent care facility categorized as a maximum savings participant. According to my health insurance plan, the only location designated as such was in the state of New York. With the limitation of maximum sites in my vicinity, I ended up at the third location I found because the other walk-ins said that they were unable to accept any more patients that day due to the influx of people coming in seeking assistance due to COVID-related health issues. Once I was able to find a location, I spent 5 minutes with the provider and I ended up with a $100 bill. When I was referred to a specialist after that appointment, there was only one provider within 50 miles radius of my home. After finally being able to schedule an appointment, my visit required a full evaluation and multiple tests. Thankfully, since I was able to be seen by a maximum savings provider, I was responsible for only my copay. However, if I was only able to be seen by someone classified as a standard savings or tier 2, I would have been responsible for the bill in order to meet my annual deductible, on top of a nearly $3,000 premium that I'm paying annually. Flash forward to my annual eye exam, which I had a month later with my eye doctor of 15 years. And during the exam, one of my metrics was abnormal, prompting the eye doctor to conduct several tests and schedule a follow-up for another round of testing. The bill sent to me stated that from the 3 additional tests done, my bill was almost $1,000. I was shocked. The eye doctor informed me of additional testing necessary to provide a proper diagnosis, which was, and just for the record, it's not in my testimony, but the way that they coded it was through my medical insurance and not through my eye coverage, which for many people is separate.
Caitlin, you have reached your 3-minute limit, so if you just want to summarize your final comments, that'd be great.
I, like many other residents, and as a nurse working on the front lines during the entirety of this pandemic, which is ongoing, did not return by the suggested date until I was able to figure out how I was going to pay off the bill from my first visit. What working class or middle class family can say that they like or love or can depend on their private health insurance plan or that it's dependable? What individual or family can say that it is affordable, that it works for them or allows them to seek the medical care that they need in a timely manner? They don't. Our state government needs to do better to protect and promote the health and well-being of our residents by supporting SB 842, a public health insurance option that will be truly affordable for working and middle-class residents, expanding accessibility to our residents and increasing providers in the networks. It ensures equity to combat the healthcare disparities leading to negative and fatal health outcomes for communities of color. If living through this pandemic, witnessing Connecticut residents suffer and die has not helped any members of this committee to evolve and understand the urgency and need of expanding healthcare affordability and access, I do not know what is going to actually motivate you. The time is now to support and pass SB 842. Thank you for your time.
Caitlin, thank you. And thanks for staying with us so late. Any questions?
I just want to make a comment. I know I'm not supposed to, but I think that having this, public testimony via Zoom is great because I worked all day. So I just threw my name on the list to possibly testify and got home, and I'm 76. So I got to do this instead of driving all the way up to Hartford. So thank you for doing it.
Yeah, we're hearing a lot of good feedback. I'm glad it worked for you. Thanks for coming. Okay, next we have Diane Keefe, followed by Stephen Heffer.
Hi, I'm Diane Keefe. Thanks for listening this evening. I will be brief. I live in Norwalk and I support SB 842. I was Director of Business Development for a New York City-based healthcare services company that provides on-the-job enrollment assistance to employees of large and medium-sized companies whose employees qualify, in some cases, for Medicaid and CHIP. For the past 35 years, I've been worked in the private sector in the financial services industry, and it was only in the most recent 6 years that I spent time in the healthcare sector. My company worked as partners with health insurance brokers, but I cannot tell you the number of times a health insurance broker found out about what we did and decided not to work with us to show our solution to their clients because it would take revenue away from them as their group that they insured declined. So I hope you take the testimony from health insurance brokers with a grain of salt this evening. Companies in the restaurant industry, in the childcare industry, in the grocery store industry, retail, hotel, and nursing home sectors were our largest customers. You might notice that these businesses are not the highest margin businesses in our country, but they do provide essential services and their employees need healthcare. Many of these employers were offering high deductible plans, but they also offered bronze and silver plans, but their low wage employees could only afford the highest deductible plans. So many times they would choose to reject those plans, and that's when the employers would bring our company in to help them see if they could qualify for public coverage. There are many working poor people in the United States and in Connecticut, of course, that qualify for free public health insurance. So I do support the provision that increases a family of four's eligibility to $53,000 from its current slightly over $36,000. Connecticut is among the 48 states in the United States that require someone to have a green card for 5 years in order to qualify for Medicaid or CHIP. In California or New York, you can have a green card for 5 minutes and qualify. So we are already limiting coverage in many ways, and I support every measure in this bill that would make it easier for working people to qualify. It's a market failure that we have so few affordable options for people, and saying that the insurance companies are limited to 15 or 20% for administration and profit is really, I don't think, strict enough when you're delivering an essential service like healthcare. We need to do better, and I think the public option will do better. And if by any chance the public option costs the state money in some cases, I will note that the state budget is projected to be in a surplus this year because of the smart taxation of capital gains, which even though so many people have lost their jobs and are suffering financially, the stock market is managing to keep the state of Connecticut able to afford a surplus. Now is the time, with a pandemic on our hands, to ensure more people and not let any more people go through the cracks by having it only associated with being employed. Also, I would point out many.
You've just hit the 3-minute mark, so if you just want to do your final comments to wrap it up.
Sure. I just wanted to highlight that the largest businesses have self-insured and have been able to purchase stop loss coverage. So the state of Connecticut, thank goodness, has attracted $60,000 to their 60,000 employees to their partner plan. And I hope that they attract at least 60,000 more to this plan once it's passed. And if it isn't passed, I would hate to be the senator or Republican who, hate to be the senator or a General Assembly member who votes against it, because it really is not in the service of the people of Connecticut. Thank you very much for your time, and thank you for being patient.
Thank you, Diane. Do we have any questions from the committee for Diane? Diane, thanks for spending so much time with us to deliver your comments. We appreciate it. Next up, we have Stephen Heffer, followed by Brendan Peppard. Is Stephen here? Okay, is Brendan Peppard here?
Yes, I'm here.
All right, Brendan, you're up next.
Great, thank you. I'm Brendan Peppard. I'm Regional Director for America's Health Insurance Plans here in the Northeast. Chairs, members of the committee, it's been a long day. Thank you very much for the opportunity. I'll just hit a couple of the points, since several of the other people before me made a lot of the points I would make. I'll say one thing: that our healthcare system does work for millions of Americans today. We've heard a lot of stories, however, about people today for whom it does not work. We know that premiums are out of reach for a lot of people. And we also know that aspects of our system can and should be improved. But a one-size-fits-all government insurance system is not the answer. Bluntly, a public option would lead Connecticut citizens to pay more, to wait longer for worse care. Proposals such as the one being discussed will have significant unintended consequences. Let me just hit 3 points. The proposal is anti-competitive. We've heard this. Public option would have a distinct advantage over traditional health plans, in which it would be in direct competition with. It would likely force providers to accept below market rates or unfairly subsidize only this coverage with taxpayer dollars. Providers may be forced to raise their rates in contracts with other providers, other products, to cover their losses from participating in this public option. We've heard several of the providers talk about how you can't reduce the rates to a Medicare equivalent rate. And third, patient access may be adversely affected. We've heard some of this as well. Rural hospitals particularly, and providers serving rural communities may not be able to sustain large blocks of business at below commercial rates. We believe there are policy solutions that exist that build on the best of both the private and public sectors that can improve affordability and coverage for all Connecticut residents. Further, if providing subsidies is a priority for the legislature should fund it through general fund dollars or some other broad-based source, not through a tax that helps one segment of the population at the expense of another. And let me, instead of going into my concluding remarks, hit question that Senator Lesser raised earlier. The Supreme Court ruling on risk corridors was not a windfall for the industry. Despite those payments, health insurance providers who received those payments will never be made whole for the losses they sustained in the early years of the ACA. The risk corridor program was designed to partially make up for those losses, but not to make them whole. The risk corridors program was designed means that even when these payments are made under the formula, health insurance providers bore 100% of the losses above that threshold. All right, and so I'll stop there and see if there are any questions. It's been a very long day. Thank you.
Thank you, Brendan. Senator Lesser.
Thank you, Madam Chair, and thank you, Brendan, for your testimony. I appreciate the clarification on or of the industry's position with regard to the risk corridor verdict, I guess, from the Supreme Court. Can you just clarify? So, since that program went away for those, I guess for the three, I think there were 3 years that were affected in Connecticut by the absence of that program. Did Connecticut policyholders pay higher premiums than they would have otherwise had to because of the absence of that program?
To some degree, that's a hypothetical question, Senator. I have difficulty answering it because we just don't know. That money was not paid back to the carriers. It was supposed to be. That, as you know, that was designed as part of the ACA as a startup program. No one knew how the ACA was going to perform in the initial years. And in fact, for most carriers, it performed poorly. Some carriers did make money and they had to share some of that money back, and they did. They made their payments back. So this particular settlement was just enforcing the existing ACA rules, which should have been followed back in 2014 through 2016. So to answer your question, I can't say whether carriers would have rated differently. I just don't know. I don't know the answer to that.
But I think the purpose of this program was to drive down premiums and costs for insurance policyholders in Connecticut and across the country. And in the Supreme Court opinion, it's directing over $12 billion to the nation's insurance carriers. And yet, as far as I can tell, we're not getting the rebates that we would sort of expect if that program had been in place during the years of the disruption. And I don't mean to, this is not in the bill. I don't mean to distract the committee from what actually is in the bill. I think that's important. But I was struck in the beginning of your testimony by discussion of subsidies and a one-size-fits-all government-run program. I think those are your words to a T. And the reason I'm mentioning it is because the only subsidies that I see in the bill are directed at your industry, and the only subsidies that I've seen litigated in the courts were $12.3 billion that just arrived in the coffers of your carriers, which I'm not saying they weren't entitled to under the law, but those are subsidies that exist as a law. So, as we look at the landscape, I think we have to recognize that there are subsidies. There's subsidies for private carriers to underwrite insurance for the residents of the state. And the conversation here today is exactly how do we fine tune them to maximize affordability. The only plan that is not asking for a handout, as far as I can tell, I listened to the comptroller's words carefully, and I didn't hear him ask for $1 in subsidies. But I am hearing you discuss the best way to come up with subsidies for your industry, and I'd be interested as well in getting some more clarity as to whether or not the policyholders from 2014 to 2016 in the state are owed a refund at this point.
So again, Senator Lesser, those would not be rebated dollars. Rebated dollars occur when a carrier exceeds the MLR threshold. These were carriers who lost money, which means they didn't just exceed the MLR threshold. They, in many instances, exceeded well over 100% MLR, meaning they had absolute losses. And so this was designed to not so much subsidize the industry or reduce costs. It was a risk corridor program is designed for a new market to ensure stability and encourage entrance because there's so much uncertainty and rating is so difficult. The subsidies you're talking about in this legislation today aren't for our industry, they're for the individuals to purchase premiums. As we've heard many people talk about today, this doesn't get at the costs. This gets at an attempt to set premiums at a level that people can afford. And I'm not going to dispute that. We've heard testimony today from many people who say they can't afford the premiums. Health care costs a lot, and it's the cost of health care that goes into the building of the premiums.
So just with respect to the risk corridor, since you you did bring it up. I feel.
I brought it up because I was trying to answer your question.
No. I appreciate that, and I'm interested in the issue. The risk order payments went both to carriers on the exchange, but it also went to a number of carriers that are not on the exchange. Is that right?
That is detail I don't have at present. I'd have to. We'll follow up with you.
Thank you very much. And if you have details specifically about risk order payments received by Connecticut carriers operating in Connecticut on their Connecticut books of business, that would be really helpful as well for the community.
Okay. I'll see what we can find.
Thank you very much. Appreciate it.
Brendan, thanks for your time today.
Certainly.
Tom Swan is next, followed by Zena Bennett. Tom, are you there? I could see you. I just can't hear you.
Yes, finally I'm here. Good evening, Representative Wood, Senator Lesser, other members of the Insurance and Real Estate Committee. I want to thank you for putting in 11 hours already on this important bill. And I think the reason you're seeing so many people continue to line up and to participate is because the importance of this and how desperate they are to see a real public option here within the state of Connecticut. I'm the executive director of Connecticut Citizen Action Group, and on behalf of our thousands of members throughout the state, I want to commend you for raising Senate Bill 842 and voice our strong support. Others have talked about how the current pandemic have helped to make the case as to why this is even more urgent. And we've heard from so many people today about just how evil high deductible plans are and how they don't provide people real security on the healthcare system and how the lack of affordability is actually costing people's lives in this country. We strongly support the proposal to allow the Comptroller's Office to design and offer an option for small businesses, nonprofits, and Taft-Hartley's. I've heard some people question about whether or not this is the proper role for, the role of government versus markets. Connecticut has done this before in other areas. We established a procurement office for energy several years back when cost of energy were going through the roof. And we heard the same arguments we're hearing from insurers and industry types about how terrible this was, but it wasn't. It not only made the standard offer for people more affordable and better, it forced a lot of the bad actors in the retail energy market to start to behave better and to offer better rates and cost less money. Nobody can justify the $2 billion in stock buybacks that Cigna had this year. Stock buybacks, $2 billion, but our premiums and copays go up every day. A public option will make it more true and force these companies to actually compete instead of being on a scam that pushes things off more and more to individuals. We strongly support the proposal in this bill to restore Medicaid to 201%. And as Meryl Gay brought up earlier, how it would be very helpful for parents to know, for more children to be covered when their parents had the same, and for the parents to have the exact same coverage. It makes no sense that we're not taking full advantage of this plan that has no copays and no out-of-pocket expenses. The proposal in this bill that would make healthcare affordable for undocumented residents in Connecticut is not only the morally correct thing to do, it is a smart thing to do in terms of public safety. From the pandemic, we all know that if we don't all have access to healthcare, then we're all at greater risk at times like this that go on. We agree that the plans on the exchange are too expensive and that high deductible plans make access to care impossible for too many. We have some concerns about financing and how this is structured, but any increased subsidies cannot go for high deductible plans. It will just give more money to insurance companies and create a false sense of security for families that go on this.
Tom, you hit your 3-minute mark if you just want to wrap up your comments.
Yeah, the last thing I want to do is the dishonesty that we've seen by many elected officials, and particularly the entire Senate Republican caucus, in sending out emails that misrepresent what's included in this bill and encouraging their constituents on their publicly built email list to participate and send in testimony opposed to this legislation, where they have misrepresented and said people are going to be forced on Medicaid, is shameful. And it's not the type of practice that should be allowed in Connecticut, and we should discourage it. Thank you for your patience. We support this bill because it will address inequalities in our healthcare system and strengthen Connecticut's economy.
Thank you, Tom. Appreciate you waiting to speak. Any questions for Tom Swan? Great, thanks again. All right, next up, we have Zena Bennett, followed by Chris Ipantima.
Good evening, Senator Lester, Representative Wood, and members of the Insurance and Real Estate Committee. My name is Zena Bennett. I am a certified nursing assistant at St. Joseph's Manor in Trumbull, Connecticut. I am also a proud 1199 delegate because through the union, I have been able to have a voice in the workplace and at the Capitol. I am here today to testify in support of SB 842. I currently live in Bridgeport with my 2 sons. I became a CNA because I believe in preserving the quality of life as best as I can. I value the work that I do, and every day I try to make life for my residents as easy as it can be. My oldest son is only 13 years old and suffers from chronic asthma and some very complex GI problems. My son's asthma medication cost has gone up due to the change in his condition and the change in the type of medications that he has to take. He now has to take 2 different types of medications every day. For one of them, the cost is $120 for a 30-day supply. And now the pharmacy says that the doctor has to make the prescriptions out for a 90-day supply only. The other medication cost is of $30. As for myself, I've been diagnosed with seizure disorder in the past 2 years. My seizure medication cost is $70 for a 30-day supply. I cannot afford that much for medicines on the salary I'm making, and yet both my son and I need these medications to be able to survive. My employer, Genesis, recently switched their healthcare plan again, but my children and I are still not able to see all of the doctors that we need to. For one, the copays are still not good at all. For example, it cost me $55 to see my primary care doctor and $60 to see a specialist. I can't continue to go on and try to afford all these costs on top of the medications and the specialists. It's just not feasible. It's not feasible. And it's really hard and it's difficult with somebody who has these medical issues and who has a child who has medical issues and still not be able to, like, you work hard all the time, you're sometimes doing doubles or have to get a second job, and it's still not enough. It's really not enough. I know there was more to my testimony I submitted, but I get emotional thinking about it because as a mom, I have to make certain choices when it comes to this.
Well, we understand the emotion, and we appreciate you coming and sharing that with us because it means a lot to hear your story. So I just want to say thank you. I know it's late, but thanks again for coming. Do we have any questions from the committee? Senator Lesser.
Thank you, Madam Chair, and thank you, Zena. I know the hour is late, but I want to thank you for your testimony and for sharing your family's story. I don't know that this bill would solve all of the problems out there and help every family that needs healthcare but can't afford it. But I will point out that some of the parts of this bill will really, I think, speak to your situation. And one of the issues is you mentioned your son's asthma. One of the issues is whether or not People who have high deductible plans can get asthma medication without having met that deductible. And the bill says that, at least on the exchange plans in Connecticut, if this bill were to pass, people would be able to get their asthma medication without having to worry about a deductible. So your story matters, and the stories of other people who've been here tonight and waiting many, many hours matter. And I want to thank you for sharing that story. And maybe it'll make a difference, but thank you.
Thank you guys for hearing me tonight. Have a good night. Stay safe.
You too. Thanks for coming.
Thank you.
Chris DiPatina from CBIA, followed by Michael Goldstein.
Thank you, Chairperson Wood. Can you hear me okay?
Yes, I can hear you okay.
Okay, Chairperson Flesser and Wood and members of the Insurance and Real Estate Committee. My name is Chris DiPatina, and I'm the President and CEO of CBIA, the Connecticut Business and Industry Association. Here with me is our Assistant Counsel, Wyatt Bosworth. I've submitted written testimony, so I'm not going to read that here, and I'll use my time instead to remark on some key points. CBIA, as many of you know, is Connecticut's largest business organization with thousands of members, small and large, from across our state, representing a diverse range of industries and employing nearly 500,000 Connecticut residents. 95% of our member companies are small businesses with less than 100 employees. Prior to joining CBIA in August, I spent the last 20 years owning and leading small businesses in Connecticut, including my family-owned manufacturing business in Middletown, Pegasus. I've also sat on numerous trade association boards, and as a result, I've interacted with thousands of small businesses from across our great state. I can confidently say that on behalf of the small business community, we oppose SB 842. A state-run health insurance plan, as proposed with this bill, will destabilize the health insurance marketplace, require taxpayer and/or employer subsidies to finance the program, and negatively impact an economy already struggling to rebound due to the pandemic. There's no doubt that the rising healthcare costs are a major issue. In a recent survey of our membership, 98% of respondents reported they were concerned with rising healthcare costs. However, our members disagree with this bill that it's the best way to address these concerns. 69% of our surveyed respondents oppose the concept of a public option, which affirms what I've also heard from numerous small businesses. The concerns are supported by the performance of the municipal plan, which in 2019 ran the deficit of 31.9 million, more than tripling the losses it incurred the previous year. The bill attempts to alleviate Connecticut residents from being the backstop by authorizing the comptroller to establish a risk fund to pay claims that exceed premium payments, which will then have the small employers underwrite the fund. Also, unlike private carriers who are bound by the guarantee issue, the comptroller will have the authority to approve or deny applicants at will. The cherry picking of risk groups will destabilize the market and rates and rise significantly, adding to the already burdensome premium costs. CBIA is working to advance common sense bipartisan solutions to rebuild our economy. However, this bill, if passed, will hinder that mission by handicapping one of the state's largest economic drivers. It is exactly these type of bills that increase our costs and prevent Connecticut from generating economic growth needed to create budget surpluses so that we can fund critical areas like our cities, education systems, transportation, social services, among other things. While CBI members disagree with the approach taken under this bill, we remain committed to working with you all to bring much needed relief that the current healthcare landscape demands. There are a number of bills pending before the committee that do this, and CBI welcomes the opportunity to work with the committee to make healthcare more affordable for Connecticut small business owners and their employees. Thank you for your time.
Thank you. Senator Wong.
Thank you, Madam Chair. The hour is long. I'll get right to the point. Thank you very much for your testimony, Chris. Let me go through your testimony and talk about the survey that you did, where 69% of your respondents oppose the concept of the public option. It seems to run counter to a survey that the Controller Lembo has, promoted that said 72% of small businesses support public option. How do you reconcile that?
Well, I think for that question, I think it's a great one. And I think it's all on how you ask the question. I think the comptroller's responses was all about businesses wanting to solve the high cost of healthcare, which is no doubt businesses want to do that. But Senator Wong, whether the public option is the right avenue is how you ask the question. And we had an overwhelming number of respondents that said no for a variety of reasons. One of the reasons was 50% don't trust the state to manage a health insurance program. 57% said they were concerned that taxpayers would subsidize the plan. I don't think those questions were asked in Comptroller Lembo's survey.
I think you're absolutely right, because as I said earlier on this morning, the fact that everyone virtually agrees that we need to contain cost and that affordable, accessible, and quality health insurance is what everybody desires. It's how we get to it. And I really appreciate your clarification on that. That's extremely helpful. The other thing that I also noticed in the testimony was the fact that I raised it with the controller, that unlike private carriers who are bound by the guaranteed issue and oversight by our insurance department, this bill and the powers afforded to the controller would really allow them to approve or deny applicants at will. I mean, even the controller used the word cherry pick. Risk groups is definitely a concern that I have. And I always point to one of the great things that happened relative to the Affordable Care Act, which is the fact that people with pre-existing conditions will now be able to get coverage. Under this possible language, the fact is you could approve or deny individuals. It really creates a risk that it is not all that it's promised. Your thoughts on that?
Yeah, that's our point about destabilizing the marketplace, right? We could swing the marketplace radically here if we're cherry picking individuals. And there's been a lot of testimony today. We've had a chance to sit in and listen to most of it about rates going up and the need to address that. A lot of those rates going up are the experience rating. And so if we're cherry picking and a lot of going to the state plan, we're going to have a lot of folks who are high risk out in the private market space, and that's going to increase premiums for a lot of employers.
Yeah, thank you. And I'll get right to the point that I'm really appreciative as a business leader and a small business, family-owned business. You're about solutions. So am I. And I think the two solutions you posed were to take a look at cost growth benchmarking and planning, just like what we did in Massachusetts, maybe do it better, but to benchmark and get some parameters and measures that are real. Can you talk a little bit more about that?
Yeah, Wyatt knows it better than I do, if you don't mind, Senator, and he'll jump in here. He's been studying the Massachusetts plan.
Hi, Senator. How are you?
I'm great, thank you.
Good. So Wyatt Bosworth, Assistant Counsel. CBIA has supported benchmarking initiatives proposed in the past. We were extremely happy to see the governor's executive order number 5 signed last January. And this really goes to the issue of trying to control cost, because until we can get a grasp on controlling the excessive rate of cost growth in this state, we could shift as many lives as you want into as many pools as you want and subsidize them with as much money as you want, but it's not going at the root issue. The root issue is cost. So I won't go into too much detail about the Massachusetts plan, but I can tell you that in Massachusetts, they have really served as a model for the rest of the state and holding health insurance companies and health providers accountable to meet their benchmarks. I can tell you from 2012 to 2018, they had an aggregate cost growth that was below their established benchmark, which is impressive given the fact that the state never had to issue any performance improvement plans, meaning that they didn't actually have to penalize the insurance companies for going above that and holding them accountable. And that's just amazing because it's delivered billions of dollars in premium savings to the residents of Massachusetts. And I think the Office of Health Strategy is doing a really amazing job at getting that executive order off of the ground right now. But I think there's a number of bills before you that would codify that and resist any future patchwork that may be done. I'll give you an example, Senator. Vicki Beltry came to us a couple months back and asked us about the potential to add employer workers' compensation claims to the All Payers Claim Database. And we absolutely support that. And we're working with our property and casualty companies right now, the Insurance Association, to get that data up on the APCD so we can begin examining those costs. So that's number one. And number two, I definitely agree with the aim of the proponents of this bill. Or I should say CBIA agrees. We have a serious donut hole problem on the top and bottom end of the exchange right now. Expanding Medicaid certainly helps cover that. And of course, providing subsidies to people on the higher end will do a good job at reducing their individual cost. But unfortunately, with such a broad-based assessment on our fully insured, self-insured, and individual marketplaces, it's going to be the insured individuals and groups at large picking up those costs. So I think a better way to go about it is what you folks on the Republican side of the aisle and what Governor Lamont has signaled support for, along with Speaker Ritter wanted to study it further, was the concept of a reinsurance program, right? So with a reinsurance program, once again, we're going after a root cause of a lot of the problems with health insurance right now, and that's high cost catastrophic claims, right? So if we could get the money together in the state budget to at least start up the fund, looking at the Wakely study that was commissioned last year, 57% of the money that we put up has the potential to be reimbursed through pass-through funding through a 1332 waiver. That's a big deal. And states like Alaska, who were on the edge of a death spiral in their own markets, instituted similar reinsurance programs, and it saved them. And I think it would provide broad-based relief to a lot of the people who are hurting right now. That being said, too, Senator, getting control on the mandates we pass, the assessments we pass. You have a bill today that nobody spoke in favor of. I submitted testimony on it. House Bill 5013, which would reform our mandate review process by allowing this committee, or I should say the insurance department, to contract with private actuarial firms to do that analysis and lower the cost for that. I think that's a good step into reviewing future mandates, because mandates add over $2,000 a year on average to premiums. So between getting a fix on what's driving the cost of healthcare through a robust benchmarking program, by providing broad-based premium relief, by a robust, well-funded reinsurance program, and holding the line on any future assessment and mandates, I think we can do a good job at least getting a start on fixing this problem.
Well, I appreciate that. And you talk about Massachusetts, and there are things we can learn from Massachusetts, and there are things that I believe we could do better than Massachusetts. Massachusetts does not have a public option program, does it?
No.
The answer is, I'm sorry?
No.
It does not. Thank you. If I may, I want to refer back to, in doing my homework, a issues and policies report that CBIA did in April of 2019. And I found it interesting where you talked about Connecticut state-run health insurance ideas, and for us to take a lesson from Kentucky's lesson of racing to have a public health insurance state-run program. Do you remember that plan, or do you recollect it?
You're talking about the Kentucky plan or our internal report?
No, you had a policy report that the title Kentucky's Lesson for Connecticut on state-run healthcare plans.
No, Senator, I apologize. I'm fairly new on the job here. I haven't had the opportunity to look at that report yet.
Well, I am eager to talk more about it, but I'm sure we'll have more opportunities. I really appreciate the insight that you provided and the leadership that you have in representing businesses. But it's also important that you don't just represent businesses. You represent businesses that employ people, that have a viewpoint of people that all clamor for cost-effective health insurance. And I'm appreciative that as you raise some questions on this bill, you also compliment it. And that's important for us to come away with, but also providing some solutions to addressing the unified challenge that we have to contain cost and be able to give healthcare insurance to everyone. The testimonies we all heard this long day has been compelling and very emotional. And I do believe it is a common thread that we all have, Democrats and Republicans, business owners and entrepreneurs and nonprofits, that we all have a right to quality and affordable and accessible health insurance. That being said, I think I've energized some of my colleagues at 10:30 at night. So through you, Madam Chair, thank you so much. And I want to compliment you for your remarkable leadership on this public hearing today. So thank you very much, ma'am.
Thank you, Senator Wong. Representative Nuccio.
Thank you, Madam Chair. So I'm going to ask, I'm actually going to ask the comptroller the same question for the same background. Could you possibly provide your survey, the results of your survey, and if you could, the parameters of who you asked? Because I think it's important for your survey and the comptroller survey to be reviewed and looked at, because one thing that I'm always looking for in is the compromise and where we get to the middle, because I believe that there are more of us in the middle than there are on either of the extremes here. And there was something that was said a few times tonight that I kind of take exception to. It was stated that the people who were asking questions or pushing back on any of these assumptions were advocating for the status quo or leaving things the way that they are, which I don't think I heard a single person say tonight. And I think it's very important that that gets called out as not really fair or accurate. I think for us to be able to really look at this, we have all said that the cost of healthcare needs to be reviewed, and we need to find a way to bring that down, because healthcare is what drives insurance. So in essence of being able to look at that on both sides, I'm asking if you would be willing to share your survey, the parameters in which you asked your survey, and the populace, and also if you have any more information on the benchmarking, because I've heard that come up quite a few times, and I know probably barely enough to maybe be dangerous in a low-level conversation, but I'd like to understand a little bit more about what's going on and whether or not it's truly been successful, and if we've given it time to kind of percolate and come back to give us some good results.
Yeah, Representative, absolutely, we can get you those survey results. You know, in normal times, you know, we usually use these surveys as a way to gauge our membership and help them inform us on how we should be lobbying during this session. We don't traditionally release those results, but I think given the fact, you know, with the poll, the ALG poll that came out, another poll that was in the HBJ, you know, we felt we needed to share the results of our members and give them a voice. So I think, you know, first thing tomorrow, I'm definitely going to work on getting that together for you and the rest of the committee.
I appreciate that. And can you again just refresh my memory? How many small businesses or how many small businesses and how many employees do those small businesses employ that you represent?
Well, in our membership representative, we have over 4,000 businesses. 95% are small, so we could do the math for you if you want. And like I said, we about 500,000 employees in our total membership. So we're a large organization. We're the third largest business organization in the whole country.
And it's fair to say that you would like to review the cost of healthcare and finding better options for your members.
No doubt, and that's what the survey said. Our 98% of our membership wants to lower the cost of healthcare, and that's why we want to work with you all. We've had these other solutions that we just think are a better pathway than the public option, is why I talked about.
I appreciate that. So am I. So I look forward to getting the information on your survey, and hopefully I can get the same thing from the comptroller so we can review it. Thank you very much.
Thank you, Senator Lesser.
Thank you, Madam Chair, and good to see you, Chris and Wyatt. And I got to ask before I get into the real questions, that's 6 feet between you, right?
We made sure of it.
We measured, yes.
All right, just want to make sure people are safe. One, I did hear, I think it was Wyatt, you mentioned that the CBAA would support I forget the exact words you used, but a robust, well-funded reinsurance program. Is that right?
Correct.
Okay. You mentioned the Wakely report. Would you support a program that would achieve the kind of savings that I think Senator Kelly mentioned in the press conference yesterday, 20% savings?
Yeah, I mean, we're looking, I have the table right here. For a 20% reduction, I think the Wakely report cited a $77 to $85 million upfront cost, and that would trigger upwards of $115 million in federal pass-through funding. That's something I think that really dependent on what the federal government gives us in aid and our budget numbers come the new report that's coming out soon, something we should certainly look at as a way to at least maximize our reimbursement avenues.
That was what my memory of the report too, is that was what Wakely had anticipated that kind of savings would cost. How would you suggest we pay? I mean, that would just be for plans offered on the exchange for individual policy holders. That would be something like $81 million, $85 million. How would we pay for that?
Well, I think if you look at a number of other states like Alaska, they've been able to contain cost at the same time as run a robust reinsurance program, and the program's paying for itself through pass-through funding. I think that's what proponents of reinsurance would like to see, is to create a program that eventually, has the level of reimbursement through a 1332 that would become self-sustaining eventually. But you're right, Senator, it's a tall ask for $77 million right now. But we certainly think that would be better than levying yet another assessment on all plans throughout the state. You heard the health plans say today that they're at the breaking point for assessments. People are assessed annually upwards of $600. It's a lot of money that these taxes and assessments put on payers, insured individuals and businesses. So we can start with a 5% reduction or a 10% reduction. Obviously, we're talking, for a 5% reduction, we're talking about $20 million, 10%, $38 million. But I guess that's your job, not mine, is to find the source of the funding.
Yeah, I agree with you. I mean, paying for programs is hard. That's what we do in this building. I mean, we're not in the building, but when we are in the building, that's what we do. And it's hard. And that's what the assessment or the user fee in the bill attempts to do. I understand it's better to say, hey, we don't have a pay for than to say that we do have one, but we're trying to be responsible. We're trying to have that conversation, whether it goes towards subsidies or reinsurance. I think we can have that conversation and work with you and your members and all the stakeholders to figure out the best way to pay for it. But you got to pay for government programs. You can't just, assume that the money comes from somewhere, because that we have really tough fiscal realities. And I think that just as probably better than I do. So I appreciate that. One last thing. I know the hour is late and there's still other folks that testify, and there are other folks who want to ask questions. But you surveyed your members. The Hartford Business Journal, that was a scientific poll. I'm assuming your survey was not a scientific poll. Was that?
It wasn't. No, it was just raw feedback from our members. Like I said, we didn't expect polling to be done on this. So, we thought the best information we had was direct responses from 260 of our members. And we thought it was worth sharing because it was worth at least sharing their voices. But we totally understand that there's absolutely no scientific means of collecting this data. It's just raw feedback from our members, but I think nonetheless useful for you as you deliberate.
Absolutely, and I appreciate that. I just wanted to clarify that. Thank you very much. It is very, very interesting, and I, like Representative Nuccio, I'd love to see that as well.
Sure. Yeah.
Thank you very much. Thank you, Madam.
Representative Farrar.
Thanks, Madam Chair. Thanks to you both for being with us at this late hour. Just to kind of clarify some of your comments earlier, is there anything in Senate Bill 842 that you do support?
I think we support the concept of providing relief to people wanting to join the exchange. The question is, do we do that through an assessment or a general fund transfer? I think the other thing that we certainly are optimistic about is the expansion of the MedConnect program. You know, a lot of our members employ workers with disabilities. And if we could figure out a way to make that easier for, you know, employees, for disabled people who want to work, but maybe have over $10,000 in assets, which is the case for a lot of people. That number is too low to begin with. You know, we certainly agree with that effort in expanding that program. A lot of our business members will benefit from that. But as far as the public option, we certainly just, I guess, principally and philosophically just disagree with you. You know, the widespread assessment, we at least want the committee to consider the potential impact on, you know, small, large, and individual market premiums. You know, we don't really have a position on the Medicaid expansion or the undocumented expansion.
Okay, that's what I was wondering, because, you know, I think for all of us, and I'm sure for many of your members, and I know particularly, you know, for women-owned businesses and minority-owned businesses who have been particularly hard hit during all of this, we know that the majority of our uninsured, you know, are individuals in communities of color, and primarily women who have lost their jobs or have really been cut wages, you know, in many of our businesses. And so, you know, I think for many of us, you know, the question of equity and how racial justice is a part of this solution is critical. And so in the solutions you're imagining, how is that a part of the solutions that you all would imagine that we consider for really creating more affordable options?
Yeah, so, you know, I don't have the exact number, but a sizable number of our members are owned by minorities and women, and we certainly champion that. We're an all-inclusive organization here. I think when we talk about expanding Medicaid, you know, Connecticut has one of the best Medicaid programs in the country. It really is a model for the rest of the nation. I think that's a testament to the folks on this committee, on the Human Services Committee, you know, to our Department of Social Services and our previous administration after expanding it. And certainly, I think we would be willing to have conversations about how we can expand Medicaid. Specifically under this bill, I think it aims to expand Medicaid Part A, as well as the MedConnect program as well. But really, I mean, you know, we're looking at global solutions here. We're looking at reducing premiums for the widest amount of people as possible. You know, we're looking about improving and building on the Affordable Care Act. And I think all of those things go to that issue, Representative.
Yeah, I certainly just hope, yeah, we can kind of keep kind of clear these goals for all our businesses and those that have suffered the greatest. And also, again, who is the majority of the uninsured. So, you know, if you have an opportunity to be open to the Medicaid expansion and serving undocumented individuals, I think that would serve our state well. So thank you both for being here.
Yeah, and that's, you know, we're not shutting the door on that. We want to be available to work with you on whatever package that we can come together around. You know, CBIA is not the organization to know this year. There's too many demanding issues that the economy demands of us, that this health crisis demands of us, and we're here to work with you, Representative. So I hope we can keep an open channel of communication going moving forward.
Thank you, Representative Farrar. Senator Anwar.
Thank you, Madam Chair. Thank you so much for being here. Thank you for your testimony. I wanted to ask you guys, for your board, for your CBIA, what is the percentage of the board members who are in a are of a small business background, like less than 50 employees?
Less than 50? I'd have to get you that number, yeah. Senator. I mean, it's probably more than half of our board. 95% of our members are under 100. I believe 87% of our membership is under 50. So the vast majority, you have to be a member in order to be on our board. So the vast majority of our board and our membership is under 100 and quite a few under 50.
Okay, when I looked at the list of your board, it didn't seem like that. There are smaller groups, but it did not appear like that. The other part was, how does one become a member? They
join. We're a dues association. So they would just, decide to join CBIA, either paying through our mission, which is advocating for economic growth and competitiveness in Connecticut, or certainly they could want to join because they want to benefit from some of our member programs, whether it's our health insurance, property and casualty, membership discounts, energy, workers' comp. We provide a lot of programs offerings for businesses to lower their costs and remain competitive.
Okay, and do you have an understanding of how many of your member companies have employees that are Ellis employees?
I don't have that number off the top of my head.
Okay, well, this is a fastest growing segment.
I'm sorry, Senator, you're breaking up a little bit.
Sorry, you know what Ellis is, right?
Yeah, you were breaking up. I couldn't hear you. I'm sorry. Yeah.
Okay, so this is the fastest growing segment in our state. And these are all employed. So statistically speaking, they are individuals employed by your members, which means that the way the employers have set up a mechanism that they have employees that are working full-time, but they're not even able to afford a single meal at a restaurant once a month. And of course, I mean, as credible and committed you are for the business industry, the businesses are only as good as the employees are. I mean, that's like basic 101 on the business end. So I know that the board is very set towards the top positions, and that makes it look very nice that it's a powerful group. But the power of the executives comes from the people. And if you do not connect those things, then they are living in two alternate realities. So I would, and that's where I believe CBIA has a very big responsibility, a moral responsibility and a sustainable responsibility to make sure that your members, because your members are the executives, the people who are working are not your members, unfortunately. But if the people are left behind, the industry is going to suffer long term. And then that's where we have to have an investment in the people. And if you look at the new businesses, which are smart, and this, I'm just for the most part, but the fact that when a new industry comes, they look for the workforce before they look for anything else. And what I see is that having an effort into the workforce and the quality of life of the workforce and their health and their personal life sustainability is going to be critical as an ingredient for the business industry. And I think that's where at times I sense that the CBIA is at a different frequency and not interacting with the people on the ground. Because every single workforce related bill, you guys have officially been against. And when I talk to you, you agree with it in private at times, but then when I look at your readings and I say, oh my God, is it the same people? And I get confused because when I interact, you guys are such kind and nice and smart people. But then I look at your documents and then the secondary conversations from the executives, and I say, I don't know what is true or what is not. So I'm just sharing because this is a good opportunity to share my concern, because every single bill that I worry about for the Ellis community, the people who are voiceless, the people who are working full-time, I see CBIA not coming in and saying, yes, we are with the workforce. And I just want you to please consider that, because your executives, if they tell you that we are only interested in our bottom line and not in the workforce, you have a responsibility to educate them that their industry is dependent on that workforce and the well-being of that workforce. And I believe this bill is a step in that right direction, even though imperfect, but it's still a step in the right direction to try and address that. So, and again, I've said quite a bit right now. And these are philosophical aspects, and I'm hoping that maybe I'll be able to get into your hearts, not necessarily the minds, but the hearts at least.
Well, if you don't mind me responding to that, Senator Edmore, I mean, we haven't met yet, and I've been here since August. I can tell you, I ran a family-owned business and grew from 40 people to 150 people over 18 years. You could call any one of my former employees. I have a great relationship with them. I have probably met more small business owners than anybody who's been before you today. Thousands in my 18 years of running business, friending companies. They treat their employees like gold. What you said is absolutely true. The business is only as good as their employees in the workforce. And I'm proud to say in Connecticut, we have some of the greatest businesses because we have the greatest workforce in the world. So I believe CBIA does bridge that gap. A lot of the benefits we offer aren't for the employer, they're for the employee. They're for the employee to spend less on property insurance, auto insurance, to have a healthier life through a wellness program. So a lot of our benefits are actually geared towards the employee because the employer wants to have happy and healthy employees. The employers in Connecticut really care about their employees. And I could say the employers in Connecticut do that more than many other states. I ran businesses in Seattle, in California, and in France. I didn't see that love, that compassion, that embracing of the employees like I see here in Connecticut. So I would be happy to talk further about that one day. I believe CBIA does bridge that gap.
Look, CBIA, when they look at my score, you guys evaluate everybody, and I don't score very well because I work for the people, and I don't work for the executives, which is fine. I take that but you're new, so maybe there's going to be a culture shift that may happen, and the time has come for the rest of the world is waking up to it, and it's about time we do it as well. The second question I wanted to ask you was, look. I have a master's in public health. I do public research at times, and I've been involved in some of that aspect. You ask a question in a manner to get the answer that you want. If people want to do this. So when I see your study saying that 69% of I guess your businesses that are connected with you, they are opposed to a public option. I would love to know how that question was asked, because you're not in your website, it doesn't say that, but I just heard you say 98% of the people are not happy with the way the healthcare costs are, which was interesting because that's something that should have been mentioned in your website as well. Maybe I missed it, but when you say 69% of the people are opposed to public option, that tells me, how was that question as asked? It was, and that maybe give us a glimpse what answer you were going to get or you're looking for. Because when I interact with the businesses in my community, they are really worried about healthcare. They're really worried about the cost of healthcare. And then they're looking at all options, and they're really not married to any idea. They just want to make sure that their workers are taken care of. But then I look at your website and say, oh, well, almost 70% people don't want this. And I say, wow, this is amazing, because we are completely indifferent. And then I say, okay, maybe none of the people that I'm interacting with are part of CBIA, but then you claim to be there too. So it's really confusing, but I thought I'd just put this there as well, because that is giving a wrongful perception to people that there is no healthcare problem.
Well, I did say, Senator Anwar, in my testimony, but it's also on our website, 2 paragraphs down from the 69%. It says 98% of CBIA small businesses surveyed that they were very or somewhat concerned with rising healthcare costs. It's right there on our website, just a couple of paragraphs below the 69%. And I even put it in my testimony as well. Healthcare costs are a major, major, major issue for Connecticut businesses, small businesses, medium and large. And we need to address it. And as Wyatt said, we're here. We're not just here to say no. We're here to offer alternative solutions and work with you all. And there are some really good alternative solutions. We can and we have to lower the cost of healthcare.
So, and if your board, which obviously is the one that controls the organization, has executives from the insurance industry who have been very clear where they stand, what are the chances that you are going to say, you know what, public option is a reasonable option?
95% of my membership is under 100 employees. 87 is under 150. Yeah, it's under 50 employees. Do you think I'm going to win? This is the 95% of my membership or 5% of my membership? I'm going to listen to the 95% of my membership that's under 100 employees. We are here opposing this on behalf of the small business community, not the health insurance.
No, but I thought the board governance is from the board, right? Or it's different governance?
No, our board does govern us. Yes, our board is here to govern us. But
and
as I
the
said in my
board
testimony,
governance has executives of the insurance industry, right?
yes, some of the insurance industry on our board, some of manufacturers on our board, some of professional services on our board, construction industries on our board. We have a very diverse and robust board.
I know. So, and that's what makes it a little tricky. Again, I understand how these big groups work, but I want you to keep that in mind that I look at your studies with a little bit of skepticism because no board is going to say that where their own business is going to be impacted, because it's all about protecting the business. And end of the day, that's why CBIA is about. And I respect that. I understand that, and it's necessary. It is and I'm interested in the balance, and that's what my interest is. And I think the balance is not there right now because if you look at the statistics of the ALICE community, that is increasing. If you look at the number of people in the last 10 months, what has happened, the entire thing has shifted in a direction where we cannot afford to have business as usual any longer. And that's why we have to start thinking of options and real options, and then present real solutions going forward. So again, I truly appreciate the opportunity to talk to you. I was getting like sleepy and tired, but as I heard your testimony and I'm just awake again now, I'll be up all night. So thank you so much. Thank you for your testimony. Thank you, Madam
You're
Chair,
welcome.
for the opportunity.
Thank you, Senator.
Wyatt, thanks for coming here tonight so late. We really appreciate you spending all this time with us. Thank you.
Thank you, everybody.
Michael Goldstein is next on the list, and I don't see that name. Nicole Bongiovanni, Elizabeth Frazier, Dan Flug. Did I say your last name right, Dan?
It's Flug. Hi, everyone. My name is Dan. I support SB 842. I want to give my quick background and then offer one suggestion for the public option bill. I'm a CPA, chartered financial analyst, and I have an associate in reinsurance designation. I work for a small business in Westport. I have a wife with a pre-existing condition and 3 young children. My Anthem Blue Cross Blue Shield fully insured annual premium is $33,800, or just over $2,800 a month. Even at that cost, the plan is a high deductible plan at $2,500 per individual. Basically, anyone at my company who can buy insurance through their spouse at like a government job or large employer does so. Every year, as you know, the premiums go up while at the same time the coverage gets worse. For example, an ER visit a few years ago was only a $250 copay, but now an ER visit, you have to meet your $2,500 deductible first. I work in finance, and I do believe free market capitalism is the best path forward for most industries. However, as we heard tonight, health insurance has gotten completely out of whack. So I do support a public option. The one suggestion I would make is for the bill to ensure that small businesses and nonprofits can obtain a disruption report from their current health insurer. A disruption report shows all of the providers being used by the policyholders. So you can then compare bids and see if the doctors would be in network under a potential new health insurance plan or this public option. We tried to shop our Anthem plan last year and requested the disruption report, and Anthem withheld it from us since they are not required to provide it to small businesses under current Connecticut general statutes. I believe this is anti-competitive, and you guys should address this. Thank you very much, everyone, for your time.
Dan, thank you. And thank you for that great insight on the disruption report. I would like to pass it over to Representative Meskers.
Dan, I want to request that you personally reach out with an email. I think it's worthy of having some further conversations about the entire industry. And given your background, I think you could be a valuable resource to us, okay?
Will do.
Thank you much. Meskers, M-E-S-K-E-R-S, State Rep, and out of Greenwich, the 150th District. Okay, thank you much. Thank you, Madam Chair.
Senator Wong.
Thank you, Madam Chair. And I didn't have Dan on my list, but I believe I know Dan, right?
Hi, Dan. Yeah, hi, Tony. Yeah, I'm a big fan of yours.
Well, I am very eager to also follow up like Representative Mesker to get some more information. And these are issues that we're looking to address. And I couldn't resist, even after a long day. I was so happy to see you, and I just wanted to say hello and thank you. My best to the whole family.
Thank you, Tony.
Madam Chair.
With my health insurance issues, I worked with my state rep, Adam Dunsby. I didn't want to bother you too much, but I do appreciate everything you're working for, and hope to speak to you soon.
Absolutely, my pleasure.
Dan, thank you so much for coming tonight and spending this late hour with us. We appreciate your testimony. Demeen Davis.
Representative Wood? Chairman Wood?
Yes.
You jumped over Elizabeth Frazier several times.
No, I called her.
She was here.
I'm right here.
Okay, Elizabeth, you are up. You were after Nicole, so I just didn't hear. So I apologize, and why don't you go for it?
Thanks. Not a problem at all. And good evening, Representative Wood and Senator Lesser and members of the committee. My name is Liz Frazier. I'm here today representing the Connecticut Association for Human Services. And CAUSE supports Senate Bill 842, which we believe offers a thoughtful, multi-layered solution towards greater health equity. And passage will advance family economic stability and will impact the future of many marginalized families and children throughout our state. Much of what I've had to say has already been discussed, so I've sort of changed my notes around. But for the last comments of the night, for myself, I would like to bring it back to families that really need the insurance and just can't afford it. Do I pay my rent or do I pay for health insurance? Can I finally afford insurance, or should I put safe tires on my car? And these are the decisions that working parents are making every month. Pre-pandemic, 46,000 parents didn't have health insurance. This is pre-pandemic. The necessity of foregoing health insurance impacts not only their own personal health, but children's well-being is closely tied to the well-being of their parents. And it's really important to remember that the impact that the stress from not having health insurance, as we've heard tonight from so many stories, that stress goes right to the children. When parents are not healthy, they have a harder time taking care of their children. Uninsured parents are less likely to bring their own children to the doctor, even when the child is insured. Ill health can run up debt for both medical costs and lost wages from being ill, making it difficult to support their children. And the family stresses all contribute to the environment that children are living in. And this can have very long lasting consequences. We're not just looking at one generation here, we're looking at two. As I look at Senator Lesser and his new little baby, 2 generations, right? Our family affects us. So in regard to Husky A, with 47,000 parents not having insurance, for many of the parents in that category of Husky A, there is no other affordable health insurance options for parents. Additionally, we're also very concerned that as the minimum wage is increased, we know that Husky A is at the present eligibility level, is one of the first benefit cliffs that will affect enrolled families. Raising it to 201% will help to ensure that families don't fall off this cliff without affordable options. The other thing I'd like to say about this is that many of these families are working, well, in Connecticut, 25% of children live in a family where there is no job stability, meaning that no parent in that household has full-time year-round employment, but they're working. 25%, 38% of Black and Brown children are living in those families. Those are the families that are part-time workers often that are not getting health insurance. And that is just a huge discrepancy. And so many of those families, their hours shift, they just don't know from week to week what their hours will be, or sometimes from season to season, and they never really know when they're going to fall off that cliff. So it's really important to take that into consideration. The childcare industry has been brought up as an example of benefit of those that would benefit from a public option. These folks, as you've heard, are very low wage, but they've also been working since the beginning of the pandemic in difficult situations where they've been getting sick and afraid of being ill. And many of them don't have insurance. So it's really important. They're not the only industry, but the childcare industry is hurt. And there are many others also that have these unpredictable schedules or that are low wage workers that have been working throughout the pandemic. And finally,
Elizabeth, you've hit your 3-minute mark. So if you just want to,
wrap
add
it up.
some closing statements.
I would be happy to. What we've found is that the pandemic has exacerbated the dire need for additional affordable insurance, and it's illuminated the systemic inequities in our healthcare system, exposing chronic injustice that has disproportionately impacted families of color. We believe this bill will provide some relief to many hardworking Connecticut families who have been able to access affordable insurance, and is a step towards rectifying some of the health inequities that have contributed to historically lower healthcare outcomes in Black and brown populations. Thank you very, very much. I really appreciate the time.
Thank you, Elizabeth. Appreciate you coming on so late. Any questions from the committee? Thank you.
Thank you.
Okay, so I apologize if I skipped anyone else, but following Dan, I have Jameen Davis, Summer Kim, Camilla Guza Chavez. I thought I saw her name on here. Yeah, Camilla, you're on next.
Hi, yes, thank you so much. And thanks for still being here and creating the opportunity for all of us to speak. I'm Camila Guiza Chavez. I'm from New Haven, Connecticut, and I'm involved with the Semilla Collective, and I support SB 842, an act concerning health insurance and healthcare in Connecticut. SB 842 will make healthcare equitable, dependable, and affordable by creating new public options for health insurance in our state. As a young woman from California building a life in New Haven, I've always considered myself lucky. I came to Connecticut to attend Yale, where I graduated in 2019. And during my time here in college, I had the privilege of meeting community organizers in the immigrant justice movement here who inspired me and motivated me to stay and continue working here and building a life for myself after graduation. I'm lucky that I've been able to keep my job during the pandemic. I work at a nonprofit cafe, a small business in downtown that seeks to support and build power with immigrant and refugee women here. We currently work with women from Arabic and Spanish-speaking backgrounds who work with us for 6 months in our cafe and attend a range of classes. And our long-term goal is to be an organizing space and cultivate our community's capacity to mobilize itself. I'm still under 26 and my parents have jobs that provide health insurance benefits in California. So if I need to, I can schedule a video call with my primary care doctor in California and can be prescribed medicine that I can pick up at a nearby pharmacy. And yet I'm, as someone living comfortably with a stable job and no dependents, I can't access a doctor in the state of Connecticut. Although I've needed to in the past year. A year ago, I needed care for a small injury, finger that I jammed, and tried going to a local health clinic, but was told it would cost me hundreds of dollars out of pocket that I couldn't pay. I went to a CVS Minute Clinic and was told similarly it would cost hundreds of dollars out of pocket, which is not an option for me. And it was a simple injury, but without proper care, it's permanently disfigured. And I would have had to fly myself to California to get care that I could afford. My income places me above the poverty line, so I don't qualify for Husky, but the monthly cost of private health insurance for me is nearly half of what I pay in rent. So I'm sharing my experience with you all today to just add my drop in the ocean of stories you've heard. But a key part of my experience that I have to share is that I have friends and mentors who can't access any healthcare at all because they don't have a social security number. And this makes no sense to me and is why Husky expansion needs to pass. It's nothing less than a crime by the state to categorically exclude any group of people from healthcare and to allow private health insurance companies to do the same. And the pandemic should show us, if nothing else did, that our health and well-being is interconnected, as someone shared before me very wisely. Protecting the well-being of a community means ensuring that every individual is cared for and has access to care. So I support the bill for Husky expansion and the public option because I believe healthcare is a human right. Every single one of us deserves to know that if we have an accident, if we catch the virus, or if our human bodies ail, as we do, that we will be supported. So I urge the committee and Connecticut lawmakers to support the bill. Thank you so much for your time.
Thank you, Camilla. I appreciate you coming out so late. Any questions for Camilla from the committee? Thank you. Robbie Goodrich is next, followed by Sophia Ditka. Robbie, just unmute yourself and you're ready to go.
Yes, good evening, members of the Insurance and Real Estate Committee, Madam Chairwoman and Chairman Lesser. First, I want to hold up this idea that this process that we go through every session here in Connecticut, especially this year, is very unhealthy. And it's so inaccessible. This has been exhausting. And I'm hoping that we work together to reform this process so it becomes more healthy and accessible for all those involved, including the elected officials. Now, most of the opposition tonight has been fighting for the health and welfare of corporations and profits. And it's been so distinctive in their claims that SB 842 is not healthy for the state of Connecticut. And most of the folks like myself supporting it are fighting for our friends, our families, the people in our community. That's not missed on me tonight. It shouldn't be missed on the members of the committee as well. So I live and work in Waterbury, Connecticut. I'm the executive director of a small grassroots organization called RACE. We fight for racial justice in our schools. I'm a father and I'm a son. And for years, I've had premiums for health insurance that have ranged from $300 per month to $800 per month. The coverage has changed drastically, and so has my options for primary care physicians, cost of copays, and out-of-network costs for the care I need. The access to high-quality and affordable health care on a consistent basis has wreaked havoc in my life, both financially and emotionally. Now, as the leader of a nonprofit organization, I've spent days, weeks, months trying to raise enough funds and win enough grants so that folks we work with can at least have the option of having health care. We simply don't have the financial flexibility to pay folks a living wage and offer them health care coverage without bankrupting our organization. This means we work long hours during the dangerous work of anti-racist education activists and advocates without knowing how our colleagues will be able to support their emotional welfare or get treatment for physical maladies after they become ill, despite their efforts to fight for the lives of folks in our communities. This is one of the ways that systems of oppression can kill us with impunity or bankrupt us. This is not fair and it's not just. Now, healthcare is a racial justice issue, especially here in Connecticut, and access to affordable, high-quality care is a fundamental human right. And despite that, tens of thousands of Connecticut residents struggle daily with decisions to either pay rent, pay for groceries, pay for transportation to and from work, or getting the proper medical treatment for depression, diabetes, heart disease, or getting their teeth cleaned, or having the proper exams done to prevent diseases such as cancer. Again, this is not fair, and this is not just. Now, I must acknowledge that the public health crisis caused by COVID-19 is a primary reason why a public option is just not good politics. It's the moral as well as ethical decision to make. Now, these are only some of the reasons why you must support SB 842. This legislation saves lives. This legislation supports an expansion of economic stability. And finally, this legislation protects and preserves families here in Connecticut. So I urge you to support SB 842, get it out of committee, and get it approved and voted for as soon as possible. Thank you again.
Robbie, thank you very much for your testimony. I apologize if I have all these dings going on back here. Any questions for Robbie from the committee? Robbie, thank you for waiting so long. I'm sorry that it was such a tough situation for you. We had hoped that on Zoom we could make it more accessible for people, but would love to hear your thoughts on how we can improve it. Next up, we have, I don't see Sophia on here, but I do see Evelyn. Evelyn, you're up next.
Ok, buenas noches a todos.
And Madam Chair, I'll be interpreting for Evelyn.
Estimados miembros del Comité de Seguro y Bienes Raíces de la Asamblea General de Connecticut, mi nombre es Evelyn Majano Montiel. Vivo en Bridgeport, Connecticut. Soy miembro del colectivo Semilla y Apoyo ASB 842. Tengo 45 años.
Dear members of the Insurance and Real Estate Committee of the Connecticut General Assembly, my name is Evelyn Majano Montiel. I live in Bridgeport, Connecticut, and I am a member of the Semilla Collective, and I support SB 842. I am 45 years old.
Vivo en Bridgeport y soy propietaria de una casa. Trabajo como proveedora de cuidado infantil y gano alrededor de $1,200 por mes. Hace 4 años a mi esposo,
sí.
Hace 4 años a mi esposo le diagnosticaron gota. Una mañana, después de tomar su medicamento para la gota, se despertó con un dolor extremo en su espalda y cuello completamente estorcidos.
So I live in Bridgeport and I am a homeowner. I work as a childcare provider and I make around $1,200 per month. 4 years ago, my husband was diagnosed with gout. One morning after taking his gout medication, he woke up with extreme pain and his back was completely crooked.
Pasó de centro de salud comunitario a centro de salud comunitario. Durante todo esto no pudo pararse y tuvo que caminar con muletas. Vio a muchos médicos especialistas. Como no tenía seguro médico, mi familia pagó de su bolsillo. Ellos iban desde neurocirujanos, urólogos, especialistas en espalda, acupuntura y fisioterapia.
So he went from community health center to community health center. During all this time, he was not able to stand and had to walk with crutches. He saw many specialist doctors, and since he had no insurance, my family paid out of pocket. They ranged from neurosurgeon to urologist, back specialist, and acupuncture and physical therapist.
Tuve que pagar $3,000 por una tomografía computarizada, alrededor de $1,000 por análisis de sangre. Cada visita a los especialistas oscilaba entre $200 a $500 por visita.
I had to pay $3,000 for a CT scan, about $1,000 for blood work. Each visit to the specialists ranged from $200 to $500 per visit.
Finalmente, un neurocirujano diagnosticó a mi esposo con una hernia de disco y ordenó una cirugía. Como no teníamos dinero, el hospital nos dijo que teníamos que pagar alrededor de $50,000 de nuestro bolsillo para la cirugía. Fuimos al banco para obtener un préstamo contra nuestra casa, pero fue rechazado.
Finally, a neurosurgeon diagnosed my husband with a herniated disc and ordered a surgery. Since we had no money, the hospital told us that we had to pay $50,000 out of pocket for the surgery. We went to the bank to get a loan against our house, but it was declined.
Finalmente, el hospital de Bridgeport, con ayuda de un trabajador social, accedió a realizar la cirugía, pero nuestra familia pagaría $40,000 de nuestro bolsillo en un plan de pagos.
Eventually, Bridgeport Hospital, with the help of a social worker, agreed to do the surgery, but that our family would have to pay $40,000 out of pocket and in a payment plan.
En total, mi esposo no trabajó durante 1 año y medio. Mi familia pagó el hospital tanto como pudimos, sabiendo que debido a esta gran deuda podríamos perder nuestra casa.
Altogether, my husband did not work for a year and a half. My family paid the hospital as much as we could, knowing that because of this large debt, we could lose our house.
Tuve mucha ayuda de familiares y amigos que nos ayudaron con comida y préstamos para pagar el cuidado de mi esposo. Todavía le debo a un amigo alrededor de $3,000.
I had a lot of help from family and friends, which helped us with food and loans to pay for my husband's care. I owe my friend $3,000.
Durante la pandemia seguí trabajando en la guardería de mi casa, cuidando a los niños desde temprano en la mañana hasta horas tardes de la noche. Continué trabajando durante toda la pandemia.
During the pandemic, I kept working in my home daycare, taking care of kids from early morning until late at night. I continued to work throughout the pandemic.
No soy la única persona indocumentada que está pasando por esto. No es justo que no podamos acceder a la atención médica. No es justo que mi esposo haya tenido que sufrir durante meses y que le debamos miles de dólares. Insto a este comité a que apoye este proyecto de ley. Gracias por su tiempo. Evelyn Majano Montiel.
I am not the only
Evelyn, can I just interject for a sec? I have let you guys go far beyond the 3 limit because I know there's 2 of you speaking, but could you get to a point where you can start to wrap it up? We do want to hear your story, but I can't let you go on, more than everybody else.
Sure. Yeah, and this is in closing. So the last thing that Evelyn said is that I am not the only undocumented person that is going through this. It is not fair that we cannot access healthcare. It is not fair that my husband had to suffer for months and that we owe thousands of dollars. I urge this committee to support this bill. Thank you for your time. Evelyn Majano Montiel.
Evelyn, thank you for sharing your story and staying up so late to share that with us. We really appreciate you being here tonight. And Luis, thank you for interpreting for us. Do we have any questions from the committee? Thanks to you both.
Thank you.
So I see that Summer has come on, but I'm going to go to Constanza Segovia, since she has been on longer, and then Summer Kim will be next.
Hello, thank you for being on this for this long. I know everybody's tired. I sent in my written testimony, so I will keep my remarks short. Members of the Insurance and Real Estate Committee, I'm just here to urge you to not leave the undocumented community of Connecticut out of this bill. We know that there's a lot of details that will continue to be negotiated and you will go back and forth on a lot of things. And I just want you to please prioritize creating a structure so that undocumented people in Connecticut who are residents like everybody else have access to at least something that can be a way to get coverage for their healthcare needs. Like Evelyn just mentioned, her story is something that we experience in our community constantly. I am part of the Hartford Deportation Defense Collective in Hartford, and this is, hundreds of people in our community around the state that have very similar stories, thousands of dollars in debt, life-changing care that is not, that they don't seek because of the financial constraints of what that might imply. This is working people. This is the parents of kids in our schools. This is human beings that need to be taken care of like everybody else. So please, I know there is, a part of this bill that would create a subsidiary that would make it so that undocumented people have access to some coverage. I know it is not a perfect solution, but it is an important first step to get relief for our community. We hope that it is a first step and that we can continue to work together. And we are here to, support you in that work and to work with you as a community so that we can get to a point where everybody in Connecticut and the United States has access to equitable, affordable, dependable healthcare without any discrimination based on any variables, including the many identities that people hold and their immigration status. So thank you very much. And yes, in support of Bill SB 842, and please keep the undocumented community of Connecticut in mind.
Constanza, thank you very much for your testimony tonight and doing so late in the evening. Really appreciate it. Any questions from the committee? Last but not least, Summer Kim, thank you for being here. You're up.
Hi, everyone. My name is Summer, and I've been living in New Haven for about 7 years now. I'm a fundraiser at a local nonprofit called All Our Kin, which focuses on early education and family childcare. And I am in support of SB 842. I truly believe that every one of us deserves affordable and quality health care just because we are alive and for no other reason. As someone who struggles with mental health, I have often experienced bouts of depression and anxiety that have made showing up to work every day almost impossible. But because the healthcare that I rely on to treat my illnesses was tied to my employment, I was facing this kind of catch-22 every day of either attending work at the expense of my health or not attending work and losing my access to healthcare. A public option, I think, would provide so much stability and peace of mind for me and many others like me, knowing that no matter my employment status, I will be able to depend on my healthcare. And particularly in the context of COVID, when so many of us have lost our jobs, and while so many others have risked their lives at their jobs every day, Connecticut residents need and deserve access to high quality and dependable mental and physical health care now and moving forward. As a matter of equity, evidence shows that Black, Latinx, and other people of color are disproportionately affected by the pandemic. And I believe we have a moral responsibility to support every member of our communities, particularly those who have been most devastated by COVID. Ultimately, the implementation of a public option will improve our workforce by enabling a vast number of underprivileged Connecticut residents to obtain and maintain a level of health that will better support us in stable employment. So I urge the committee to support SB 842. Thank you for your time.
Summer, thank you. And thanks for hanging out so long to give your testimony. We really appreciate it. Any questions for Summer? Well, I want to thank the committee for hanging out so long. This was a long hearing, and there are so many of you spent the whole day with us. Sam spent the whole day with us too, which is great. He was an active member of the committee today. I think he looked like he was having a blast learning government. So do we all night? Do we adjourn, or do we just, what do we do, Senator?
We can adjourn. I just want to say though, if I can have a moment of indulgence, this is the first public hearing you've ever chaired, and you did it for almost 13 hours, and I think that's pretty impressive. And so congratulations, Representative Wood. You make it look easy.
Yeah, thank you. Oh, stop, you guys make it easy. So, and Al made me lots of cake, so that helped.
Sounds good. And we will be having a committee meeting and a public hearing on Thursday. So that's our next
correct
committee business.
Yep. So we will be seeing everyone at 9 on Thursday.
So see if we can do 15 hours next time.
Yep.
That's not funny.
Everybody.
That's
Have
not
a wonderful
funny.
evening.
That's
Sorry,
not funny.
I want to thank the chairs for a great committee meeting. You know, I think it was very passionate, and we heard a lot of different views. I want to thank everyone for being at the table and paying attention and listening to, I think, what is a fundamental, deep, and difficult concern for all of us. So thank you very much.
Thanks to everyone that made it happen too, Diane and team. Zoe, thank you. Bye, everyone. Good night.
Thank you. Good
Well
night.
done, Madam Chair.
Good night. Thank you.
Good night.
Good night.
Good night.